ladies and gentlemen. A very good morning to each one of you. I, Dr. Shweta Kanikar, am deeply privileged and honored to extend a warm welcome to each one of you on this momentous occasion as we gather today for the Model District inaugural workshop under the Ayushman Bharat Digital Mission. In line with the vision of our Honorable Prime Minister Shri Narendra Modi ji of building a digitally empowered India, initiatives like the Ayushman Bharat Digital Mission are paving the way for transformative changes in the healthcare sector. By harnessing the power of technology, we aim to create a more connected, accessible, and efficient healthcare ecosystem for every citizen. The Ayushman Bharat Digital Mission envisions an integrated digital health ecosystem through Aadhaar IDs, health records, healthcare professional registries, healthcare facility registries, and interoperable digital systems where every citizen can seamlessly access healthcare services through secure digital platforms. This workshop is a step forward in realizing that vision, bringing together key stakeholders to deliberate, collaborate, and accelerate the implementation of digital health initiatives towards establishing a model district. Today, we also celebrate National Doctors' Day. I take the opportunity to express our sincere gratitude and best wishes to all our doctors for their dedication, compassion, and selfless service to the society. Happy Doctors' Day to all the doctors present here and to the entire medical fraternity. This makes today's event even more significant as we celebrate both the spirit of healthcare and the advancement of digital health services. Ladies and gentlemen, as we navigate through the proceedings of this event, I request Madam Dr. Rupa Naik, Director, Directorate of Health Services, to kindly guide the dignitaries to the dais. I'm delighted to take this opportunity to introduce and extend a heartfelt welcome to our distinguished dignitaries, whose presence today is a true honor for us. Your participation adds a special dimension to this occasion, and we are grateful for your time and contribution to this significant milestone. We have the honor of hosting a person of great stature and accomplishment, Dr. Sunil Kumar Barnwal, IAS Chief Executive Officer, National Health Authority. Dr. Sunil Kumar Barnwal is a distinguished 1997 batch IAS officer of the Jharkhand cadre. He holds an engineering degree and a master's in public policy from the National University of Singapore and Harvard University. With over 21 years of extensive experience, his career has spanned various key roles within the government of Jharkhand, including serving as Secretary for the Department of Industries, Mines and Geology, and as Secretary to the Chief Minister. His contributions cover a wide array of sectors, including education, IT, industry promotion, energy, natural resource management, and governance. Currently, Sir serves as the Chief Executive Officer of the National Health Authority under the Ministry of Health and Family Welfare, Government of India. Let us express our gratitude and welcome Dr. Sunil Kumar Barnwal with a huge round of applause. I request our State Mission Director, Shri Atindra Maralkar Sir, to present a floral bouquet and a memento as a token of our heartfelt respect and appreciation to Sir. Next, I would like to welcome Shri Yatindra Maralkar, State Mission Director and Health Secretary, Government of Goa, whose exceptional leadership in public service and commitment to the well-being of our community has left an indelible mark. Sir has always been cooperative and supportive of our health and innovation proposals. Your presence, sir, adds an exceptional luster to this momentous occasion. I request our director, Dr. Rupa Naik, State Nodal Office, to present a floral bouquet and a memento as a token of our heartfelt respect and appreciation. I also extend a warm welcome to our very own Dr. Rupa Naik, Director of Health Services, Kampal. Your presence adds a touch of distinction to our gathering, and we are truly honored to have you here, madam. I request our State Nodal Officer, Dr. Kedar Raikar, sir, to present a floral bouquet and a memento as a token of our heartfelt respect and appreciation. I now take the opportunity to extend a cordial welcome to Dr. Pankaj Kumar Arora, Director, National Health Authority. Dr. Arora is a senior public health professional with over 20 years of experience in designing, implementing, and leading large-scale health programs in India. Sir holds a MSc in Global Health Policy from the London School of Economics and a MS in Surgery. He is also a member of the ISQA Academy of Quality and Safety in Healthcare and has authored multiple peer-reviewed publications on public health and clinical medicine. Dr. Arora has also served in the Indian Railways Medical Service, where he introduced digital health solutions and has led strategic hospital management reforms. He has also collaborated with a wide range of stakeholders, including Ministry of Labor and Employment, Ministry of Home Affairs, Ministry of Social Justice and Employment, and Ministry of Road Transport and Highways, and has fostered partnerships with international agencies to advance India's universal health coverage agenda. Currently, he is serving as a director in the National Health Authority, Government of India, and he plays a key leadership role in advancing the Ayushman Bharat digital mission and onboarding and integrating central and state government health programs into the ABDM ecosystem. I request Shri Yatindra Maralkar, sir, State Mission Director, to present a floral bouquet and a memento as a token of our heartfelt respect and appreciation. Next, we have the honor of hosting Dr. Piyush Singla, who is also an IS officer of EGMAT Cadre 2012 batch. He has served in the UT of Jammu and Kashmir for the last 14 years in various administrative capacities. Academically, he is an MBBS postgraduate diploma in medical law and ethics from National School, and Masters of Public Health from Johns Hopkins University. Sir has recently been posted as a Director, National Health Authority. Please put your hands together for Dr. Piyush Singla. I request Shri Yatindra Maralkar, sir, State Mission Director, to present a floral bouquet and a memento as a token of our appreciation. It is my pleasure to welcome our State Nodal Officer for Ayushman Bharat Digital Mission, Dr. Kedar Raikar, whose leadership and dedication have been a constant source of inspiration. From the very beginning, he has been incredibly supportive, always making himself available whenever guidance or assistance is needed. His commitment to strengthening digital healthcare and supporting every stakeholder has made a meaningful difference to our team's progress. Please join me in extending a warm welcome to Dr. Kedar Raikar, State Nodal Officer, ABDM. I request Madam Dr. Rupa Naik, Director, Directorate of Health Services, to present a floral bouquet and a memento as a token of our heartfelt respect and appreciation. At this juncture, I would like to acknowledge and warmly welcome all the distinguished dignitaries seated amongst us. Your presence today adds great value to this occasion, and we are grateful for your support and participation in this important milestone under the Ayushman Bharat digital mission. I take this opportunity to acknowledge the presence of Madam Dr. Rajnanda Desai, who is the OSD to Honorable Health Minister. I request Ms. Divya to kindly present a bouquet to Madam as a mark of our appreciation and respect. I also take this opportunity to acknowledge the presence of Dr. Pooja Madkaikar, Director Ayush, and I request Ms. Jemima to kindly present her a bouquet of flowers as a token of our appreciation. I also acknowledge the presence of Dr. Meenal Joshi, Deputy Director Ayush, and I request Ms. Dikshita to kindly present a floral bouquet. Together, we are in the company of individuals whose contributions and achievements inspire us all. Let us make this event memorable by cherishing the wisdom and insights they bring to us today. Our State Mission Director, Secretary Health Shri Yatindra Maralkar Sir, has been a constant source of guidance, encouragement, and support throughout this journey. His leadership and commitment have played a very vital role in shaping this model district initiative. We are truly grateful for his unwavering support. I extend my humble invitation to our State Mission Director, Shri Yatindra Maralkar Sir, to kindly deliver the welcome address. Please join me in giving a warm welcome to our State Mission Director, Shri Yatindra Maralkar Sir.
Respected Dr. Sunil Kumar Barnwalji, CO NHA, Dr. Pankaj Aroraji, Director NHA, Dr. Piyush Singlaji, Director NHA, Dr. Rupa Naik, Director, Dr. Kedar Raikar, State Nodal Officer, all doctors present here, senior officials of the Ministry and Health Family Welfare, distinguished delegates, and dear friends. Namaste, good morning, and warm greetings to all of you on the occasion of Doctors' Day. First of all, I would like to extend my sincere appreciation to National Health Authority, Government of India, for their support in organizing this conference. I would also like to place on record my sincere gratitude to Honorable Health Minister for his continued support towards strengthening the healthcare delivery system in Goa. The healthcare landscape is undergoing a profound digital transformation. The Ayushman Bharat digital mission provides us with a unique opportunity to build an integrated, interoperable, and citizen-centric digital health ecosystem that will improve access, efficiency, continuity of care, and informed decision-making. Today's inauguration of the model district represents another significant milestone in translating this national vision into tangible outcomes at the grassroots level. Since adopting the mission, our state has made steady progress in implementing the key building blocks of the ABDM ecosystem. Our efforts have focused on creating awareness among citizens about digital health, expanding the generation of ABA numbers, integrating both public and private healthcare facilities with digital health ecosystem, onboarding health professionals on, onto the national registries, promoting digital health records and paperless service delivery, strengthening interoperability between health information system, capacity building through extensive training of healthcare staffs. Today, the state has generated around 10 lakh ABA IDs. More than 1,200 healthcare facilities have registered under the Health Facility Registry, and we have 100% registration of public hospitals on the registry. Close to 4,000 healthcare professionals are now part of the healthcare professionals registry. Multiple hospitals and health facilities are already generating digital health records through ABDM compliant HMIS. Overall health records linked are around 5.5 lakhs in the state. We have successfully conducted extensive capacity building programs covering all the districts, health institutions, and frontline healthcare workers. Our digital health ecosystem continues to expand with increasing participation from both public and private healthcare providers. Here I would like to mention that on 29 June 2026, Honorable Union Minister J.P. Nadda ji officially relaunched the Arogya Setu platform as a comprehensive digital health application under the Ayushman Bharat digital mission. The application now allows users to create and manage their Ayushman Bharat health account and to consolidate their medical history in one secure place. During the inauguration at Delhi, I visited the kiosk set up by the ministry, used the Arogya Setu app, and uploaded my test report. I found it very useful and very easy. I encourage everyone to install the Arogya Setu app on their mobile phones and create their own health account to derive benefit from the service. The Model District Initiative marks the next phase of our journey. It will demonstrate how digital health can be fully integrated into routine healthcare delivery, from registration and consultation to diagnostics, treatment, referrals, and continuity of care. The learnings from the district will help us to develop scalable models that can be replicated across the state. The success of this mission depends on the active participation of every healthcare facility, whether public or private. I urge all private hospitals, clinics, laboratories, diagnostic centers, and healthcare providers to become active partners in the digital transformation by onboarding onto the Ayushman Bharat digital mission. I also acknowledge the dedication of our state and district authorities, healthcare institution, ABDM team, technology partners, and every healthcare workers who has contributed to this journey. The inauguration of this model district is not the culmination of our efforts, but the beginning of the next chapter in our digital health journey. Under the able leadership of our Honorable Chief Minister and the constant guidance of our dynamic Honorable Minister for Health, we will continue to provide the adoption of digital health initiative, strengthen service delivery, and build a resilient technology-enabled healthcare system that serves every citizen with efficiency, equity, and compassion. Let us work collectively to make this model district a benchmark for digital health transformation. I wish the workshop a great success and look forward to meaningful discussions and valuable outcomes. Thank you and Jai Hind.
Thank you, sir, for the warm welcome and the brief overview. Your words have resonated with all of us and have set the tone for this event. Ladies and gentlemen, the successful implementation of the Ayushman Bharat digital mission is guided by the vision and leadership of the National Health Authority. It is now my privilege to invite Shri Dr. Sunil Kumar Barnwal, Chief Executive Officer, the National Health Authority, to kindly address the gathering. Sir.
Good morning. Namaskar. Uh, so let me thank the government of Goa, Department of Health and Family Welfare for organizing such a beautiful conference workshop on model digital health district. On this occasion, let me also express my thanks to Secretary Health, who is also MD, NHM, CEO, State Health Agency, and also a State Mission Director of ABDM, for taking the lead for organizing such a workshop. I see the presence of Dr. Rupa Nayak, the Director of Directorate of Health Services, Government of Goa, the State Nodal Officer, Sri Kedar Naikar, and we have the presence of the two directors from National Health Authority, Dr. Piyush Singla and Dr. Pankaj Arora. Both of them happen to be the doctor in National Health Authority. Today is indeed a very important day when we all are working in the field of healthcare. That is the Doctor's Day. So it's a big congratulations and big gratitude to all the doctors present here. Let us give a big round of applause for their service, dedication to this country. So, this day, as it happens to be so important for the healthcare, and happens to be a day dedicated to all those who provide healthcare, the doctors. This day is very important for organizing this event also when we are trying to make healthcare delivery more efficient, more connected, and more intelligent. And that is where we wish to make the hands of doctors much more stronger. They could deliver more, their capacity can be increased, and they should be more efficient in the delivery of the healthcare. So this workshop gets a lot of significance on this particular day. Today, we also see here, besides the presence of the representative from various hospitals, healthcare delivery, service providers, we have health tech companies here who are actually providing software solutions to making healthcare delivery more efficient. So this presence and gathering together makes this event even more important when we are trying to find out how technology as a tool can make healthcare much better, connected, accessible, and also intelligent. So, though most of the time, as many of you are doctors here, will feel their major role is to provide treatment. Their major role is to actually treat the patient, and they are so involved in it that they don't see the tools which can make them more efficient in delivering those treatment. And here is the technology which makes it happen. So somehow, while we are very good in our clinical work, we need to also understand what are the tools which makes our work much more efficient and intelligent. So while technology has provided good tools for better treatment, like you have good radiological machines, you have surgical tools, etc. There are other aspects of healthcare delivery which many a times makes the work much easier. If some tool can do the screening much before the patient comes to the doctor's work gets reduced. If the doctor doesn't have to do anything which is non clinical, administrative, and has become part of the workflow, I think doctor will have more time to devote on the clinical work. So that is the context in which the digital health becomes very important. And we have seen that the countries have actually become more efficient by using technology, not only to providing more effective treatment, also to more efficient healthcare delivery. So this is the context in which National Health Authority, while on one hand implementing Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which is also implemented in Goa for financing the health care for poor and vulnerable population, we have another mandate to implement Ayushman Bharat digital mission to create a national digital health ecosystem. So why digital health is so important in this country? See, the way healthcare is being delivered in India, and all of us are actually user of this healthcare delivery as a patient or parents of a patient, or maybe we see relatives, family members as a patient, and therefore we are all user of the healthcare system. We all see in India the healthcare delivery is highly fragmented, isolated, episodic healthcare, where the time you get sick, you look for the healthcare, and then that episode is over. Next time you start afresh. So there is no connection between what you were treated earlier and what are you going to be treated now, and probably what will be how you will be treated in future. So this disconnect of different episode actually is a big loss in healthcare delivery, because the treatment which is provided is on the same physical body which is actually bearing the earlier treatment now and in the future. So anything happens with the your own body, in whatever form, whichever symptoms you get, whatever medicine you take, antibiotics you have taken, whatever surgery or the treatment has happened on your body, has a implication on the future treatment or the future diagnosis. And this part was completely missing in a fragmented healthcare delivery. Now, this was the situation because we know we are a huge country, highly diverse country, very complex healthcare system, both private, public, a small clinic, big hospitals, a small diagnostic center, big diagnostic center, a small pharmacies, big pharmacies. So it's a huge system with a lot of complexity. And it's very difficult to connect all these systems, and it was almost impossible till we got an opportunity in the form of technology. Now, once we see technology as an opportunity, we are actually seeing a possibility where this all fragmented health system, isolated health system, actually can get connected. They can start talking to each other. The patient becomes the center of the whole healthcare delivery. The whole health records gets linked to the patient ID, and it travels with the patient. So whether patients goes to X healthcare delivery point or the hospital, and next time to Y, the records travels with him. Hospitals also can share the record with the consent of patient. So now this is a possibility with the use of technology, and India is one of the few countries in the world, and in fact many of the developed countries also don't have such system, where we have created a digital architecture in which such different systems can actually talk to each other. And that is what Ayushman Bharat Digital Mission is all about. So when we started the Ayushman Bharat Digital Mission in 2021, it actually it was based on a digital health blueprint which talked about unique identity to everyone who is a stakeholder in healthcare delivery. And who all are they? They are patient, they are facilities, whether it is hospital, pharmacies, diagnostic centers, and they are healthcare professionals, whether it's doctor, nurses, paramedics, etc. So these stakeholders were given a unique verified identity in form of registries, which is health facility registry for all facilities, health professional registry for all professionals, and a patient registry in form of Abha ID, which we call Ayushman Bharat Health Account. So these three registries, and day before yesterday, we also got drug registry launched by Honorable Union Minister of Health and Family Welfare. Just we'll take a pause and then we'll continue.
We are truly honored to have with us today our Honorable Minister for Health, Urban Development, Town and Country Planning, Women and Child Development, Forest and Ayush, Shri Vishwajit Rane sir. Your unwavering dedication to the field of healthcare, public service and innovation is truly commendable. Ladies and gentlemen, please join me in extending a warm round of applause as we welcome our Honorable Health Minister, Shri Vishwajit Rane sir. I request Shri Yatindra Maralkar, a State Mission Director, to present a floral bouquet and a memento as a token of our heartfelt respect and appreciation. Light symbolizes knowledge, wisdom, and progress. May I request our esteemed dignitaries to kindly proceed for the ceremonial lighting of the lamp. Thank you all. I request CEO NHA Sir Sunil Kumar Barnwal to kindly continue.
So I also welcome Dr. Sri Bishwajit Rane, Honorable Minister of Health and Family Welfare, Government of Goa. On behalf of National Health Authority, I welcome you, sir. This is a very important workshop from National Health Authority point of view, because when we are trying to create national digital health ecosystem, we see technology as a big opportunity for all of us to make this fragmented healthcare system to a connected healthcare system. But the challenge is not the technology. The biggest challenge is adoption of this technology. And that adoption requires not the digital infrastructure, it requires more of the change management, capacity building, change of thought and the mindset to use new technology. And that is where this workshop is very important, when we are trying to impress upon all the stakeholders of the healthcare ecosystem to actually adopt digital system to make themselves more efficient in healthcare delivery. This all will happen only if we actually create some of the models in this country. And that is where this idea came to have one model district in each of the states. So altogether, we are going to have 36 model districts where every health facility, starting from a small single doctor clinic to a big hospital, a small pharmacy to a big pharmacy, and all diagnostic centers, blood banks, completely on digital systems. And similarly, we have also envisioned that every district in the country should have at least one public facility and one private facility to have end-to-end digital system. With this vision of creating models in this country, we want to showcase to rest of the districts and the facilities that this is possible in our country. And actually, it has started happening. We have seen in this country itself, in some of the states, some of the facilities have gone completely digital. No longer they use any paper, there is no printer in that health facility. So everything, it actually happens on a by a digital means. Once you register, you just remember your token, and unless you get out of the facility, you don't get anything. And as soon as you are out of the facility, you get everything on your mobile. So this is the power of technology, where anything or everything which happens with you, you keep getting on your mobile. Day before yesterday, as Yatindra was mentioning, that Honorable Union Minister of Health and Family Welfare launched a revamped Arogya Setu app. This Arogya Setu app, you can see there is a poster placed here also. There is a QR code, you can download it. This is going to be what we call Bharat Ka Health app. This is going to be the single application for your health care in the country, where you can get every health services, including your health record, diagnostic, your wellness record. Anything you capture through your smart watches can also be seen there. And not just that record gets created, it makes huge longitudinal records in form of graphs, tables, etc. So you can see how your diabetes level is changing, how your creatinine level is changing. So you can actually do prediction. You can be actually made alerted against the future complications. And that is the beauty of this app. So this app is going to be the single application for every citizen in this country to use all healthcare services. So I also request all of you to download and start using this app, which will not only be used when you go to the health facility. Whatever health records you have or you had in the past, it might be lying in your cupboards or almiras. You may like to scan and upload it, it will be converted into a digital format. So while it is a physical record, also you can convert into a digital record, and it can be chronologically arranged so that you get the longitudinal health record. So this is the application which makes your whole health history on your mobile application. So that I'll request everyone to use it and make it a movement so that everyone starts asking for the future health records in digital forms only. One of the reason why digital health ecosystem is also taking time to build is the demand has also not been created enough, where patients start asking for the digital health record. And that will happen only if we create enough awareness among the people. So with these, what I see Goa has done extremely well. Sir, I must mention to you that Goa is one of the few states in this country which has done extremely well in health facility registry, Abha ID creation, and health professional registry. They are one of the few where 70% of the population has got the Abha ID. So we are very near to achieving the saturation. And once we achieve the saturation, every citizen in this state can have the health record on their mobile app. Similarly, all the health facilities can be on the registry, and all 100% of the public hospitals and facilities are on the registry. Some are in the private sectors are left out. We'll request that they should also come on the registry. Similarly, health professionals, around 65% of the health professionals are also on the registry. That creates an ecosystem where we are ready to take off, and we are ready to move to next level, where all digital health records which gets created get links to the Abha IDs of the citizens. So Goa actually is in much ahead of other states, and that is why we are hoping Goa should become not just the North Goa district, whole state should become the first digital health state in the country. That is the expectation from this state, and I'm sure the kind of leadership is there in the state, it is possible to achieve. The what we need to do now is, with this level at which Goa has reached, we have to do the next step. Next step is to use hospital management information system which is enabled with ABDM in all the health facilities. Similarly, for the pharmacy diagnostic centers. And we have here today the presence of about 10 such integrators who are providing such solutions. These integrators are actually, their softwares are enabled with ABDM, so they are ready to use. We have such integrators already on our portal. Some of them have taken the pain to come over from different parts of the country to actually impress upon you about their facilities. Now it is up to you to select which facility, which software suits to your requirement, and accordingly use it. So this is something which we are trying to actually develop this, so that the software providers and the user actually meet together, and this workshop provides that opportunity to happen. Now coming to the this HMIS, once we start using, and in fact some of our officers did visit today one of the facility in Goa, and we found there was a HMIS system being used, but at the same time, parallelly, the physical system was also being used. That is not a solution to what we are looking forward to. If we continue with the physical system, actually use of digital system is making more burdensome to the doctors, to the staff of the facility. So while they were doing initially only physical system, now they are doing both physical and digital system, which is actually burdening them more. So the point is not to use both. The point is that we need to stop the physical system, make every component of it part of the integrated workflow of the digital system, and use only one digital system. And then only the workload will come down. People will gain the full advantage of the digital system. And this is happening. This is happening in one of the state. I should name that state is Bihar, where even at the health sub center level, there is no paper, there is no printer, everything is digital. And I must also say the softwares are so good nowadays, the doctors don't have to type. They have to just select from the drop down which symptoms they want to select, which medicine they want to prescribe, which test they want to prescribe. This is what the prescription contains. So if this is used, I think the work gets reduced drastically for the doctor, for the staff also. And in due course of time, you will see this whole business of typing will go away, because now there are good solutions where patient doctor conversation can automatically be converted into prescriptions. This is already happening, and some of the facilities are already using it. We would like that also to be used in Goa, so that the doctors can get more time to dedicate for the treatment, for consultation, for talking to the patients, not for writing prescription or noting down the symptoms, etc. So this is the advantage which we will have with the HMIS system. I should also impress upon that while we are looking for transition from fragmented system to a connected system using digital health, we are also creating huge strength for the country together. Now new technologies are coming, and artificial intelligence is one which has already entered in our life. We are now already using it, and more we will use in the time to come. Here is the case that if we want to use AI in health, where the AI has the highest application in healthcare, if we want to use AI in health, we need to know that it works only if we have digital data. So while we say we are a huge country with a large population, we have huge data, these data are of no use if it is of not a standard quality, if it is not digital in a standard format. And that is where our role is to use digital systems so that we create data, so that the AI models are trained on Indian data, so that these models work well in the Indian context. Because nowadays there are so many AI solutions coming in the market who claim very high efficacy, but most of the time they are trained on foreign data. So whether they work well in the Indian context is not very sure. Sometimes it could be very misleading. And therefore, it is very important that we have the AI solutions which are trained on Indian data. Though Ministry of Health and Family Welfare, through National Health Authority, we have developed a both platform, benchmarking open data platform for health AI, so that we benchmark, test and benchmark the health AI against Indian data sets. But that is the requirement for testing and benchmarking. But we need more health AI which are trained on Indian data sets, for which we need data, and that is where we are required to develop the digital health system where the digital data can be created. Similarly, AI will require much more a strategic requirement of its usage in healthcare, because we all know that healthcare is extremely sensitive, and it deals with the lives of people. We just can't apply AI like any other sector. It has to be completely, assured, responsible, ethical, and should be tested much before it is applied. So this is a future which we are looking at, and for that future we have to create the foundation, which is a digital health. So this is something which we are very hopeful that the way we need to create digital health ecosystem, it will also feed to the usage of emerging technology like AI. Some of the hospitals, they may also think that why should they use digital system? What gain they will make if they use the digital system? Their work is going as usual even with the physical system. Here I want to tell to all of them that today you have the patient who are happy with the physical prescription. Tomorrow you may not have such a patient. The new generation is actually digital first generation. They look for the doctor's facilities not by asking their friends or relatives. They just first search on the mobile, Google search, or some AI tools. So those who are not on digital system, those who are not on registry, they may not be visible to them, and that is where you are required to be on the registry, whether you are a professional or a facility, and that will actually enhance your visibility, discoverability, and that will help not just the patient, also to you for that. Similarly, many of the new generation people will actually ask for the digital record. They may not be happy with your physical record because they can't make intelligence out of it. Because tomorrow, once I have the health history of last 5 years, I want a prediction based on that data. I want all alerts based on that data, whether I should be alerted that whether my daily routine is enough to take care of my future requirements. Am I doing enough exercise? Am I taking good nutritious food? These all will come only if we derive intelligence out of this data, and the new generation is going to ask for it. So today is the time that we start thinking the value of digital health, and if we don't think, probably we will become irrelevant in future times. So this is very important area which we are all working together. We are hoping that Goa could be one of the model state, not just North Goa as a model district, where every health facility becomes end-to-end digital. They create only digital health records. They create digital health records which are linked to the Aadhaar ID, and then they build the capacity, not just in form of creating digital health record, also the capacity to analyze the data which gets created out of digital health records. Once you have the data of the whole state, I think at the level of the government, honorable minister can appreciate that you will be able to pinpoint which area of the state has what kind of disease burden, which kind of people get what kind of disease predominantly, in which age group you have certain kind of disease, which gender is going to have what kind of disease uh, you know uh, prominence. Also you have a different seasons, you can imagine which disease takes place in what period. So these all are right now based on perception, based on our historical knowledge. Tomorrow it will be based on evidence, it will be based on data, and that is the power of technology. That is the strength it brings to government, to the society. So we should all start working for creating this digital health ecosystem. And you can imagine if every state does so, at a country level, we become extremely powerful enough to have the whole disease profile and the disease surveillance over the country level. And the population and the diversity we have, we will be probably the world's strongest country in the field of healthcare delivery. So with these words, I wish this workshop a big success. I also request all of you to visit the stalls which have been put by the integrators to showcase their solutions and see how quickly you can start using these application in your settings. Those who are from the health facility, I'll request each one of you to make a roadmap for next 3 months. How will you implement this HMIS in your health facility? Not just the software, the whole change management, capacity building, change of mindset, and make it happen so that end to end digital health record creation can happen. With these words, I thank all the participants here today and the government of Goa, Department of Health and Family Welfare, all their officials for taking out time and organizing this event, which is going to be a big success. I wish all success to the event too. Thank you.
Thank you, sir, for your insightful address and for sharing the vision of the National Health Authority. Your guidance and continued support are invaluable as we work together to strengthen the digital health ecosystem and advance the implementation of the Ayushman Bharat digital mission in our state. The success of the Ayushman Bharat digital mission depends on strong leadership and commitment across the health sector. The leadership and initiatives that our Honorable Health Minister has championed have paved the way for a future where every citizen can hope for a healthier and a more prosperous life. Sir's commitment to public health is highly commendable, particularly through his key digital initiatives implemented in Goa. Under his dynamic leadership and visionary guidance, the state of Goa has taken significant strides towards transforming healthcare through technology and innovation. Some of them include Goa being the first state to deploy AI powered lung cancer screening across our public health facilities, AI enabled breast cancer screening for early detection of breast abnormalities, telecardiology and STEMI workflows, digital X ray services with teleradiology support, telemedicine and e-Sanjeevani consultations, connecting patients with specialists without the need for long distance travel. We also have our first digitized primary health center at Kurlim, which was also digitized under Sir's guidance. Under Sir's guidance and constant support, Goa has also achieved a milestone of over 10 lakh registrations for the ABA. As we stand at the threshold of this inaugural event, it is with great honor and anticipation that I extend an invitation to our distinguished Honorable Minister for Health, Shri Vishwajit Rane sir, to share his vision for the state of Goa. Sir.
Good morning to all of you. Today, before acknowledging all our dignitaries on the dais who have come specially here to Goa for this workshop, I would like to wish all the doctors present here happy Doctors' Day. Wish you all the best, because without you, all this is not, I mean, we cannot have any kind of discussion. And it's all of you that are actually saving lives and continuing to save lives. Present here today amongst us, who has specially come from Delhi, is Sri Sunil Kumarji, who's the CEO of National Health Authority. We also have our Secretary Health, Sri Mararkar. We have our Sri Pankaj Kumarji, who's come here, Dr. Pankaj Kumarji, Dr. Piyush Singla, Dr. Kedar Raikar, our own Director Health Services, Dr. Rupa, and all of you present here and all the doctors present in the audience. My our ex-director health service, Dr. Rajnanda, who has been with me. That's why I was just telling Sunil Kumarji about my journey also as a health minister. And I was fortunate to have this portfolio for the last 16 years plus. All of you must have heard Sunil Kumarji mentioning about the importance of digitization. And I got along. I told our office to send me input, like, what is the workshop? So I got everything. But actually, what you and we were just discussing, I was just discussing with them is that we, being a small state, we should actually lead by example. Digitization of records is so important. And I was just mentioning in the lift that I generally used to go and do earlier. I used to go and do all my health checkups in Singapore, and somebody had suggested when I was there was some issue which I had gone with a relative, and then how the digitization is so important and how it helps the doctors actually bring in more efficiency in the system. Honorable Prime Minister of the country, Modi ji, is very clear that digitization of these records and mapping of the population, if it has to happen, in order to ensure that we are in a better position to, use our knowledge, diagnostics. We all say that there are so many things and so many levels. I think Mr. Maralkar visited. I couldn't go to the function recently. Actually, I was supposed to go with him when Nadda ji had this the Arogya Setu 2.0 was launched. I only want to say one thing is that we have been doing what we can in the state of Goa, and there's lots more to be done. When we invite, we have the private sector also in the state of Goa, which is we are working very closely with. But then digitization of the records, and if we are able to have all of them on board, and for that, to get all of them on board, I think first the state government, and not only like you said, Sunil Kumarji, is that not only the North Goa District Hospital, but all the district hospitals, Goa Medical College, and all the peripheral PHC and CHCs, if we are able to integrate, it is going to make life easy. Like just now Sunil Kumarji mentioned that we have a parallel manual system and we have the digitization, then the pharmacy, then you can combine, and you can actually, since this is a workshop, I'm just going into one subject. Suppose we in the state of Goa, Sunil Kumarji, must be the only state that we give treatment protocols beyond your insurance card, or going beyond. We give most of the things free of charge to the patient. We don't charge anything, neither during COVID and neither today. Like, we have actually mapped the population in segments. What you were just mentioning, I was just listening to your speech, is like having an overall mapping of the population so that we are able to identify what are the areas of concern and how. And for this, if digitization is not done, and also doctors sitting here in the audience, actually, I have not got an opportunity to mention meet Sunil Kumarji in Delhi. I think my Delhi trip is overdue. Everybody is complaining. My ministers are complaining. Aap aate nahi. You're not attending the any program in Delhi. But I think I'll come call on you. It is important to sit with you to understand what way we can move forward. That's why I was just mentioning, like I was just told that Bihar has digitized all the records across the board. Then this is an amazing thing. Just imagine a state like Bihar digitizing all their records. We are saying that we have registered 10 lakh people and digitized and given ABA cards, but that is not enough. How are you going to utilize this data? How are you going to have a seamless approach in seeing that the patients coming from the PHC or CHC or even a sub-health center to the Goa Medical College for tertiary care, how this seamless information can be used by the doctors? A poor man, a poorest man for coming from the rural area should have that card which has all his records, so the doctor doesn't have to ask anybody or go and send him to do multiple tests, but he has that information and he can have a focused approach in treatment protocol as far as to give the patient. Today, I would just want to tell all the doctors, it's not far away. I was telling Mr. Maralkar, he said, no, we require funds. But let me put it in this way, that when a visionary Prime Minister of the country, Modi ji, is very minutely, actually, when he started his tenure looking at the smallest thing which we didn't think was very important in our daily routine and lives. Today, the whole country is looking at all programs. Each and every program initiated by him today is a success story. And I'm just starting, it is not related to health, but something like a Swachh Bharat, trying to change the overall mindset to digitization of records and having a seamless crossover information across the state in the government healthcare system will only help the doctors work in a much more efficient manner. Then you don't need to give prescription, you don't need to do anything. There'll be commons, so everything will be linked to a digital dashboard which you'll be able to utilize. You'll find out what is happening. Your blood records of a particular PHC, CHC will also be on, and you can draw information from wherever you want. I know it is a very sense. Many times we were just saying that, it is important for us to see that we move in that particular direction. And for that, the doctor sitting here in the audience, I mean, doctors sitting here, like I was just now, somebody mentioned, is that there are a lot of people who have been, facilitators of technology, and talk to them and see ultimately what you want. You want a good company, or you want a good facilitator to help us implement the type of technology that you have been implementing in other states, so that we are also able to pick up the right type of partner. Many times I was just mentioning to Dr. Saab is that lot of people come and quote for these tenders. We don't know whether they're in a position to actually deliver or they're not. That's why I said that, if we have a time bound manner in which a small state like Goa, for us, we are in the vision of the Honorable Prime Minister. Nadda ji is also there. Fortunately, I had the opportunity to work with Nadda ji even when he was a minister earlier. And I have had a very good relationship with him. He has always given me good ideas how to move forward. But it is also for us at the state level to see that we are able to take this Ayushman Bharat digital mission forward. Whether it's the pharmacy where Mr. Rataboli is sitting from our Goa Medical College, or what are the, I mean, medicines available there. A doctor at the tip of the finger can always make life easy, not only for himself, but also for the patient. And also at the state, I mean, we are doing so many programs, but we are doing it in various segments. And what just now Dr. Sunil Kumarji mentioned, is that the national authority, we are so grateful to them because of their guidance. But also what he just mentioned is that you will be in a better position to assess and bring in efficiencies of system and map the population across the state of Goa, and then understand what you need to do as a state and accordingly tweak your policy and move forward. I just want to give an example. Is when I was in Singapore, I went to Mount Elizabeth, and Mount Elizabeth has my 16 years records, and they have a graph which generally tells you exactly how you've been, what is your overall wellness, what's your parameter, what was your triglyceride 16 years back, and what it is today, how your life cycle has moved. Today, medicine is going beyond medicine. People are talking of regenerative science, regenerative longevity, and several things. And today, people are wanting to actually reduce the cell age. And so I'm just trying to tell the doctor that medicine is becoming such a vast and such a. I was told in Dubai, sir, is that now there's a longevity protocol, longevity ministry, which has now been formed, basically only to deal with longevity. So basically, what we want to do, we are not saying that we want to have a longevity ministry here. We are just saying that we want to see that we are able to map the population using digital medium, so that we can give him the best treatment protocol and understand his records much better, and even for the patient to understand it. Once he has a digital access to this type of, and you have access to this type of platform, it makes life much more easy. I think with the speech and the guidance given by Sumil Kumarji, I will make it. I myself will come to Delhi and sit down with you with a small team, just to get an insight. How do we move forward, and how do we integrate Goa as a model, and Goa can lead. We have actually done well on many parameters, and if we have to actually move forward, then I think, with your guidance and the government of India, since we are totally in sync with your vision, the vision of Naddaji, vision of the Prime Minister, and the Government of India. So we are all in the same thought process to achieve something, and achieve something that is different, and become a lead state in implementing all this. Actually, I was surprised when Dr. Saab just mentioned that, Bihar is fully has been digitized. Then I think we need to fix a time frame to see that all our PHCs, CHCs, sub-health centers, all our facilities are in sync, and we are able to move forward. This will only help us. And Ayushman Bharat and the digital mission, as launched by the Honorable Prime Minister, is with a vision, and a vision to bring in more efficiencies in the system. And I think these efficiencies will come and help us understand our state much better when we are in a position to implement it 100%. And I think we will implement it 100%. Mr. Maralkar is a little worried. He always is a little worried and stressed, I think, about the funding. इसलिए मैंने सुनील कुमार जी को बोला कि गवर्नमेंट ऑफ इंडिया से लिंक इट टू सम स्कीम where you tell them that the state government will be allowed to access these particular schemes only when you're 100% digitized, and some sort of a directive should come, and states like us will fall in line and make sure that we are able to take this forward. I don't want to say much today. We have got a cabinet meeting. I'm already delayed for the cabinet meeting, but I said this is also important. आप आ रहे थे, so I said I had not got an opportunity to meet you, and important for us as a state, and I can only commit, because we as a state are very progressive, and we are grateful to the National Health Authority for guiding us from time to time. All our officers always are present for every interaction under NHM or anything, anything that is called for by Government of India, to see that Goa as a progressive state goes ahead and we are able to achieve the whatever you suggest to us, and we want to move forward in that particular manner. I would like to thank you for being present here today, Sunil Kumarji, and your whole team, and our Director Health Services, who without fail attends every meeting. And even if I am not there, many times I am excusing myself these days, but I think he's been attending, just getting a different insight to how health is. And I have been fortunate, being the health minister for the last 16 years, has given me at least that I have been able to keep policies in sync and move forward. And I have been very fortunate to work with Nadda ji in the past and today also. And I assure you that Goa will follow the guidance, and we are grateful to the National Health Authority. And if there's any other way you want us to link us or make suggestions to us, and even the facilitators that are here, the technology people who actually are here, who have actually dealt with other states, I think Secretary can interact with them, Director can interact, Dr. Kedar is here, all of them can interact with them, and then we'll be able to take things forward in a better manner, because we are such a small state. We are smaller than a district of, if you look at a state neighboring to us like Maharashtra, if you look at it, our state is smaller than any big district of Maharashtra. And it will not take time for us to integrate and have an integrated system and have this implemented in the most efficient manner and a most transparent manner. Thank you, and wishing you all a happy Doctors' Day again today. And I want you to all the doctors, please understand, a minister only cannot take decisions. I'm not, I always have this discussion. Minister is not only to take decisions, suggestions should come also from the doctors' fraternity. And doctors also should make these suggestions, because you are working in the system. And we are here to hear you, and administratively, whatever we need to do, we need to work with you and ensure that we have an efficient system and efficient platform in place. And also, the private sector should join us. And I appeal to them also to be a part of this system, so that we're able to work in a very integrated manner. Thank you so much.
Thank you, sir, for your insightful address and for highlighting the state's commitment to advancing digital healthcare. Your dedication to health is truly commendable, and we are fortunate to have someone of your stature contributing to the success of Goa. We are grateful for your continued leadership and commitment to improving healthcare in our state. Your guidance and encouragement will undoubtedly strengthen the implementation of the Ayushman Bharat digital mission across the state. I extend our sincere gratitude for your time and your genuine commitment to make today's event a truly memorable one. We now have a small memento as a token of appreciation from the National Health Authority. I request all the dignitaries on the dais to kindly assemble for the official group photograph. I also request the Ayushman Bharat digital
Don't have to wait, you know my name. Sunshine and rain, some things don't change. Thinking about the days we were younger. You know.
We'll start with the technical session. Tea break. पंकज कुमार का question है. Yeah. Thank you, sir. Ladies and gentlemen, we now come to one of the most anticipated sessions of today's inaugural event. It is. Oh, yes, ma'am. We'll start with the technical session. Very soon, we'll start with the technical sessions. Requesting you all to please be seated. Requesting everyone to please be seated. We will soon start with our first technical session. It is my privilege to invite Dr. Pankaj Kumar Arora, Director, National Health Authority, to address the gathering on Ayushman Bharat Digital Mission, along with an overview of other key digital health initiatives and innovations of the National Health Authority. Under the leadership of the National Health Authority, these initiatives are paving the way for an integrated, interoperable, and citizen centric digital health ecosystem across the country. We are honored to have him with us today to share his insights and vision. The stage is all yours, sir.
Good morning, everybody. I'll just request all of you to just switch off your mobile or put it on silent mode and do not see it for next 30 minutes so that you are able to understand what ABDM is and how it changes life for the citizen. It's not another program which you have to just log in and fill the data. It's an infrastructure which has been developed to make our lives, your life, and the life of the citizens of Goa and India easier and better and get a better healthcare. So in this session of 30 minutes, I will be telling you about what is ABDM, what is the initiative, this model district and model facility initiative is, as well as I will be taking you through the new innovations which we have done, the scan and share and scan and pay. So it will be very, very interesting, and you will be able to absorb more if you will concentrate and listen to me and see the screen too. So as it was told that we were there to create this fragmented journey to a integrated and connected journey, and the patient will have everything on his hand at the fingertips. So what ABDM is to create a health record and records linked to a ID. That is what the crux is. So when we visit doctors and we finally end up having a prescription, it is to be linked with that ID of mine or yours, for that matter, and all the records should be there in that ID, and that multiple IDs which you create in different hospitals, may it be a private, public, or immunization place, or maybe a pharmacy, are at one place. So that gives you that longitudinal health record of yours. As the minister sir was saying that Singapore had it done 16 years back, we are there now, and we should be not missing this opportunity. And it will not be possible with support of all of you who are there to help us make this ecosystem, the national health, digital health ecosystem, which will be already secure, confidential, and private by design. It will be having that privacy, security of your data. And we work on an interoperable system so that these records can talk to each other, and then any hospital can, with the consent of patient, can share the records to the other hospital, and the patient get a better treatment. Overall, the crux is that we have this system developed now which is secure, interoperable, has security privacy by design, has your confidentiality maintained, as well as it is federated. By federated, what I mean is that the record stays where it is generated and only can move with the consent of that patient whose record it is. So there is no issue of that doubt in the mind of the doctor should not be there that ये data कहाँ चला जाएगा, ये leak तो नहीं हो जाएगा. So वो leak वो share तभी होगा जब patient agree करेगा. And anybody and everybody can plug in. As a citizen, I can plug in. As a doctors, you can plug in. As a government hospital, the facilities can plug in. Private hospital can plug in. Pharmacies can plug in. They and national programs can plug in. So we have created that socket in which everything can plug in, and the flow of information is only when it has been asked for. So आप समझो कोई बहुत सारी ट्यूब डाल दी हमने एक जगह पे और उस ट्यूब से खाली डेटा जाएगा, लेकिन ट्यूब में कहीं भी सेव नहीं हो रहा है, वो डेटा वहीं पे है जहां पे बना था और वो पहुंच रहा है वहां पे जहां चाहिए था आफ्टर द हेल्थ information user wants it from the health information provider, may it be the hospital, may it be the pharmacy. So you have to plug in for it to be successful. And it's a doctor's day. I'll request all doctors to have that pledge today that they will plug in and they will help us achieve this journey for Goa and India. उस सब के लिए आईडीज जरूरी हैं, आइडेंटिफायर जरूरी है. बहुत सारे आइडेंटिफायर हमने बनाए, साथ में कुछ गेटवेज भी बनाए. ये एक हमारा कोर बिल्डिंग ब्लॉक बनाते हैं. एक आइडेंटिटी है सिटीजन की, एक आइडेंटिटी है डॉक्टर की, नर्स की, फार्मासिस्ट की, दैट इज हेल्थ प्रोफेशनल रजिस्ट्री, पेशेंट की हो गई या सिटीजन की हो गई आयुष्मान भारत हेल्थ अकाउंट, और तीसरी है फैसिलिटी की हेल्थ फैसिलिटी रजिस्ट्री, जो कि फार्मेसी हो, चाहे वो अस्पताल हो, चाहे वो क्लिनिक हो, सब वो अपनी रजिस्ट्री बनाते हैं. तो एवरीबडी हैज अ आइडेंटिफायर. And then we have gateways which use these identifiers as well as the other digital public goods which are available to give that advantage to the citizen. तो आभा क्या है? आभा एक 14 डिजिट का नंबर है जो कि आपको मिल जाता है. इससे सब डेटा आधार से आता है. क्या एडवांटेज है इसका हमारे लिए? एक तो ये एक आइडेंटिफायर है जो आप मल्टीपल आइडेंटिफायर यूज करते थे. हर अस्पताल अपना आईडी बनाता था, फार्मासिस्ट भी आपको एक आईडी देता है बिल में. वो सारा हटा के ये आभा आईडी एक यूनिक आइडेंटिफायर के रूप में उभर कर आया है जिससे आपके रिकॉर्ड उसके साथ जुड़ सकें. मैंने बताया ये सिक्योर है बिकॉज आपकी कंसेंट के बिना कोई डेटा आगे नहीं जाएगा. आपकी कंसेंट जरूरी है. उसके बाद आप जो चाहे सेलेक्ट करके अपना डेटा उसको शेयर कर सकते हैं अगले डॉक्टर के साथ या अगली फैसिलिटी के साथ. और साथ साथ ये वो क्रिएट करता है आपकी हिस्ट्री जो कि सब जगह से एक साथ आ गई एक जगह, और आप उसको एक साथ देख सकते हैं. 16 साल का रिकॉर्ड बताया मिनिस्टर साहब ने कि वो देख पा रहे थे उनका ट्राइग्लिसराइड कैसे चल रहा है, कितना फर्क पड़ा. सो यू कैन हैव दैट इन्फ्रेंस ड्रॉन विद दैट एआई इन प्लेस नाउ. हेल्थ प्रोफेशनल रजिस्ट्री भी एक 14 डिजिट का नंबर है. इससे क्या फायदा है? डॉक्टर को भी तो फायदा होना चाहिए. सो डॉक्टर्स डे के दिन मैं बताता हूँ फायदा क्या है डॉक्टर को. एक तो ये आपको ट्रस्टेड आइडेंटिटी देता है, क्वैक से आपको सेपरेट करता है. इट गिव्स यू दैट वेरीफाइबिलिटी बाय द पेशेंट व्हेन ही कैन सी ऑन अ गूगल में सर्च करेगा, जो फाइंड करेगा एचपीआर डाल के आपको कि कौन सा डॉक्टर, तो पंकज अरोड़ा एमबीबीएस एमएस सर्जरी करके आ जाएगा, कहाँ से किया है सब कुछ पता लगेगा. तो ही कैन वेरीफाई हु यू आर. It gives a very good confidence to the patient and the identification to you as well as that trustability to you. Also it makes it discoverable. जमाना गूगल का ही है, आप हर चीज को सर्च करते हैं. तो पेशेंट भी आजकल, सर ने बताया, पूछता किसी से नहीं आजकल. पहले हम कॉल करते थे, यार बता दो कौन सा तुम्हारे बगल में गैस्ट्रोएंटरोलॉजिस्ट है, किससे कराया तुमने इलाज. अभी सब चीज अवेलेबल है, उसका स्टार रेटिंग भी है, कौन से अस्पताल में क्या है, कितना उसका एक्सपीरियंस है, एवरीथिंग इज अवेलेबल ऑन द नेट. सो दिस विल गिव यू दैट discoverability also to be seen by the patient, and that will increase as well as that advantage of getting now the license renewed of the councils. For several states have now done it. HPR के बिना council renew नहीं करता है. दिल्ली काउंसिल जैसे नहीं करता है अब मेडिकल काउंसिल. HPR नहीं बनाएंगे तब तक आपका नेक्स्ट रिन्यूअल नहीं होगा. साथ ही साथ ये आपको एक एडवांटेज देता है ऑफ यूजिंग द UHI, जिसके थ्रू आप अपना अपॉइंटमेंट बुक करा सकते हैं पेशेंट के द्वारा. इफ यू एक्सपोज योर टाइम टेबल थ्रू द APIs कि हाँ 10 बजे का अपॉइंटमेंट पंकज अरोड़ा का बुक करना है इस दिन, तो वो अपना बुक कर सकता है. ऑल्सो यू कैन गिव टेली कंसल्टेशन एंड इट गिव्स यू द वेरीफाइबिलिटी ऑन द अदर साइड कि यही डॉक्टर बैठा है. ये नहीं कि आप डॉक्टर ही नहीं था, उसने प्रिस्क्रिप्शन दे दिया, पता ही नहीं लग रहा है. सो दैट इज अगेन द एडवांटेज. फैसिलिटी का भी यही एडवांटेज है, उसको भी एक डिस्कवरेबिलिटी मिलती है, उसका बिजनेस बढ़ता है, चाहे वो डोमेस्टिक हो चाहे इंटरनेशनल हो. उसके लोगों को पता लगता है हाँ ये गोवा मेडिकल कॉलेज जहाँ प्लेस है, या यहाँ पे ये फैसिलिटी प्राइवेट आपकी जो कर रही है ये प्लेस है, तो वहाँ पे जाके वो इलाज करा सकता है अपना। साथ ही साथ दिल्ली में जाना है कहाँ पे वो फैसिलिटी है, वो भी अवेलेबिलिटी यहाँ पे पता लगती है। एक और एडवांटेज है, अब ये लाइसेंस रिन्यूअल के भी काम आएगा, एंड इफ सीए परमिट्स इट विल बी यूज्ड इन दैट। तो ओवरऑल क्रक्स क्या है, सॉरी आई विल ब्रीफ, it gives you that discoverability, the presence on the system, the Googles and every place, give you the unique identity, that number. It makes you available the booking of the consultation, may it be physical or teleconsultation. Also, it's now you will get that digital certificate of your you're a doctor who is having the HPR, as well as the facility who is having the HPR. And also you can issue the medical certificates now over it. There is also a workforce which was healthcare workforce place which was launched, in which you can register as a doctor. So अभी जो हमने सब बात करी उसमें मैंने दो चीज बात करी। एक नीचे वाली आप लेयर देखेंगे, एक हमने डिजिटल पब्लिक गुड बने हुए थे पहले से, दैट यू कैन सी ऑन दैट साइड। आधार सबके पास है, यहाँ पे हाथ खड़ा करिए प्लीज। आधार किसके पास है? हर एक के पास है, बढ़िया। यूपीआई सब यूज करते हैं? यूपीआई नहीं, हाथ खड़ा करना पड़ेगा, ऐसे नहीं पता लगता अंदर अंदर। हाँ, यस, गुड। और डिजी लॉकर कम लोगों के पास होगा, तब भी और बहुत लोगों के पास है, गुड यार, एक्सीलेंट। हमने ऐड क्या किया, लेयर आभा, एचपीआर, एचएफआर, अब ड्रग रजिस्ट्री भी लॉन्च कर दी। तो ये सब चीज जो है बेस बनाती है इन 3 एक्सचेंज प्लेटफॉर्म्स का वर्क करने के लिए। तो क्या करता है ये बीच वाला ग्रे कलर का जो है, हेल्थ इंफॉर्मेशन एक्सचेंज एंड कंसेंट मैनेजर। ये क्या करता है, ये वो जो मैं बता रहा था बार बार, जो HMIS LMIS हैं, चाहे वो हॉस्पिटल हो चाहे लैब हो, उसमें जो रिकॉर्ड जनरेट करते हैं उसके द्वारा ये आके आपके PHR ऐप में सेव हो जाते हैं। चाहे वो आरोग्य सेतु हो, चाहे वो आभा ऐप हो। उसके बाद जब आपको वो शेयर करना है किसी को, तो वो वहां से वापस आके इस कंसेंट के द्वारा ही वापस HMIS या LMIS, HMIS पे जा सकते हैं दूसरे अस्पताल के। So it gives you that collation of the reports at your PHR app, which can be shared and shared to another doctor for a better outcome. तो एडवांटेज क्या है पेशेंट का, कि उसको बढ़िया से इलाज मिल रहा है, वो उसका बाय प्रोडक्ट है। इसका सबसे बड़ा एडवांटेज डॉक्टर का है इसमें, उसको सारा चीज पता लग रही है पेशेंट के क्या है, वो अच्छे से इलाज कर पाएगा, अच्छा रिजल्ट देगा, नाम होगा, ही विल गेट एडवांटेज। साथ साथ आपका जो डेटा है वो कंसेंट के द्वारा शेयर हो रहा है, तो कुछ मिस होता है तो आपकी वो रिस्पॉन्सिबिलिटी तब रह जाती है कम। वरना जैसे मरीज ने बताया कि मैंने तो शेयर किया था, आपने देखा ही नहीं, किसी के स्टेरॉइड चल रहा है, and then the patient is operated, lands into pulmonary edema, there is no history available. Now it has to be shared through the consent of that patient. On the other side, the green one is a universal health interface which has been launched by the Honorable Health Minister day before, and this gives you the advantage of what I was talking about, of discoverability as a doctor, as a facility, and then your labs can be seen, your pharmacies can be seen, your hospital can be seen. Also, you can see the number of beds available. If you expose that to the thing, your things can be seen, that kitna bed available ICU mein hai, kitna bed aapke available. Sath hi sath, you can search for the blood groups available across. You will, if you will download this app of Arogya Setu 2.0, the scanner is there also. I'll, at the end of my session, I will show that scanner to you. Hope you all download. तो उसमें आप चेक कर सकते हैं कि कौन सा ब्लड ग्रुप आपके बगल में अवेलेबल है. That was a very new thing, and we are going to improve it further. The third thing, and this talks to the hospital service provider application जो अस्पताल का रहता है, and then हमारे पास जो PHR ऐप रहता है या एंड यूजर एप्लीकेशन रहता है, उसके थ्रू हम बुक कर सकते हैं. That is again intraoperable. The last one is for especially for the PMJ hospital. How many PMJ hospitals are there here? Government और प्राइवेट के 2 थे, वो आए हैं अभी. गुड. सो ये जो आपका है, इसमें आपको नेशनल हेल्थ क्लेम एक्सचेंज एक ऐसा स्टैंडर्ड प्लेटफॉर्म बताता है जिसके द्वारा आप अपना बिल स्टैंडर्डाइज वे में सबमिट कर सकते हैं. क्या फायदा होता है? Because it is standardized, there are less chances of not submitting the details which are required for the claim to process. Faster claim processing. Also, we are incentivizing the hospitals right now 200 rupees or 10% of the bill, whichever is lower, for submitting the bill through the NSCX. So जो आपके यहाँ HMIs लगे हैं, अगर वो NSCX compliant हैं, जैसे CDEC कई जगह लगे तो अभी हो जाएगा, इशू थोड़ी देर में हो जाएगा. So उसके द्वारा अगर आप जमा करेंगे तो उसको आपको 200 रुपये और एक्स्ट्रा मिलेगा बिल का. साथ ही साथ जब आप जितना रिकॉर्ड लिंक कर रहे हैं उसका भी आपको पैसा मिलता है, जो कि हमारा डिजिटल हेल्थ इंसेंटिव स्कीम का एक सेशन हम आफ्टर द लंच करेंगे, उसमें आप देख पाएंगे. एंड आई होप दैट एवरीबडी इज क्लेमिंग दैट. गोवा ने अभी तक 2,28,000 क्लेम किया है. सबसे ज़्यादा पीएससी कोडलिम ने आई थिंक क्लेम किया 60,000. सो आई थिंक बाकी सारी पीएससी सीएससी को भी इसके अंदर लॉग इन करना चाहिए एंड इस्तेमाल करना चाहिए. तो ये मैं आपको एक स्क्रीन दिखा रहा हूँ. इसमें एक तरफ तो हेल्थ इंफॉर्मेशन प्रोवाइडर है, चाहे वो डॉक्टर हो, चाहे अस्पताल हो, चाहे हेल्थ प्रोग्राम हो, चाहे वो लैब हो, और दूसरी तरफ उसको कंज्यूम करने वाला यूजर अस्पताल है या डॉक्टर है या सिटीजन है. तो होता क्या है, यहाँ से जब आप इंफॉर्मेशन मांगते हैं हेल्थ इंफॉर्मेशन यूजर, तो एक मैसेज आता है पेशेंट के पास और उस अस्पताल के पास. जब पेशेंट उसको एग्री कर लेता है, कंसेंट देता है कि मैं ये शेयर करना था, सेलेक्ट कर लेता है, तो वो डेटा यहाँ से प्रोवाइडर से, जहाँ मान लीजिए कि गोवा मेडिकल कॉलेज में वो रिकॉर्ड बना था और वो आप पीएससी में अपने गए तो देखने के लिए कि कितना उसको दवाई चल रही है, कौन सा डायबिटीज का दवाई चल रही है, तो ही कैन शेयर दैट. सो नाउ द पीएससी कॉलिम कैन सी दैट व्हाट मेडिसिन वर कंटिन्यूइंग इन एंड वाज एडवाइज्ड इन गोवा मेडिकल कॉलेज. अभी बात मैं कर रहा था फायदा क्या होता है. तो ये एक सिटीजन थी, वो गई एक बार प्राइवेट अस्पताल में, एक बार गई पब्लिक अस्पताल में, फिर गई इम्यूनाइजेशन सेंटर पे. हर एक ने अपना आईडी बना दिया, हर एक आईडी बना हुआ है, पेपर भी निकाल दिया, डिस्चार्ज कुछ है नहीं, तो वो अपना बैग लेके ढोती हुई फिरती है हर जगह बेचारी. अभी क्या हो गया, दिस इज अ यूनिक आइडेंटिफायर व्हिच आई वाज टॉकिंग अबाउट. सारा चीज उसके हाथ में है, उसके मोबाइल पे फिंगर टिप पे है, बटन दबाएगी, शेयर कर देगी. ऐसे ही जैसे हेल्थ प्रोग्राम में वो जाती थी लेडी, अपना आरसीएच में गई, आपके सारे प्रोग्राम आप रन करते हैं, किसी भी अस्पताल में गई, तो अब वो सारी चीज एक साथ देख पा रही. मान लीजिए उसका हीमोग्लोबिन था 9.8, उसको क्या क्या चला. नाउ एवरीथिंग इज नोन टू हर as well as the next doctor who is going to see it. So this is through the consent based system where we have that advantage. So फायदा क्या होता है ओवरऑल ऑफ द कंसेंट मैनेजर और हेल्थ इंफॉर्मेशन एक्सचेंज का? एक तो सारा रिकॉर्ड आपके पास आता है. सरकार का क्या फायदा होता है, वो इसका सर्वेलेंस कर सकती है देख के कि भाई कौन सी बीमारी क्या कहाँ पे है. मान लीजिए कि आप सोचिए कि ब्रेस्ट कैंसर का लोड आ रहा है गोवा मेडिकल कॉलेज में, अभी तो आ रहा है, वो रिकॉर्ड सेव नहीं हो रहा, लेकिन एड्रेस भी पता नहीं लग रहा. आभा के द्वारा एड्रेस भी पता है, वो कहाँ का रेजिडेंट है पता है, क्या उसके एनवायरमेंटल फैक्टर इफेक्ट है, यू कैन देन चेंज दैट. You can also advise a breast self-examination early. You can advise a mammogram for more than 40 years of age. If you see that advantage, if you see that what we say incidence and prevalence in that area, तो ये आपको एडवांटेज देता है. और यू कैन यूज दिस डेटा आफ्टर एनालाइजिंग फॉर लर्निंग एंड गिविंग दैट एडवांटेज टू हॉस्पिटल्स. मान लीजिए मेमोग्राम बहुत सारे हो गए, उसमें ब्रेस्ट कैंसर पता लगे, तो अगली बार जब वो चेक कराने आए तो एआई डाल के उसे हम चेक कर सकते हैं कि ये वाला जो पार्ट दिख रहा है ये कैंसर हो सकता है. सो बहुत बड़ा एडवांटेज होता है फॉर द पब्लिक एंड फॉर द डॉक्टर्स एंड फॉर द कंट्री टू गेट दैट एडवांटेज ऑफ नोइंग द डिजीज एट द अर्ली स्टेज. क्योंकि पहली स्टेज में एक तो जिंदगी ज्यादा लंबी बचती है कैंसर में, दूसरा पैसा बचता है सरकार का भी पेशेंट का भी, और ओवरऑल इकोनॉमिक ग्रोथ होती है क्योंकि वो इकोनॉमिकली एक्टिव बंदे को आप बचा रहे हैं. स्टेज 4 में आप कीमो लगाइए और रेडियोथेरेपी लगाइए एंड देन पेशेंट अल्टीमेटली हैज अनफॉर्चुनेटली हैज सकम्स टू दैट. बट इन फर्स्ट स्टेज ब्रेस्ट कैंसर 20 साल, सोचिए 1 साल से 20 साल में कितना, 19 साल का इकोनॉमिकली प्रोडक्टिव प्लस सेविंग लाइफ ऑफ पेशेंट. व्हाट एन एडवांटेज इट गिव्स टू अस. एंड दैट थिंग व्हिच आई सेड, यूएचआई ऐप पे जाके आप सब कुछ चेक कर सकते हैं, अपना किसी का अपॉइंटमेंट बुक कर सकते हैं. सो बहुत ही बढ़िया एडवांटेज है. सो अगेन आई विल रिक्वेस्ट यू ऑल टू बी अ पार्ट ऑफ दिस जर्नी एंड अडॉप्ट दिस डिजिटल हेल्थ इन योर डे टू डे लाइफ. Not thinking it's extra work, but the advantage you will get through it, and the patient will get through it, and the country will get through it. बहुत बड़ा अभी काम हो चुका है, काफी कुछ, तो 100 करोड़ से ज्यादा रिकॉर्ड लिंक हो गए हैं. 92 करोड़ से ज्यादा आभा आईडी बन गए हैं हमारे. 141 करोड़ लोग के बाद आधार है अभी उनमें से, क्योंकि आधार जरूरी है इसको बनाने के लिए. तो अच्छा परसेंटेज हमने अचीव कर दिया. आप लोग की सहायता से हमने कुछ 5 लाख फैसिलिटीज भी रजिस्टर करी हैं, 9 लाख प्रोफेशनल्स, काफी सारी फैसिलिटीज, 2.5 लाख से ऊपर एबीडीएम कंप्लायंट हैं. स्कैन एंड शेयर टोकन जो है, जो मैं बताऊंगा अभी, उसको भी आप काफी टोकन हमने करोड़ों में इशू कर दिए हैं. और अब हमने एक स्कैन एंड पे शुरू किया है, उसको भी हम आखिरी में देखते हैं. 46,000 उसको भी हम ट्रांजेक्शन कर चुके हैं. 137 करोड़ का हमने डीएचआईएस डिजिटल हेल्थ इंसेंटिव दिया है डीएचआई स्कीम के द्वारा. 10 लाख अचीव करा है आज, कल रात को गोवा ने. आई थिंक दे नीड्स अ राउंड ऑफ अप्लॉज फॉर दैट टू ऑल ऑफ यू. तो यू हैव नाउ क्रॉस 10 lakhs. ये डेटा मुझे पता लगा, कल हम डिस्कस कर रहे थे 15 लाख से थोड़ी पॉपुलेशन कम हो गई है, सो बट इट इज देन अगेन इट इज नियरली 70% ऑफ दैट, एज वेल एज द हेल्थ फैसिलिटी भी 70%। सर ने बताया कि बहुत ही कम स्टेट है जिन्हें 70% अचीव किया है, सो हेल्थ फैसिलिटी रजिस्ट्रेट भी काफ़ी बढ़ गई हैं। हेल्थ प्रोफेशनल, मैं अभी पूरा नंबर दिखाऊंगा, तो मैं रिक्वेस्ट करूंगा सेक्रेटरी सर से कि वो बस एक आखिरी हमें छलांग लगानी है और हम उसे अचीव कर लेंगे। एज मिनिस्टर सर ऑल्सो सेड दैट हमें ये मॉडल स्टेट बनाना है, मॉडल डिस्ट्रिक्ट नहीं, तो हम इसको चाहेंगे सर कि आप पूरा कवर कर दें। आप हेल्थ रिकॉर्ड लिंक कर रहे हैं, कोडलिम आज सुबह हम गए थे, पीएससी कोडलिम इज लिंकिंग द रिकॉर्ड्स एंड दे आर हैविंग इंसेंटिव ऑफ 11,000 पर मंथ आल्सो, सो करीब 70 रिकॉर्ड पर डे वो लिंक कर रहे हैं, दैट्स अ गुड थिंग। एज वेल एज स्कैन एंड शेयर टोकन वहाँ पे जनरेट हो रहा था। मैं रिक्वेस्ट करूंगा जहाँ पे भी नहीं चल रहा है तो उसे आप स्कैन एंड शेयर टोकन को आप अपने यहाँ यूटिलाइज करें, सो दैट पेशेंट गेट द बेनिफिट एंड कैन स्किप द क्यू। Also, there are 179 facility under ABDM, which are ABDM software are there. ये हमें थोड़ा सा मेहनत करनी पड़ेगी, we have to have that। हमने कुछ लोग बुलाया है जो कि ये सॉफ्टवेयर देते हैं, तो प्राइवेट प्लेयर्स जो आए हैं वो प्लीज़ देखें, और साथ में गवर्नमेंट के लिए जो आप सर चाहें वो आप अडॉप्ट करके इसे 100% कंप्लायंट बनाए। तो जो हमने सर प्लान किया था, आपसे शेयर भी किया था, ये आप सबकी सहायता इसमें लगेगी। हमने ये मॉडल डिस्ट्रिक्ट एक इनिशिएटिव शुरू किया है, जो कि अपने आप में एक अच्छा इनिशिएटिव है, इन अ वे ऑफ गेटिंग दैट मॉडल अवेलेबल फॉर द अदर डिस्ट्रिक्ट्स टू फॉलो, एज वेल एज द फैसिलिटीज अवेलेबल इन वन पब्लिक एंड वन प्राइवेट फॉर द अदर फैसिलिटीज फॉलो इन अ डिस्ट्रिक्ट। तो हमारा बेसिक पर्पस क्या है कि हम एंड टू एंड एबीडीएम एनेबलमेंट को शोकेस कर पाएं, चाहे वो डिस्ट्रिक्ट हो चाहे फैसिलिटी हो। और उसके लिए हमें एक गैप एनालिसिस करना था, जो कि गोवा ने किया, और अभी पता है कितने हमारे HMIS कम हैं और कितने हमारे डॉक्टर्स रजिस्टर्ड नहीं है, वो सब हमने अभी ये कर लिया है काम। सिमिलरली फैसिलिटी के अंदर भी हमने पब्लिक एंड प्राइवेट आइडेंटिफाई कर ली है। हमारा मंथ ऑन मंथ प्लान है कि हम सारी की सारी जो गैप एनालिसिस कर लें, जो मई में सर ने कर दिया था, और हमें नॉमिनेशन सारे के सारे दे दिए जाए जो साहब हमारे गोवा से मिल गए हैं। अब हमारा अगला काम है कि सर 100% HFR को लाना। पब्लिक में आपने कर दिया है सर, प्राइवेट में हमें सर आपकी मदद लगेगी, और सब लोग की मदद लगेगी प्राइवेट सेक्टर से। आई थिंक काउंसिल्स आर आल्सो देयर, काउंसिल्स, थैंक यू अगर आप लोग आए हैं इसके लिए। आई होप दैट यू मेक श्योर दैट एवरीबडी इन द काउंसिल इज ऑन दिस HPR and all the facilities of those doctors are on HFR and the pharmacies too. So हमें साथ साथ जितने HMIs हैं, तो तीन तरह के फैसिलिटी हो सकते हैं। एक तो या तो HMIs उनके पास हो पहले से जो कि ABDM कंप्लायंट हो, वेल एंड गुड, बढ़िया है, उसे हम NS6 की तरफ ले जाएंगे। लेकिन जो HMIs ऑलरेडी है और वो ABDM कंप्लायंट नहीं है, वी आर देयर टू हेल्प यू गेट इट ABDM कंप्लायंट ऑन अ फास्ट ट्रैक मोड। तो जो भी HMIs आपके यहाँ रन कर रहे हैं जो कि ABDM कंप्लायंट नहीं है, प्लीज अप्रोच द सेक्रेटरी सर and send a request to NHA to fast track it. We'll arrange a 2-day session for you on and in NHA and get it fast tracked and ABDM compliant. Third is जो जिनके HMIS ही नहीं है, उनसे दरख्वास्त है कि वो यहाँ पे सबसे मिले और ABDM compliant सॉफ्टवेयर प्रेफरेबली NSCX इंटीग्रेटेड खरीदें और अपने यहाँ लगाएं। सबसे एक इंपॉर्टेंट चीज होती है कि वो आदमी जो अस्पताल में आ रहा है या कहीं भी पहुंच रहा है फैसिलिटी में, उसको पता तो लगे कि आभा है क्या है। तो उसके लिए बहुत जरूरी है अवेयरनेस, द मटेरियल विच इज देयर टू टेल कि ये QR कोड लगा हुआ है, यहाँ स्कैन कर दे, एक बंदा उसे बता पाए कि यहाँ हेल्प कर दे अगर कोई भी नहीं जान पा रहा है। सो IC सर अगेन रिक्वेस्ट, सारे भी फैसिलिटी के जो इंचार्जेस आए हुए हैं एंड सेक्रेटरी सर, प्लीज एक कियोस्क मॉडल फैसिलिटी में चारों में सर लगवाया जाए, जिसमें कि वो दोनों प्राइवेट और पब्लिक में सर कि वो वहाँ पे जिसको बता पाए जो पेशेंट है उसको कि आप ऐसे करना है फॉलो, और ये आपका आभा बना दें और ऑटोमेटेड करें सर। जैसे ही आए वो पेशेंट आभा बनाए, दैट इज द फर्स्ट स्टेप, कि उसको आप बाय डिफॉल्ट अगर उसका नहीं है तो बना दिया जाए सर। साथ ही साथ हम अभी सर वी वर देयर इन मणिपुर, वहाँ पे उन्होंने बड़ा अच्छा सिस्टम लगाया सर। हर काउंटर पे सर फिंगरप्रिंट की मशीन है, उसके बिना चलता ही नहीं आगे सर। वो अपना फिंगरप्रिंट लेके अचीव करता है और डाटा लेता है और फिर आभा बना देता है, फिर आगे वो अपना रिकॉर्ड जनरेट करता है। इसलिए सारे स्टाफ को भी सर हमें बहुत ट्रेन करना पड़ेगा। मैं अभी लिंक शेयर करूंगा सर, आपसे रिक्वेस्ट है कि आप ऑर्डर निकालें कि वो सारे लोग एक टाइम बाउंड मैंने मुझे कंप्लीट कर लें। और साथ ही साथ हम स्कैन एंड शेयर का इन द मंथ ऑफ सर जून या जुलाई में सर इसको स्कैन एंड शेयर सब जगह आपकी फैसिलिटीज में अवेलेबल करा दें सर। सो HFR HPR IC कियोस्क एंड सारा ट्रेनिंग हो जाए, फिर हमें कुछ नहीं करना है, फिर हमें मॉनिटर करना है खाली। फिर आप लोग के लिए बहुत टास्क सिंपल है, यू हैव टू फॉलो दैट दिस इज a habit This is in the flow of the work and it is not a burden. जब आप इसको करने लगेंगे एज अ डॉक्टर, बिकॉज मैं भी लिखता था पहले, ये तो प्रिस्क्रिप्शन मुझे भी बड़ा डिफिकल्ट हुआ था जब चेंज किया था. इट इज सच अ इजी थिंग. ड्रॉप डाउन मेन्यू अवेलेबल है आपके पास. आप टेम्पलेट बना सकते हैं बीमारी का, फीवर का, बटन दबाया सब भर जाता है. डायबिटीज का बटन दबाया सब भर जाता है. फिर आपको खाली काटना है और चेंज करना है. यू आर नॉट टू टाइप एनीथिंग. So typing is gone. Please see that you understand. Once you try to use it, 2-3 महीने इस्तेमाल करेंगे, लगेगा क्यों लिख रहे हैं हम, कितना आसान है. So that's the next thing forward. And क्या हमें मॉनिटर करना है, वो ये है इन अ डिस्ट्रिक्ट. आपने 70% अचीव कर लिया है, 95% इज टारगेट. तो जितने लोग को जानते हैं सबको बोलिए कि आभा बनाएं, प्लीज सबको बंदे आभा बनाएं. एंड वी अचीव द टारगेट ऑफ 97-95%. सारे लोग जितने यहाँ पे आए हैं वो आज ही अगर नहीं है तो HPR बनाएं. और जो फैसिलिटीज यहाँ, अगर आपकी फैसिलिटी रजिस्टर्ड नहीं है तो उसे रजिस्टर करें. सो वी हैव टू अचीव दैट. एंड साथ ही साथ हम अपने यहाँ सोल्यूशन को लगाएं, HMIS जो ABDM एनेबल्ड HMIS को. स्कैन एंड शेयर का टारगेट हमारा 75% का है. आवा बेस्ड प्रिस्क्रिप्शन जो हमारे रिकॉर्ड बनते हैं जब आपके अंदर पेशेंट आता है OPD में, तो उसका प्रिस्क्रिप्शन आभा बेस्ड हो, ये हमें सुनिश्चित करना है 90% लोगों का. IPD में कोई एक्सक्यूज नहीं है क्योंकि टाइम होता है डिस्चार्ज करने के लिए, तो सारी डिस्चार्ज समरीज शुड बी आभा लिंक्ड. So that is one thing which has to be taken care by all hospitals, which are may it be Goa Medical College, may it be Victor Hospital, any hospital which is there in on the panel, especially the PMJ hospital, they should be having discharges through ABHA, because वैसे ही PMJ में ABHA is already there. Or scan and pay, I'll tell we have to implement it in all facilities in the model district. Similar thing is for the model facilities. I'll just come to that. So abhi aapki 52 public facilities out of 161 in the model district of North Goa are having the HMIS, and 45 out of the 630 जो कि इसमें काफी फार्मेसी भी हैं, उनका भी they have that they are on having some software available. कई सारी फैसिलिटीज अभी ना HFR पे नहीं है. So ये इस समय नॉर्थ गोवा का स्टेटस है. 64% आपका आभा बना हुआ है. पब्लिक सर आपने पूरा अचीव कर दिया, थैंक्स टू ऑल. आई थिंक अगेन राउंड ऑफ अप्लॉज टू द गवर्नमेंट हॉस्पिटल्स टू हैव अचीव दैट. एंड प्राइवेट में भी इट्स अ गुड नंबर, आई एम टेलिंग यू. 63% बहुत ज्यादा नहीं है, बट आप लोगों ने करा है. इसमें आपने फार्मेसीज ज्यादातर कर दी हैं, विच इज अगेन आई ओपनर फॉर एवरीबडी. आउट ऑफ 161 ऑड फार्मेसीज आपकी करीब 159 ऑलरेडी आर रजिस्टर्ड. दैट इज अगेन अमेजिंग थिंग. छोटी क्लिनिक्स से रिक्वेस्ट है कि प्लीज अपने आप को रजिस्टर करें. सर HMI सर ये तो बड़ा मेहनत वाला काम है. पब्लिक वाले में तो आप आई थिंक एक साथ ही कर सकते हैं सिंगल ऑर्डर के साथ, विद द लीडरशिप यू हैव एंड द फोर्स एंड डायरेक्शन यू हैव. सो आई थिंक इट कैन बी अचीव्ड इन नेक्स्ट वीक और सो. सर CDAC इज देयर, NAC इज देयर, दोनों तो ही, प्लस साथ में प्राइवेट में जो भी आप सर अच्छा समझें स्टेट के लिए करें. प्राइवेट वालों से दरख्वास्त है, प्लीज इसको आप अडॉप्ट करें. एंड सर प्लीज हेल्प देम टू अचीव दैट. Doctors again have been 100%, sir. Again, achievement of state. Nurses also are 81%. Single sir एक order में I nursing council if it is there. So I'll request, thank you. Please आप सर इसे कराइए complete. ये आपकी जिम्मेदारी है सेक्रेटरी साहब को बताना कि 2 हफ्ते में कंप्लीट हो गया. 200 ही बची हैं खाली बस, 200 भी कम. तो अगले हफ्ते का टारगेट मान लें, हो जाएगा. ग्रेट, थैंक यू. एंड थोड़ा सा डिफिकल्ट होता है प्राइवेट वाला, वो भी आप ही ने कराना है. दैट इज अ वेरी स्मॉल नंबर, 17%. एंड डॉक्टर्स थोड़े से बचे हैं सर, 15%. वो डॉक्टर जो काउंसिल है, मेडिकल काउंसिल एज वेल एज द एसोसिएशन, आई विल रिक्वेस्ट देम टू हेल्प अस आउट इन गेटिंग इट डन. स्कैन एंड शेयर टोकन वगैरह का मैं भी आपको स्कैन एंड शेयर के साथ बताऊंगा. साथ ही साथ ये टारगेट, सिमिलर टारगेट्स आर फॉर द फैसिलिटीज जो 4 हमारी हैं एक्सेप्ट द आभा. आपकी सर फैसिलिटी दोनों की दोनों हैव दैट HMIS. अनफॉर्चुनेटली द रिकॉर्ड्स अभी जो 2 हमारी फैसिलिटी प्राइवेट आई हैं उनके रिकॉर्ड लिंक नहीं कर रहे हैं. वो 2 क्लिनिक से सर आई रिक्वेस्ट, ओम है एंड दूसरा हॉस्पिटल है, दोनों के जो एडमिनिस्ट्रेटर उनसे दरख्वास्त है कि वो इनके अंदर अपना रिकॉर्ड जनरेट कराएं. दे शुड बी जनरेटिंग दैट रिकॉर्ड एंड हैव दैट इंसेंटिव आल्सो earned from this DHIS scheme and have that digitized record for the patients. Already sir जो कॉर्डली में वो अच्छा कर रही है, they are generating 1300 plus records and their good amount of tokens are also generated. So I'll request before I go to the innovations, let's complete the task pending of HFR, HPR, and we'll request support of the councils and the doctors and the fraternity and the administration to complete those tasks on priority. This is the link. Please, can you if you all doctors can, or the professional can take a photograph of the link of on that side lms.nha.gov.in, where you can do that course and understand about ABDM, what is the advantage, how to go about it. And let's have the kiosk by the state by the end of the week, next week, to at all 4 facilities to help the patient and do that IC, not only in that area, but all the places where the people go, PDS shops and all one of stations and places that they can understand and have the advantage with the QR codes available to scan and use it. NS6 integration for the already ABDM facilities, as well as PMJ में तो हमने already direction already सर के यहाँ से आए हुए हैं कि we have to do it NS6 enabled. So आप जितनी PMJ facility हैं उन्हें NS6 हमें enable कराना है, and we have to have that submission done through a standard form through the NS6 platform. और सर एक आपसे सर रिक्वेस्ट है कि वीकली सर एक मीटिंग फॉर नेक्स्ट 4 weeks प्लस फोर्टनाइटली आफ्टर दैट टू रिव्यू सर कितना आभा बन गया, कितना डिजिटल ट्रांजैक्शन हो रहा है, सारी फैसिलिटी को बुला के सर आपके अंडर अगर ये हो जाएगा 4 हफ्ते तक सर, इट विल बी टेकिंग दैट पेस, एंड देन फोर्टनाइटली यू कैन रिव्यू एंड यू कैन allocate that work then after that. And we'll be also will request the Goa Medical College to sir increase the record linking sir. They are lacking, they're having the highest amount of PMJ outgo, but they are linking the lowest number of records, sir. So I think because you're paying it, sir, I think you can ask them they should be linking those records also and creating those records also. 2 innovations की बात मैं करूंगा. One is scan and register, जिसमें कि आप अपना एक QR कोड के द्वारा आप अपना टोकन जनरेट कर सकते हैं. आप अस्पताल में जाते हैं, उसमें जाके आप एक आपका QR कोड मिलता है, आपने आभा ऐप के द्वारा, आरोग्य सेतु ऐप के द्वारा, या कोई भी जो PHR ऐप के द्वारा आप उसको स्कैन करके अपना डेमोग्राफिक डेटा उस कंप्यूटर पे शेयर करते हैं डॉक्टर के साथ. तो पंकज कुमार अरोरा इतना मेल रेजिडेंट ऑफ सो कम्स एंड स्टोर्स इन योर रिकॉर्ड, एंड द रिकॉर्ड फाइनली गेट्स लिंक टू यू. तो एडवांटेज जो मैंने ऑलरेडी बताया आपके सारे वो एडवांटेज है कि उस एरिया की बीमारी पता लग जाती है सारी अगर होती है तो, और मेरा नाम भी पंकज अरोड़ा ही रहता है, कुछ और नहीं कर देता आदमी जो बैठा होता है. सो आई थिंक सो मेनी ऑफ यू हैव सीन दैट नाम गलत आखिरी में आ जाता है कई बार. हाउ मेनी हैव सीन दैट कि नाम भरा और कुछ और लिख दिया? कैन यू रेज योर हैंड्स? सब एक निकला बस, खाली एक ही का गलत, तो 2 3, तो अब 3 लोगों का नाम तो गलत भरा गया, तो नाम सही आएगा, आधार से आएगा, एंड द डेटा विल बी एक्यूरेट. सो दैट्स द एडवांटेज फॉर द हॉस्पिटल. और एडवांटेज हॉस्पिटल के लिए क्या है, वो बंदे को भरना नहीं पड़ेगा बार बार, तो उसका वर्कलोड कम होता है, तो उससे आप और प्रोडक्टिव काम करा सकते हैं जो काउंटर पे बैठा है. ही विल नॉट बी फ्रस्ट्रेटेड इन राइटिंग दैट नेम. ऑल्सो ही ओनली आस्क द डायग्नोसिस की, मतलब प्रॉब्लम की, बुखार है तो मेडिसिन भेज दिया, पेट में दर्द है तो सर्जरी में भेज दिया, दे कैन डू दैट. एंड वो आपके जो साथ साथ जो कियोस्क आप बनाएंगे उसमें वो हेल्प कर देगा आपको एंड दे देगा. सो दिस इज व्हाट इट डज. एक इसमें इंपॉर्टेंट चीज है कि इंटरनेट कनेक्टिविटी अच्छी होनी चाहिए, वो एडमिनिस्ट्रेशन को एश्योर करना है. सो हमें ये लगता है कि अगर वो अच्छे से अवेलेबल हो जाएगी तो ये बहुत अच्छे से पिकअप कर पाएगा. सो इट विल improve that efficiency as well as it has the data security, and consent के बिना कुछ आपका जाएगा नहीं, तो उसकी चिंता की हमें बात नहीं करनी है. कैसे चेंज लाता है ये फोटो देख लीजिए नीचे. ये भीड़ थी जब पहली बार लेडी हार्डिंग में हमने इसको लगाने की सोची थी, तो इतनी भीड़ हमने देखी थी पहली बार जाके. आई थिंक इट्स 2022 की पिक्चर. उसके 3 महीने बाद ये हाल था. एवरीबडी सिटिंग, नोबडी इज इन लाइन, वेटिंग फॉर द टोकन टू बी डिस्प्लेड. इट रिड्यूसेस द वेटिंग टाइम ऑल्सो, बिकॉज जो बंदा भरता है वो भी 5 मिनट लगाता है. पंकज अरोड़ा लिखेगा, भरेगा, फिर कहेगा अरे सुनाई नहीं दिया, दोबारा बताओ, एज क्या है, एड्रेस पूरा नहीं समझ आ रहा, अच्छा रेलवे कॉलोनी कहाँ की, तो ही विल आस्क दिस काइंड ऑफ क्वेश्चन. इट विल टेक अ लॉट ऑफ टाइम. तो टाइम 50 मिनट जो लगाता था उसके बाद 4 से 5 मिनट का टाइम फर्क आ गया, अगर 10 लोग लाइन में लगे हैं तो. दैट वाज द डिफरेंस अचीव्ड. मैं जस्ट एक वीडियो आपको दिखाना चाहूंगा, इसको आप प्ले कर सकते हैं लिंक को. तो पेशेंट जब आता है कैसे वो क्यू को पार करता है दैट क्यूआर कोड के द्वारा अपने पीएचआर ऐप से, ये पेशेंट की जर्नी कैसे इंप्रूव होती है, हम आपको ये वीडियो अभी दिखा पाएंगे. एस्केप करके आपको शायद करना पड़ेगा, पहले एक बार बाहर निकल जाइए इससे. आनंद, कैन यू हेल्प हिम? सो जो वीडियो हम दिखाएंगे इसमें कैसे ट्रांसफॉर्मेशन लाया है इन द हेल्थ केयर. आवाज चला दीजिए, आवाज चला दीजिए. वॉल्यूम नीचे.
Now you can skip the long queues at OPD counters and generate your tokens instantly. Want to know how? Continue watching. This is the OPD counters area at Government Hospital in New Delhi. Every day, thousands of patients stand in these queues to get the tokens for their doctor consultation. This is where the government scheme Ayushman Bharat Digital Mission or ABDM comes into the picture. ABDM brings to you a simple functionality of QR code based faster registrations. A patient can simply scan the QR code placed near the registration desk using their phone. Select the app from the list displayed on screen. Register or log in to share their profile with the hospital to complete the OPD registration digitally. On successful sharing, the patient gets their token number on the app. When the token is called or displayed at the counter, the patient simply visits the registration desk. The patient is asked some basic questions related to their health issues, and the outpatient slip or OP slip is given to them. The patient can now visit the doctor and complete their consultation. By skipping the long queue at the OPD counter, the patient saves time and efforts. Apart from this, under the ABDM scheme, the patients also get the benefit of digital health records. With faster OPD registration and digital health records, the patient gets dual benefits. For next consultation, they can simply walk in, take the OPD token, and share previous health records from their app. No need to carry medical files.
Thank you for that video. That clapping says it that it was effective. थोड़ी सी आई जोर से बजा दीजिए, ऐसी कोई दिक्कत नहीं है. So ऐसा ट्रांसफॉर्मेशन आया, मरीज was so happy. लेडी हार्डिंग और मे फॉर दैट मैटर गोवा मेडिकल, जहाँ भीड़ होती है ना, इट इज सच अ प्रॉब्लम. एंड जो काउंटर पे बैठा होता है वो भी बेचारा फ्रस्ट्रेट हो जाता है कि इतना सब लोड आ रहा है, सब मैं ही टाइप कर रहा हूँ. वो उनसे भी लड़ता रहता है. वो सब खत्म हो जाता है आफ्टर दिस स्कैन एंड रजिस्टर फीचर. एक और क्यू हम हटाना चाहते हैं, एंड इसके लिए आपकी मदद लगेगी क्योंकि नया इनिशिएटिव है. जो भी अस्पताल में थोड़ा पैसा चार्ज होता है, 10 रुपए 20 रुपए या कुछ भी चार्ज होता है, तो उसके लिए क्या होता है, आपने जैसे ही ब्लड टेस्ट एडवाइस किया या कोई इन्वेस्टिगेशन और एक्सरे वगैरह एडवाइस किया, फिर वो बंदा जाके या उसका रिश्तेदार जाके लाइन में लगता है कि ये 10 रुपए जमा करके आता हूँ. वो लाके फिर वो पर्ची दिखाता है, फिर वो इलाज शुरू होता है, उसका ब्लड सैंपल कलेक्ट होता है. टू डू अवे विद इट, वी हैव दैट स्कैन एंड पे फीचर which gives that advantage and that empowerment to the patient to scan the same QR code which he scanned for the scan and register feature and pay, because उसके PHR ऐप में वो ऑटोमेटिकली आता है कि 10 रुपए आपका इसका टेस्ट का ड्यू है या 300 रुपए इसका ड्यू है. वो उसको क्लिक करके सीधा स्कैन करके उस पैसे को पे कर सकता है. क्या एडवांटेज है पेशेंट के लिए? लाइन बच गई, ही सेव्स द टाइम एंड हैरेसमेंट ऑफ बीइंग इन लाइन, गेट्स द ट्रीटमेंट फास्टर. क्या फायदा है अस्पताल के लिए? कैशलेस हो गया, no cancellation needed for the cash which has been now collected. It is now in already a sheet कि कितना पैसा इकट्ठा हो गया, and the manual process is over. So it really eliminates that line and adds a feature of one more payment option to that hospital for this. So with this, I thank you all for patiently listening to me, and I hope you all register yourself on the Aarogya Setu app 2.0. Please can you have that QR code available? जितने लोग यहाँ पे हैं उसको प्लीज अभी स्कैन कर लीजिए और उसको अपने लिए यूज करिए, ताकि आप भी इस जर्नी का एज अ सिटीजन एडवांटेज ले पाएं लॉन्गिट्यूडनल हेल्थ रिकॉर्ड्स का और अपनी अच्छी हेल्थ केयर को अचीव करें. थैंक यू वेरी मच.
Thank you very much, sir, for providing us with a comprehensive overview of ABDM and its transformative vision. Your address has underscored the significance of implementing the Model District Initiative. We sincerely appreciate your guidance and leadership. And we are very grateful for the guidance and continued support of the National Health Authority in taking this vision forward. As a token of our appreciation for your time and expertise, I would like to invite Dr. Kedar Raikar, the State Nodal Officer, to present you with a small memento. With this, we conclude the morning sessions. We now break for lunch. May I request all participants to kindly return to the venue at least by 1:45 p.m. so that we can commence the afternoon program as scheduled. The lunch is arranged outside. Thank you and enjoy your lunch.
We meet by 1:45. The time is 1:15, half an hour for lunch.
You are also requested to kindly scan this QR code which is displayed and download the Arogya Setu 2.0 app. Thank you. Historically are the toughest, but the sessions that are lined up post lunch are well worth your focus. With that, we now move to an important component of the Ayushman Bharat digital mission, that is the Digital Health Incentive Scheme, that is DHIS. The scheme has been designed to encourage the adoption of digital health by incentivizing healthcare providers and facilities for creating digital health records and promoting the use of ABDM enabled services. To provide us with a detailed understanding of the scheme, its objectives, eligibility, incentive structure, and implementation process, it is my pleasure to invite Shri Arun Kumar, Regional Coordinator, ABDM, National Health Authority, to deliver the session.
Very good afternoon to all of you. Good afternoon. Good afternoon. लंच के बाद आवाज़ क्यों कम हो रही है? ये आवाज़ ही थोड़ी ज़्यादा होनी चाहिए, क्योंकि अगर हमें गोवा में अडॉप्शन को बढ़ाना है तो एनर्जी भी हमारे पास होनी चाहिए। आप लोगों ने ऑलरेडी डेटा देखा, सीईओ सर ने काफ़ी कुछ बोला, डायरेक्टर सर ने भी काफ़ी कुछ बोला, आपको डेटा दिखाया कि वेयर वी आर स्टैंडिंग करेंटली। तो वी नीड सम एक्सपेक्टेशंस, वी हैव सम एक्सपेक्टेशन फ्रॉम द गोवा स्टेट. Being a coordinator of Goa, I have 4 states more, so there are total 5 states. तो आपने कई सारी चीज़ें सुनी, आभा के बारे में, HPR के बारे में, HFR के बारे में, और आपको NSCX भी बताया गया, और आरोग्य सेतु के भी बारे में आपने सुना होगा। थोड़ा गूगल भी कीजिएगा, जिनको पता है अच्छी बात है, जिनको नहीं पता थोड़ा सा और जानिए, बिकॉज ये हमारे खुद के भी काम में आने वाला है। बीइंग अ पेशेंट, आप पेशेंट के लिए भी काम में आने वाली चीज़ें हैं। गेट टुगेदर हुआ है, HMIs प्रोवाइडर्स आपके सामने हैं, टाइम मिले तो इनसे बात कीजिए, क्या फैसिलिटीज़ वो प्रोवाइड कर रहे हैं, हमारी क्या रिक्वायरमेंट है, हम किसके साथ मैच कर सकते हैं। यू कैन गेट द बेनिफिट फ्रॉम दिस प्लेटफॉर्म। तो दिस इज़ द वन वर्कशॉप। आफ्टर दैट इस तरह की कई सारी और भी वर्कशॉप होने वाली हैं गोवा के अंदर और दूसरे राज्यों में भी। तो DHI इज़ वन ऑफ द मोटिवेशनल फैक्टर। जैसे कि खाना खाने के बाद एक मिठाई हम लोग सब लोग खाते हैं, एक स्वीट्स होता है, डेजर्ट होता है। तो डिजिटल इकोसिस्टम में अगर हम हैं तो कुछ तो हम लोग खुद से इनिशिएटिव कर ले ही रहे हैं डिजिटल एडॉप्शन के लिए। इसके साथ साथ गवर्नमेंट ने एक स्कीम स्टार्ट की थी, DHIS, डिजिटल हेल्थ इंसेंटिव स्कीम, कि हम कुछ करेंगे तो कुछ मिलेगा। तो ये जो मिलेगा आपके लिए, तो कुछ स्टार्टिंग में कुछ क्राइटेरियाज थे। ये स्टार्ट हुआ था 1 जनवरी 2023 को, आपके सामने दिख रहा है। तो कुछ छोटे क्लिनिक्स होते थे, वो बोलते थे कि साहब हमारे पास हार्डवेयर नहीं है, IT इंफ्रा नहीं है, हम कैसे डिजिटल को इनिशिएटिव को आगे लेके जाएंगे, हमारे पास ऑपरेटर नहीं है। कुछ अगर सीनियर डॉक्टर्स होते हैं, वो कहते हैं साहब हमें तो लिखने की आदत है, हमारे पास अगर एक ऑपरेटर मिल जाएगा तो बेहतर रहेगा, तो बट ये खर्चा बढ़ेगा, इस खर्चे को हम कैसे मैनेज करें। तो इस स्कीम्स का बेनिफिट यही था कि अगर ये हमें फंड अगर गवर्नमेंट देती है, तो पहले आप स्टार्ट करेंगे, स्टार्ट करने के बाद आप क्लेम करेंगे, क्लेम करने के बाद आपको जो इंसेंटिव मिलेगा, यू कैन यूटिलाइज दैट इंसेंटिव फॉर IT को। आप अपना जो इंफ्रास्ट्रक्चर है, लैपटॉप्स अगर आपको परचेज करने हैं या आपको ऑपरेटर आपको रखना है, कि मैं बोलता जाऊंगा, अगर कहीं कहीं होता है कि पेशेंट को पेपर भी चाहिए होता है और हमको डिजिटल भी करना है, तो पेपर पे भी लिख रहे हैं और वो साइड में टाइप भी कर रहा है, या वॉइस टू टेक्स्ट का भी हम बेनिफिट यूज कर सकते हैं। तो कुछ ऐसे HMIS के अंदर भी फीचर्स हैं। तो अपफ्रंट जो कॉस्ट थी उसको डॉक्टर्स के क्लिनिक पर, जो छोटे क्लिनिक्स हैं, मीडियम क्लिनिक्स हैं, उनके ऊपर ज़्यादा लोड ना आए, तो ये एक इंसेंटिव स्कीम स्टार्ट की गई। और इसके कुछ यही था कि इसको यूटिलाइज करके आप अपने सिस्टम को बढ़ा सकते हैं। जैसे कि आप लोग देखते होंगे, अगर पहले के टाइम में कुछ दुकानें हुआ करती थी, हम लोग जब मार्केट में जाते थे, एक पुराना सिस्टम होता था। और आज के टाइम में अगर कहीं जाते तो हम मॉल में एंट्री करते हैं, एक दुकानों का उन्होंने पूरा इंफ्रास्ट्रक्चर अपडेट किया, एक कंप्यूटर ऑपरेटर रहता है, आप जाते हो अपना सामान उठाते हो, पिक किया, वहाँ एक तो आपको भी जाने में अच्छा लगता है, उसने भी अपना सेटअप अपग्रेड किया। तो समय के साथ साथ अगर हम देखें कि हेल्थ इंफ्रास्ट्रक्चर को अगर हमें अपडेट करना है, क्लिनिक को अपडेट करना है, तो डॉक्टर साहब पहले बैठा करते थे और वहाँ नंबर लगाने के लिए एक रिसेप्शन पे बंदा बैठा रहता था, और लाइन लगाओ और अंदर आ जाओ, आप दवाई लेके घर चले जाओ। अभी थोड़ा सा सिस्टम चेंज करने के लिए, अगर रिसेप्शन पे कोई व्यक्ति बैठा हुआ है, आपका स्कैन एंड रजिस्टर के थ्रू आपका टोकन दे रहा है, तो आपको टोकन नंबर मिल गया, आपकी इन्फॉर्मेशन चलेगी, डॉक्टर साहब के पास गए तो वहाँ आपके नाम के, आपके आभा नंबर के अगेंस्ट डिजिटल प्रिस्क्रिप्शन दे दिया। जैसे ही उन्होंने सेव किया, आपके नंबर पर तुरंत मैसेज चला जाता है कि डॉक्टर साहब ने आपको क्या क्या मेंशन किया हुआ है। तो ये सब चीज़ें हैं, तो हमें वक्त के साथ साथ बदलना है, तो DHIS का भी आप बेनिफिट ले सकते हो। नेक्स्ट, ये जो जर्नी है, जो स्टार्ट हुआ ऑफिशियली, जो इसकी पॉलिसी स्टार्ट हुई वो अप्रैल से स्टार्ट हुई, 23 से, और अभी मार्च 26 से लेके सितंबर तक के लिए करेंटली अभी वैलिड है, चल रहा है। और आगे जो भी चीज़ें होंगी वो लीडरशिप के डिसीजन के ऊपर होगा, जो डेटा हमें मिल रहा है उसके ऊपर डिसाइड किया जाएगा फर्दर कितने टाइम में हमें एक्सटेंड करनी है, क्या इसकी एलिजिबिलिटी क्राइटेरिया है। तो बेसिक एलिजिबिलिटी क्राइटेरिया है कि कम से कम एक क्लिनिक को 100 ट्रांजेक्शन्स करने होंगे 1 महीने के अंदर। उसके बाद जो आप ट्रांजेक्शन्स करते हैं वो उसके साथ इंक्लूड हो जाते हैं फॉर द DHIS। तो ये एक इनिशियल है, कोई भी गवर्नमेंट प्राइवेट फैसिलिटीज इसको अडॉप्ट कर सकता है। इसको किस तरह से क्लेम करना है, अगर आप कोई सेशन हम लोग कराते हैं, NHA की तरफ से भी होता है, स्टेट की तरफ से भी होता है, किस तरह से आप इसका बेनिफिट ले सकते हो। क्योंकि अभी गोवा में मैं देख रहा हूँ ओनली एक ही गवर्नमेंट की जो फैसिलिटीज़ है, PSC कोलिन, उसी को इसका बेनिफिट मिल रहा है, तो वाई नॉट अदर्स, तो दूसरे लोग भी इसका फ़ायदा उठाएं। तो उसके लिए सबसे पहले आपको प्रिस्क्रिप्शन स्टार्ट करना पड़ेगा, मिनिमम क्राइटेरिया को फुलफिल करना होगा, उसके बाद ही आप उसके लिए क्लेम को अपना रेज कर सकते हैं। तो हर महीने जो भी आप ट्रांजेक्शन कर रहे हैं, उसको करने के बाद आप क्लेम रेज करेंगे, दैट इन्फॉर्मेशन हैज रिसीव्ड विद द NHA। उसके बाद आपकी इन्फॉर्मेशन को प्रोसेस किया जाएगा, इंटरनल अप्रूवल्स के बाद जो भी आपका अकाउंट होगा, उस अकाउंट में गवर्नमेंट की तरफ से आपको फंड ट्रांसफर किया जाएगा फॉर दिस इंसेंटिव, एज ए इंसेंटिव। तो अभी आप देख रहे हैं कि जो भी HMIS प्रोवाइडर है, उसकी भी कुछ कंडीशंस अपडेट की गई हैं कि मिनिमम आपको V3 कंप्लाइंस होना चाहिए, वासा सर्टिफाइड होना चाहिए। आप देख रहे होंगे लास्ट वाला जो कॉलम है, और कैटेगरी 1 और 2, दो तरह के मेन डॉक्यूमेंट है। कि IPD में क्या होता है कि व्यक्ति हॉस्पिटल में ज़्यादा समय तक रुकता है, 2 दिन 3 दिन, तो वहाँ पर आप हेल्थ रिकॉर्ड लिंक आसानी से कर सकते हैं, उसके भी कुछ चार्जेज हैं आपको, सॉरी इंसेंटिव है जो मिलेगा। प्लस दूसरा है कि जो वेलनेस और प्रिस्क्रिप्शंस और इन्वाइसेस, एज ए फार्मेसी में इन्वाइस होता है, तो ये लोग अपना जो भी डिजिटल इकोसिस्टम में हम इंफॉर्मेशन आभा के साथ लिंक करेंगे, वो भी KYC वेरीफाइड आभा। पहले क्या होता था कि कोई भी एड्रेस से अगर रिकॉर्ड लिंक कर रहा है तो उसको भी उसके बेनिफिट्स मिलते थे, बट अभी KYC हम अगर आधार के थ्रू अपना आभा बनाते हैं और उसके थ्रू अगर हेल्थ रिकॉर्ड लिंक कर रहे हैं, तो उसमें उसको फ़ायदा मिलेगा। PMJY इंश्योरेंस क्लेम लिंक्ड विद आभा इंसेंटिव पर क्लेम रिड्यूस फ्रॉम 500 to 200 और 10% ऑफ द क्लेम अमाउंट। तो ये पहले 500 रुपये था, अभी 200 कर दिया, तो 200 और 10% ऑफ द क्लेम अमाउंट। तो ये अभी करंट कंडीशंस है। कंपैरिजन प्रीवियस एंड करंट की जो पहले क्या था अभी क्या है, तो हम अभी करंट पे फोकस कर रहे हैं बिकॉज पहले का तो सिस्टम जा चुका। तो अभी जो सिस्टम है हमारा करंट पॉलिसी है अप्रैल 26 टू सितंबर 26 के लिए कि ऑल पब्लिक एंड प्राइवेट फैसिलिटीज आर एलिजिबल फॉर दैट। स्कैन एंड शेयर के लिए पहले पैसे मिलते थे, इंसेंटिव मिलता था, बट अभी वो एक्सक्लूड कर दिया गया। वी आर करेंटली फोकसिंग और फॉर स्कैन एंड पे। ये तो हमारी आदत बन गई है, जिसकी आदत नहीं है हमें उसको बढ़ावा देना है। स्कैन एंड पे को हमें इनिशिएट लेके आना है कि लोग जाएं, क्योंकि जैसे सर ने पहले बताया कि आपको यूपीआई है, आधार है, हम बेनिफिट्स ले रहे हैं। आज के टाइम में पैसे भी हम साथ में लेके नहीं चलते। मोबाइल किए, स्कैन किया, कहीं भी जाना है, कुछ भी आपको ट्रांजेक्शन्स करनी है तो स्कैन एंड पे का यूज़ करना है। सेम इन हॉस्पिटल्स की आपको पेमेंट के लिए लाइन नहीं करनी होगी। आपका जो क्यूआर कोड होगा, डॉक्टर ने जो भी प्रिस्क्राइब किया, लैब से जो भी आपको टेस्ट कराने हैं वो आपके नंबर पे पीएचआर ऐप के थ्रू आप सीधे पेमेंट कर सकते हैं जो भी आपको टेस्ट कराने हैं। अगर डॉक्टर ने 10 टेस्ट उसमें प्रिस्क्राइब किए, अगर आपको 5 ही कराने हैं तो आप 5 का पेमेंट कर सकते हैं। तो ये कुछ बेनिफिट्स हैं। तो जब भी आप स्कैन एंड पे फैसिलिटीज़ अगर यूज़ करेगी तो उसका बेनिफिट होगा। इसमें 5 रुपये ट्रांजेक्शन होता है फैसिलिटी को, और 1 रुपये जो मिलेगा पर ट्रांजेक्शन फॉर डीएससी, जो भी आप HMIS यूज़ कर रहे हैं उसके लिए। उसके बाद आप देख रहे हैं कैटेगरी 1 के लिए डिस्चार्ज समरी डायग्नोस्टिक रिपोर्ट के लिए 10 रुपये मिलेगा फैसिलिटी को, और 5 रुपये उस सॉफ्टवेयर को मिलेगा जो वो फैसिलिटी यूज़ कर रही होती है। कैटेगरी 2 में आता है प्रिस्क्रिप्शन, वेलनेस और इनवॉइस, उसमें 5 रुपये फैसिलिटी के लिए रहता है और 2.5 रुपीज़ फॉर डीएससी। तो पर डे आप जितने भी ट्रांजेक्शन्स करेंगे, जितने भी रिकॉर्ड लिंक करेंगे विद आभा, तो आपको इसके अकॉर्डिंग आपकी कैलकुलेशन में जो भी अमाउंट होगा वो आप क्लेम कर सकते हैं। 10 rupees for the HIU and 5 rupees to the HIP health information user and ये health information provider। तो होता क्या है कि रिकॉर्ड तो बनते जा रहे हैं, हमारे आवाज से लिंक हो रहे हैं, बट वी आर नॉट फैचिंग दैट रिकॉर्ड्स। डॉक्टर के पास गए तो डॉक्टर को भी पूछना होता है कि पुराना प्रिस्क्रिप्शन क्या था। वो जब कंसेंट रेज करेंगे जिस HMIS से करेंगे तो उसके लिए भी कुछ पैसा है, सो दैट कि ये हमारी प्रैक्टिस हो जाए। सिर्फ रिकॉर्ड बनाते बनाते गए बट हमने उसको यूटिलाइज नहीं किया, हमने उसको यूज़ नहीं किया, पेशेंट को भी पता नहीं है, तो उसकी अवेयरनेस बढ़ेगी कैसे। तो ये हमें दोनों काम करने हैं। उसके बाद आप देख रहे हैं कि मैक्सिमम लिमिट इसमें 5 CR है, एक्सेप्ट इंश्योरेंस क्लेम वेयर इट इज केप्ट एट 1 CR पर एंटिटी। तो मैक्सिमम आप 5 करोड़ तक का क्लेम कर सकते हैं रेट। तो ये बहुत बड़ा अमाउंट है, क्योंकि अभी गोवा में कोई भी ऐसी फैसिलिटी नहीं है जो इस रेंज को अचीव कर पाए, तो हमें आगे बढ़ना है। नेक्स्ट है, आप देख रहे हैं कि टाइमली सबमिशन ऑफ यूसी। होता क्या है कि पब्लिक फैसिलिटीज़ में हमें क्लेम तो मिल गया, इंसेंटिव हमें मिल गया, लेकिन हम उसका यूसी प्रोवाइड अगर नहीं कर रहे हैं तो आप नेक्स्ट क्लेम के लिए एलिजिबल नहीं होते हैं। तो आपको जो पैसा मिला है आपने यूटिलाइज करना है। तो बीइंग अ पब्लिक डिपार्टमेंट, पब्लिक फैसिलिटीज़, आपको उसका यूसी भी डिपार्टमेंट को देना होगा, सो दैट आप नेक्स्ट क्लेम के लिए एलिजिबल हो जाते हैं। लास्ट है कि फैसिलिटीज़ में 200 और 10% ऑफ द क्लेम विच एवर इज द लो टू डीएससी 10 रुपीज़ पर क्लेम। तो पहले जो 500 रुपये आपको मिल रहा था थ्रू NSCX का, अगर आप क्लेम करते हैं तो अब 200 रुपये या 10% ऑफ द क्लेम अमाउंट। तो यूटिलाइजेशन लेटर इज रिक्वायर्ड फॉर द पब्लिक फैसिलिटी। तो 1 लाख से अगर आपका कम है इंसेंटिव तो आपको कोई यूसी देने की ज़रूरत नहीं है। तो पहले हमारा टारगेट है कि हम 1 लाख तक अपना क्लेम रेज करें। इसके लिए आपको बहुत मेहनत करनी होगी, बहुत सारे रिकॉर्ड्स लिंक करने होंगे। उसके बाद सेकंड, अगर हम देखते हैं अगर हमारा क्लेम 1 लाख से 50 लाख तक पहुंच जाता है तो आपको 25% का यूटिलाइजेशन देना होगा, सो दैट आप नेक्स्ट क्लेम के लिए आप उसको इनिशिएट कर सकते हैं। थर्ड पॉइंट, अगर 50 लाख से अगर ज़्यादा होता है तो आपका 75% यूटिलाइजेशन होना चाहिए। और आपको ये ज़रूरी होता है बीइंग ए पब्लिक डिपार्टमेंट, पब्लिक फैसिलिटी, कि आपको जो भी पैसा गवर्नमेंट से मिल रहा है आप उसका यूसी प्रोवाइड करें। अभी करंट स्टेटस अगर हम देखें तो गवर्नमेंट की जो मैं बता रहा था, PSC कोरली में इज ओनली 1 पब्लिक फैसिलिटीज़। जो हमारे पास 323 फैसिलिटीज़ हैं, 323 फैसिलिटीज़ हैं, तो उसमें से सिर्फ एक ही है। तो Y1, तो रिमेनिंग्स जो भी हमारी फैसिलिटीज़ हैं, PSC हो चाहे डिस्ट्रिक्ट हॉस्पिटल हो, तो सभी लोग HMIS को यूज़ करें और इस क्लेम का बेनिफिट उठाएं। प्राइवेट में ओनली 10 ही क्लिनिक हैं, तो वो भी छोटे छोटे क्लिनिक्स हैं जो इसका बेनिफिट ले रहे हैं। तो अमाउंट भी बहुत ज़्यादा नहीं है। तो उस अमाउंट को अगर हमें अचीव करना है मिनिमम 1 लाख वाला, तो मेहनत करनी पड़ेगी। तो ये हम क्लेम कर सकते हैं। इसका बेनिफिट, आप इंटरनेट की कनेक्टिविटी है, आपको ऑपरेटर लगाना है, अगर आपको कोई भी इस तरह के IT से रिलेटेड या आपको कोई भी हेल्प चाहिए तो आप इस फंड को यूटिलाइज़ कर सकते हैं। इंटरनल कैपेसिटी बिल्डिंग, रिफ्रेशर ट्रेनिंग, जो भी सिक्योरिटी गार्ड, एक मोटिवेशनल आप मंथली एक रिव्यू कर लीजिए। तो एक मोटिवेशन जब फैक्टर मिलेगा तो आदमी काम करेगा। तो ये वही मोटिवेशनल फैक्टर है फॉर द फैसिलिटी, फॉर द प्रोफेशनल्स, कि आप इस फंड को, इस स्कीम का उसको यूज़ करें, इसका बेनिफिट लें। थैंक यू वेरी मच फॉर द स्मॉल प्रेजेंटेशन। इसके बाद आई रिक्वेस्ट टू आनंद सर आप आएँ और एक हमारा एक छोटा सा प्रेजेंटेशन है एबीडीएम इंटीग्रेटर्स जर्नी के लिए कि किस तरह से इंटीग्रेटर्स एबीडीएम सिस्टम में आते हैं, क्या चैलेंजेस फेस करते हैं।
So before Anand comes, just I'll address the gathering on the previous 2 slides. Please मोबाइल छोड़ के थोड़ा सा इधर ध्यान दें. व्हाट्सएप घर पे भी चेक कर सकते हैं सब लोग. ये आज आए हैं तो हम लोग थोड़ा सा सुन लेते हैं. बहुत इंपॉर्टेंट चीज़ है, आपका बहुत फायदा किया बिकॉज ये पैसा अनटाइड है. अनटाइड मीनिंग इट कैन बी यूटिलाइज्ड बाय योर फैसिलिटी फॉर बाइंग अ कंप्यूटर फॉर द डॉक्टर, द स्टाफ, टैबलेट्स, ऑल काइंड ऑफ थिंग्स यू कैन थिंक अबाउट. इंटरनेट. PSC कॉर्डलिम से कौन है? कॉर्डलिम कैन कम ऑन इन द फ्रंट प्लीज. आ जाइए कॉर्डलिम वाले, आगे आ जाइए प्लीज. यहाँ स्टेज पे आ जाइए प्लीज. ताली बजाइए भाई, सब आ रहे हैं. कॉर्डलिम वालों ने अच्छा काम किया बहुत. प्लीज. ये जो 59,995 रुपीज है इन्हीं का है सारा. आप लोगों ने किस दिन लिया? देखो गलत बात है क्योंकि these are the champions and should learn from them. आपने किस चीज के लिए इस्तेमाल किया वो पैसा? वो
हमने रिचार्ज के लिए किया, इंटरनेट रिचार्ज, वाईफाई.
So they bought the internet Wi-Fi on their own. Untied fund है. डॉक्टर जो वहाँ का इंचार्ज है उसके यूटिलाइजेशन का पूरा अथॉरिटी है. पीछे करना स्लाइड. सो अभी ये लोग खाली रिकॉर्ड लिंक कर रहे हैं, अभी लैब इंटीग्रेटेड नहीं है अनफॉर्चुनेटली. सो वो पैसा लूज कर रहे हैं. और पीछे एक पीछे करो. यस प्लीज सी द ब्लू पार्ट. एवरीबडी जो CSC से हैं, PSC से हैं, हाथ खड़े करें प्लीज. सब पैसा छोड़ रहे हो अपना. आप अपना कंप्यूटर खरीद सकते थे अलग से सरकार के अलावा. कितना आपके यहाँ कितना? एक CSC सर प्लीज, आपने खड़ा किया हाथ. एक बार आप प्लीज सर, कैन यू गिव द माइक टू सर? एक माइक दीजिए सर को. सो आपकी CSC में कितने पेशेंट आते हैं? जरा पूरा बना लीजिए. कितने पेशेंट आते हैं, कितनी इन्वेस्टिगेशन होती है, सब होता है. PM जैसे भी. कौन सी CSC है सर? कितना पैसा PM जैसे आ रहा है?
PMJY के अंतर्गत हमको ऑप्थेल्मिक OT जो है या कैटरेक्ट सर्जरी होती है उसका पैसा आता है.
सो यू गेटिंग सम अमाउंट ऑफ मनी. एक तो पहली बात, वो पैसा आप डिजिटल हेल्थ के लिए यूटिलाइज कर सकते हैं. इसका सर्कुलर हमने निकाल दिया है, तो आपको इस्तेमाल करने का अधिकार है. आप एक बार सेक्रेटरी साहब से बात कर सकते हैं. दूसरा, कितनी OPD होती है आपके यहाँ पर डे?
अराउंड 250 to 300.
ठीक है, 250 to 300. पहले 100 के लिए इसने बताया पैसा नहीं देंगे हम. बाकी 150 पहले दिन का, और बाकी अगर 25 दिन मान लें, 25 × 25 है 625. तो 625 2 जीरो और लगा दें तो करीब 2500 OPD ना बोले तो पर मंथ 250 पर डे.
हाँ, पर डे
5 रुपए के हिसाब से आपका हो गया 10,000 12,500 पर डे. 20 दिन 25 दिन लगा लो, जोड़ लो सर. 3 लाख रुपए हर महीने का आपने ऐसी तैसी गवा दिया बस खाली. उससे कितना पैसा कमा सकते? जस्ट इमेजिन द अमाउंट यू आर लूजिंग. 5 rupees for the prescription, and if you scan and pay, 5 rupees for every scan and pay, and you integrate the lab record, 10 rupees for every lab record, and because आपके IPD भी होता है,
हाँ,
10 rupees for every discharge. Just calculate. अपने कैलकुलेटर सब खोल लीजिए, अपना अपना निकाल लीजिए. कितना कितना निकल रहा है किसका? मैं अभी एक दो से और पूछूंगा. कौन बता रहा था इधर? CSC से कौन था? वन मोर या बताइए, कितने आपके CSC में पेशेंट हैं? OPD
डेली OPD इज अराउंड 250 to 300.
3 लाख रुपए सभी खो रहे हो यार. मतलब इतनी सारी CSC हैं यहाँ पे. 6 CSC हैं, if I'm right, 6 CSC, and they are losing 3 lakhs a month. We are ready to give it. We have the funds. Why don't you take it? First of all, you have to register. You are not registered, right?
No, we are registering the patients.
नहीं, not the patients. ये हैं DHIS के registered champion. So आपकी जिम्मेदारी है. You have to register all CSCs, all PSCs on this thing. 2 हफ्ते के अंदर. 2 हफ्ते का टारगेट है सर. नहीं, आनंद कम. तो आनंद will be there with you. I am deputing one person. He will be responsible to help you get register all things, all people on this platform. 3 लाख रुपए महीना कम थोड़ी है. आप सोचो, आप जो कहते हो कि मेरा इंटरनेट नहीं आ रहा है, मेरे यहाँ लैपटॉप नहीं है, डॉक्टर को नया अच्छा लैपटॉप लेने का अधिकार नहीं है ना? दिलवाना है आपने, है ना? देखो निकला दिल से भी, तो आपको दिलवाना है. इधर कहीं से तो आई आवाज. सो आई एम सेइंग प्लीज बाय गुड हाई क्वालिटी लैपटॉप्स, i7 वगैरह वाले, ताकि वो डॉक्टर भरे तो फास्ट भर पाए. डॉक्टर की अगर आप समस्या को बढ़ाएंगे कि भाई ये लिखो भी और भरो भी, तो गलत है ना. डॉक्टर्स डे के दिन बात ही करना गलत है उसकी. तो अभी आपको ये करना है, जिम्मेदारी आपकी है. रेडी होना है. रेडी हो कि नहीं? ये तो यार, लेकिन अब उसको चैंपियन बना दिया, फोटो इसी का छपेगा. सो केदार जी हैं, तो डॉक्टर साहब हमारे जो SNO है, ही विल बी टेकिंग द चार्ज देन, एंड यू विल बी अर्निंग अ गुड अमाउंट, 6 CSCs, at least 3 lakhs each CSC, 24 PSCs if I'm right. So they will earn 60,000. तो सर क्या 11,000 रुपये पर मंथ का मैंने पूरा चार्ट निकाला, तो 11,000 पर मंथ निकाल रहे हैं, तो 11,000 वो PSCs कर सकती हैं. यू कैन, एंड देन हॉस्पिटल्स विच आर देयर, जो आपके डिस्ट्रिक्ट, सब डिस्ट्रिक्ट एंड डिस्ट्रिक्ट हॉस्पिटल हैं, जो कि PMJ में करीब करीब 1 करोड़ रुपए, 1.3 करोड़ ऑलरेडी कमा चुके हैं, कुछ 90 लाख कमा चुके हैं. दे कैन ऑल्सो अर्न अ lot of amount from the DHIs. So please note these things. Take a photograph, please. I'll request all CSC people to take a photograph and PSCs कि ये कितना कहाँ, और आपने कैलकुलेट करके शाम को SNO साहब को बता देना कि मेरा इतना नुकसान हो रहा है, ताकि SNO साहब आपको पैसा दिलवा पाएं. एंड आई थैंक यू ऑल फॉर इफ यू पार्टिसिपेट एंड गेट रजिस्टर्ड. इसका रजिस्ट्रेशन प्रोसेस समझा दिया तुमने, तो ये आप लिंक शेयर कर दीजिए सर को कि रजिस्टर कैसे करना है, और आप साथ में लग के करा दीजिए सर के साथ. ठीक है, थैंक यू. आनंद, यू कैन कंटिन्यू.
Okay. Thank you, Arunji, for breaking down the mechanics of the Digital Health Incentive Scheme. Securing these incentives is a massive win-win, helping us offset technology costs while elevating our standard of care. As a token of our appreciation for your time and expertise, I would request Ms. Ruchita to kindly give a memento to Arunji. So we have another small session on ABDM integration by Shri Anand Joshi. Thank you.
Thank you. Thank you, sir, that you have set the context and the tone that you can earn a lot of money, which, like us again, being, if you become ABDM enabled, right? तो आप वो सारा पैसा, मतलब हमें जो गवर्नमेंट का पैसा है, that you can utilize to provide better healthcare and to enhance the facility at your healthcare facility itself. So in order to start with, so taking a cue from the morning session, right? जहाँ पे सुबह सर ने बताया था, CEO सर ने भी, पंकज सर ने भी एक्सप्लेन किया था कि हाउ लाइक अस अगेन पेशेंट जब आता है फैसिलिटी के अंदर, तो व्हाट ऑल आर द टच पॉइंट्स. एंड इन द मॉर्निंग वी हैड ऑल्सो डिस्कस्ड अबाउट द टेक स्टैक, कि हमारे पास में ABDM के 3 की गेटवेज हैं: HICM, Health Information Exchange and Consent Manager, second is UHI, Universal Health Interface, and third one is NHCX, National Health Claim Exchange. So just taking a journey out of it, if there is a patient, अगर मैं, if I'm traveling here, right, and I need to discover, I have a medical exigency and I need to discover a doctor, so I would be able to discover doctor nearby, my nearby hospital, nearby doctors, using UHI, Universal Health Interface. That is an application which allows us to discover the nearby medical services. It can also extend up to ambulance booking as well, blood bank services also. Second to it, I would be able to register it quickly using, because I have my Abha, तो मेरा आभा बना हुआ है, तो मैं उस आभा से अपनी डिटेल ऑलरेडी शेयर कर चुका हूँ, एंड आई वुड बी एबल टू पे द कंसल्टेशन फीस इफ दैट इज देयर यूजिंग स्कैन एंड पे, right? These are the various use cases that is again very tightly integrated with all the patient journey in order to provide a smoother experience and provide a better quality care. अगर हम बात करते हैं टेली कंसल्टेशन के लिए, तो फ्रॉम डिस्कवरी इटसेल्फ पे करके आगे हम कंसल्टेशन बुक भी कर सकते हैं. देन देर इज एंड बाय द टाइम माई कंसल्टेशन, डॉक्टर राइट्स मी अ प्रिस्क्रिप्शन, आई वुड बी एबल टू सी द प्रिस्क्रिप्शन इन माई हेल्थ लॉकर, बिकॉज इट इज ऑलरेडी इंटीग्रेटेड विद माई आभा. सो Arogya Setu comes up with a default health locker, that is DigiLocker, right? So I would be able to access my record then and there itself. The moment doctor writes the prescription, it submits in the system, और वो मेरे पास से मेरे आरोग्य सेतु लॉकर में भी accessible होता है उस पेशेंट के लिए. Given the scenario कि now I have my prescription with me, right? There can be two cases. Either I will go for a diagnostic test, or I would be heading toward the pharmacy to get my medicines dispensed. So the beauty of this ecosystem is that I would be able to share my health record, the prescription also, with the pharmacy or maybe diagnostic lab, whatever that is applicable. And I would be able to make a payment then and there itself using scan and pay. This is again one of the use case that enables you this thing. And ये सारे use case जो हम बता रहे हैं अभी, उसी के अंदर से सर ने बताया अभी कि scan and pay के अंदर there is an incentive that is linked to it. If you write a prescription, there is an incentive that is linked to it, right? And that is applicable for the facility as well as for the DSCs also. By DSC, I mean to say कि जो solution provider आपका है, be it HMIS, LMIS, PHR application और pharmacy के लिए softwares जो हैं, उन सब के through they will also get a amount into it. Then coming to the inpatient part, we can leverage our National Health Claim Exchange Gateway. That is also part of it. And this is where the ABDM as an ecosystem helps you to provide a better experience to achieve operational excellence as well as in terms of efficiency optimization also. So these, as on date, we are having 502 partners that are already integrated. That is distributed amongst the national health programs as well as the government programs, government HMIS, and we do have the private players also. And 2000 plus, they are already in the process of integrating, right? So we do have a very robust integration support mechanism in order to help all the partners, all the stakeholders who want to get on board on the EBDM ecosystem. We enable, we do have several support mechanism also, which we are going to cover in the subsequent slides. So just to take an example, like us कि 502 लोगों ने जो अपना ABDM में onboarding हुए, right? So there are two use cases like us for the healthcare facilities. Either they are already having like us a digital solution. So there are two ways to look into it. The first way is register on the Sandbox portal, right? You will get the access and then you start integrating it. There are other ways also. There are ABDM connectors that are already available listed on our portal itself. You can onboard them, ask them to make your solutions ABDM enabled. That is also a possibility out there. In case if any facility that is not using any solution, they can actually procure ABDM enabled solution. And these are the key value offering like us that we are listening from the morning itself. So I will quickly move to next slide. So as I speaking about like us, this is for the healthcare facilities, and when it comes to DSC part, so there is a provision, there is a mechanism wherein which you go to sandbox.abdm.gov.in and you click on, you need to hit on the register now, right? The moment you click on register now, the application will come. The application will come to a committee. There is an evaluation mechanism where this is the life cycle of the integration. So you will get the access keys. You start the integration. Once the integration is completed, then you have to go to functional testing, the security testing, and then HTC committee that reviews it. So this entire ecosystem, if we have to come from the integration point of view, it is again distributed amongst 4 milestones. M1, we call it like as creation and verification of ABHA, where we are trying to validate one of our key registry that is for the citizens, ABHA, so that we would be able to tag the health record with the concerned individual. M2 is about creation of health records. We are having 8 different type of health records that are being acknowledged by the ABDM ecosystem, starting with the consultation, then discharge summary, then invoice, then wellness, health record. So, and followed by like us again, there are 3 more, right? So this is about once my health record is getting generated, if doctor writes me a prescription, then it will get linked to my ABHA address and then it will be exposed to entire ABDM network itself. M3 is like us, if I have to go there, if I'm getting into a consultation and doctor asks me to share my previous record to in order to like prescribe me further, then M3 enables the facility or doctor or a solution to fetch my record, given that it requires my consent also. It's a consent driven mechanism. We are taking patient as a center. So now the data belongs to patient itself. So that is why patient will be able to provide consent using PHR application. And the milestone 4, when talking about the HFR, so it given that in your existing system, you keep on onboarding the doctors or the healthcare professionals through your system itself, the verification as well as the creation of HFR, that is also happening through APIs. So these, in order to like us expedite the integration support, we do have the support mechanism wherein which we would be able to provide you dedicated support itself. We do have a ticketing management system where we do adhere the SLA, right? So that is also available. We do offer like as the integrator workshops as well. As sir have mentioned, like as in case if you want to come, we would be able to get into like as a conference room and 2-day workshop where it will technical workshop. We will be working back, our team will be working back with you in order to get the integration done. We will close it then and there itself. So this is again one of the practice which we are doing like from last couple of months, and it's being very fruitful. And we do publish our calendar, like as there are several virtual sessions that keep on happening. So the information is already available on the Sandbox portal itself. We do publish the monthly calendar, what all sessions that we are going to take. Plus, there are certain expectation in order to achieve it. We do expect like us from the partners who are integrating with us. So typically it take 3 to 5 weeks of effort in order to complete the entire journey. किसी का भी सॉल्यूशन अगर नहीं इनेबल तो उसको हम 3 से 5 वीक के अंदर कंप्लीट करवा देते हैं, गिवन दैट कि यू फुलफिल दिस क्राइटेरिया. वी नीड डेडिकेटेड टीम आउट देयर. यू मस्ट नीड टू हैव अ टेस्ट इन्वायरमेंट. एक पीरियोडिक रिव्यू जो है अपडेट वो हम करते रहें. You are able to, like us again, we need to get into like us there are certain mechanism which to follow, जहाँ पे periodic review होते हैं, आप progress update करते हैं, and if we get into these calls, so we will be able to provide you the right support, because this is something what we are doing for more than 2,000 integrators, right, which is distributed across PHR, HMIS, LMIS, your pharmacy solutions, and so clinic management systems also. So this is what we are doing. This is again a quick the entire documentation that you require in order to start integration with, that is already available on this portal. That is our Sandbox portal, public domain itself. You sit on the documentation part, and then there is a step to step. Again, if you see like a milestone 1, milestone 2, milestone 3, PHR application, so that is already over here. It also do have the information about the UHI and NHCX, and there is I would like to request one thing. There is a tab over there, contact us ke nahi paas mein, support tab hai, right? So if you have any query, right, please click on the support, and you will be, it's a ticketing management system that I was mentioning earlier also, so which is SLA driven itself, so we have to adhere to it, so you will be getting a faster response. Plus, we also do like as the onboarding workshop, like as previously we used to do once in a month. Now we are doing like as in every fortnight, every 15 days that we are conducting. So whomsoever integrators are registering on it, so we give them orientation, and we do have a ready Reconner project plan kind of a thing. If you follow that, so we would be able to expedite the process. So in case if you have any questions, so feel free to ask. Otherwise, I would conclude here. Thank you. Thank you, sir.
Thank you, Shri Anand Joshi. So Anand Joshi is the network operation team lead with the National Health Authority. As a token of our appreciation for your time and expertise, I would like to request Ms. Divya Walke to present Mr. Anand Joshi with a small memento. We now move to the next session of the program, a live demonstration of the Hospital Management Information System. The HMIS is an important digital health solution that streamlines hospital operations, enhances service delivery, and supports efficient patient care through integrated digital workflows. Our state has been using the CDAC HMIS platform, that is eSushrut, to support digital transformation in healthcare facilities. To take us through the demonstration, I have the pleasure of inviting Shri Uday Singh, Scientist E from Center for Development of Advanced Computing, that is CDAC, to the stage. Please.
Very good afternoon to everyone. So, yeah. Since time is limited, I'll run through the slides what I have, and at the end I will just show you the video, right? Demonstration will take time, but we were aware that during the shortage of time, we might run the video as well, right? So one after the other, I'll be running it, right? So as everyone knows, the e-Sushrut HMIS exists in Goa state since 2022, and we have already done DH, SDH, CHC, and PHC. Or thinking of that, where the clinics, small clinics, where the manpower is very limited, right? 2 or 3 people just run the show. One doctor, one data entry operator, and one pharmacist. So in that case, a bigger HMI solution is not needed. So in keeping that, we have developed one very lightweighted HMI solution. We call it e-Sushrut Clinic. And on 29th of last month, our Honorable Health Minister have just launched this application. So just run through this slide, and lastly, I'll do that. So, hello, am I audible, right? Means for whom we have done this, right? So basically, clinics and the smaller healthcare facilities, as I've just said, who are running this show. How many private practice like clinic are here? No one. Private. Yeah, fine. Only 2, right? So fine. So sir, you can have a look, right? It's a very 2 or 3 steps process. So facility with limited manpower and facility with limited infrastructure. So what are the key feature of it? All the big HMI solution feature we have integrated in this part. That is M4, that is health professional ID can be created, HFR can be created. Online appointment can be done through this. Again, ABA based appointment. A person who has ABA can take an appointment directly, or this particular application can generate his ABA address and ID as well. Role-based user, again, single HPR doctor can create a role of his doctor, and general user he can create for his data entry operator as well as nurse. Electronic health record linkage is there, is complete paperless. Registration, OPD doctor is linked to the PHR app. This particular application is M1, M2, M3 as well as M4. Right, added advantages. A lot of applications is M1, M2, M3, but we have M4 all as well. CDSS, it is backed by AIMS Delhi, Clinical Decision Support System, on the basis of vitals captured during the examination. Suggestive drugs and the diets can be given to. He can change, doctor can change, but it's a suggestive value. Benefits of HMIS Lite is, again, it's affordable. It's when you take it, it's $299 per month for 5 user. User friendly, very easy to use, efficient and future ready, data security, and normal subscription. Currently, it is right now it is free for 3 months. When you onboard it, three months is there. Our team is sitting over there, will help you to onboard your clinic. So these are the features, like appointment management, patient registration, doctor, clinical decision support system, issue tracker, laboratory, pharmacy, and individually I'm running through it. Appointment means you can schedule the appointment, cancel it, reschedule it again. Patient registration, direct, again, is ABA based, 30 to 15 to 30 seconds it will take. If you have ABA, all the data is fetched from your Aadhaar. Doctor desk, we have again voice to text. When a doctor and patient is conversing, right, all the details being captured and populated to our doctor desk. CDSS, I've already verified, right? Clinical decision support based on the vitals captured. Issue tracker, a particular clinic can log his issue. मेरे से ये नहीं हो रहा, तो our team will get back to you. Laboratory management is again sample collection, acceptance, rejection, validation, and report printing. Pharmacy, when the doctor prescribes, the same RX is available at the pharmacy desk. So he can take the, if integrity is also is done. One of the clinic has requested for the billing model for how many charges are being done. So X-ray 500, right? We are coming with this also. Very soon we will be doing with billing model as well. Appointment can be booked, right? Again, what I've said is appointment is purely ABA based. If a patient doesn't have ABA, he can create his ABA, then appointment can be done. Choose the appropriate department, doctor data, time slot, and consultancy fees. Successful booking, user is receive a confirmation on his mobile and he can walk to his clinic. Again, how to skip the line? Scan and share. Scan, skip the line, go to the registration counter. All the data is being fetched. I mean, sir has already briefed in the morning how to skip the line. It's a, I mean, 10 minutes task is completed in 1 minute. Why to wait in time? What I've said, it's an ABA based registration. You can do the mobile number, ABA address. And this is new ABA creation. Now we have created two factor, that is biometric and face authentication. Recently we have done this also. So biometric से भी जल्दी हो जाएगा, face authentication भी जल्दी हो जाएगा. The previously available feature तो थे ही थे, ये हमने recently add किया है. Registration module, as a patient can register through the ABA, patient revisit facilities there, follow up, what we called. Registration can be cancelled, reschedule, right? As per patient sitting at home, he can do. Slot book कर लिया, चला मैं नहीं जा रहा, I have some urgent. He can reschedule. That feature is there. काउंटर में हमने उनको फैसिलिटी दिया कि डुप्लीकेट प्रिंटिंग का दे रखा है, इफ नीडेड उनको हार्ड कॉपी पे ही चाहिए तो. डॉक्टर डेस्क है कि again it's a complete digital part, right? So you can bookmark the prescription, fever, cardiac arrest, or orthopedic. Like recently I visited one of the clinic in Arunachal. He has 25 bookmarks, all pediatric. One effort was there, but he done that. In another clinic, I have 100 bookmark available, and what the doctor has done, अपना बुकमार्क उसने टेबल पे रख लिया, सीरियल 1 to 100, एंड साइड में एक इंडिकेटर डाल दिया था. इफ दिस कम क्लिक खत्म, 1 to 100 bookmark was there. So bookmark is a very like best feature in our doctor desk. You can bookmark the drugs, investigation, 3 you can bookmark. So life is very easy. On single click, everything is loaded, and according to the patient condition, you can tweak that. But one of the doctor had made 100, and भले वो intern से कराया, लेकिन verify he has to do. Again, his signing has to go. Again, laboratory management, doctor desk के ही investigation raise हो सकता है, right? And sample collection area में जाएंगे, collect. If it is rejected, reject, right? दो ही option होते हैं वहाँ पे. Then validate, approve, and print. All are safe. Pharmacy, doctor ने जो दवाई दी, that particular RX is visible at the pharmacy counter also. He had just say the only his unique number. All the prescription is seen as the screen. So जो stock में available he can issue, and जो नहीं है he can just do away with it. बाहर से वो ले सकते. Ideally maximum cases में मिल ही जाता है. Again, it's a consent based. Our application is consent, right? अगर हम दूसरे क्लिनिक में जाएंगे, it's a consent based application. जब तक वो consent नहीं देगा, तो डॉक्टर साहब हमारा नहीं देखेंगे. Ideally, this should be done. If I'm sitting in Goa, right? I'm coming from Delhi. So आज मेरे को कहीं visit करना है, तो कहीं अगर मेरे को high BP है, तो उनको पता नहीं ना मैं कौन सी दवाई ले रहा हूँ. I'm unconscious. Like मैं उनको बता सकता हूँ कि सिलागा 10 ले रहा हूँ या एल्पेडिपिन ले रहा हूँ. उनको पता कैसे लगा? मैं past history. If I give the consent. So you have to इसकी like advantages आपको समझना है. इसकी is a very powerful this M3 consent management. अगर आप ये करेंगे तो नो नीड ऑफ कैरिंग द हार्ड फाइल विथ यू, सिंगल मोबाइल ऐप, आप कोई भी PHR ऐप से आप पुल कर सकते हैं रिकॉर्ड। फॉर द टाइम बिंग स्लॉट होता है 30 मिनट्स 15 मिनट्स, यू कैन शो। सब प्रिस्क्रिप्शन आइडियली 1-2 देख सकते हैं। This is the health information type. Prescription we have done, diagnostic report, OPD consultation, immunization record, health document, wellness record, and invoice. These all are the records can be seen at the PHR app. Right now we have OPD doctor test RS, PHR हो सकता है, investigation हो सकता है, IPD का जो IPD summary है वो PHR app में link हमने कर रखा है, इसमें होगा। Again, the technical support, right? We have L1, L2, L3. If first level is at NHA, they will solve the, you call the toll-free number, they will solve your issue. If issue is not solved at the end, there is again reported to the CDAC team, they will solve within 24 hours to 40 hour escalation. Within that, we have also SLA, so keep on escalating. Every day in the morning, 10 o'clock, we have an issue list. We discuss on it. Iska kya hua, kiska nahi hua. On priority, we close everything. If you want demonstration, right, I'll share you the number after this session, right? We'll have one word, then I'll show you the demonstration as well. This is our toll-free number, email ID, and portal URL, right? And after the session also, I'll give you the number. I have a small video play for you, right? How it is being done, how we onboard the clinic and all. So please, I request run the video, please.
Welcome to eSushruth at Clinic, a lightweight health management information system, HMIS. Solution developed by Center for Development of Advanced Computing, CDAC, with support from National Health Authority, NHA. It is transforming the way small and mid-sized healthcare facilities work. From quick patient registration to hassle-free appointments and secure electronic health records. In the next few minutes, we'll guide you through the complete process of creating an account on eSushruth at Clinic, setting up a facility, adding users, package selection and subscription details. To begin, visit the official website ehmis-lite.in. Click on the Sign In tab and choose to create a new account. You can register either using your Health Professional ID HPID or your Health Professional Number HP number. HPID is a unique 14-digit health identification number for doctors and nurses, serving as a repository for verified professionals across various systems of medicine delivering healthcare services throughout India. If you don't have an HPID, the platform allows you to generate one quickly through Aadhaar-based OTP verification. Once HPID is validated via OTP, the system will display your HP details and the facility linked to your ID. User can select the multiple facility from the list, confirm the details and move ahead to the next step. Facility setup and package selection. Before proceeding to the next step, the user first reviews and agrees to the terms and conditions and privacy policy. Once accepted, an OTP will be sent to your registered mobile number for verification. Enter the OTP to proceed. Next, click on the Facility Setup tab and click on Facility Setup and Package Selection tab. Here, select the facility and the facility details will be auto-populated in the respective field. Now, choose a package for the facility. Currently, only a free trial package is available. After this period, you can upgrade to a suitable package as per your needs. After facility setup, the next step is creating users and assigning roles. Start with health professionals. Enter their HPID. Validate it with OTP and the system will autofill the HP details. Now, the admin selects the user specialization under the department and enters room number, room description, and user role as doctor before adding the user. The admin can assign multiple roles such as doctor, nurse, or registration clerk. For non-medical, login credentials can be created under generic category by entering user's name, mobile number, and email ID, and assigning the role such as registration clerk or pharmacy clerk. Users' login credentials will be sent directly to the registered email ID. From here on, health professionals can log in with their HP ID and OTP authentication, while generic users can log in using their username and password. This ensures both access and smooth management of facility operations. And that's it. In just a few simple steps, you can register, onboard your facility, and create roles for the facility staff on the e-Sushruth at Clinic platform. Thank you for watching.
So this was the onboarding your clinic. Now, like registration OP doctor, as per your roles and responsibility, you can assign and start using this application. It's as simple as that. 15 minutes onboarding, another 15 minutes starting it, right? So with this, I like to end my session here. Thank you.
Thank you, sir. I'd like to invite Ms. Ruchita to present a small memento as a token of our appreciation. Next, we move on to the next demo by the NIC, that is the National Informatics Center. The NIC has been contributing significantly towards digital initiatives and supporting the development and implementation of e-governance solutions. I now invite Shri Ravindra Kumar, Deputy Director General NIC, to kindly deliver the demonstration and share their insights on the digital health platform.
Good afternoon, everyone. आप लोगों ने सुबह से जो EVDM के बहुत सारे प्रेजेंटेशन देखे एंड अभी ई-सुश्रुत का भी देखा, तो हम लोगों का जो NIC का जो HMIS है, HMIS सब एक जैसे ही होते हैं, ये भी वैसा ही है, सारी फंक्शनलिटी सेम ही है. मैं कुछ अभी तक जो अचीव किया है या जो हमने इसमें क्या क्या फीचर्स हैं उसके बारे में थोड़ा सा बताऊंगा. नेक्स्ट स्क्रीन पे. So yeah, next. So actually this application next gen e-hospital जो पहले एक एप्लीकेशन था e-hospital जो पिछले 15 साल से 20 साल से NIC ने डेवलप किया था. एम्स दिल्ली में चलता है और बहुत सारे हॉस्पिटल्स में रन कर रहा था. उसको अपग्रेड किया है विद न्यू टेक्नोलॉजी, माइक्रो सर्विस आर्किटेक्चर एंड डिस्ट्रीब्यूटेड आर्किटेक्चर में बहुत सारी टेक्नोलॉजी यूज़ की गई है एंड बहुत सारा इंटीग्रेशन भी किया गया है डिफरेंट एंटिटीज से, सो दैट कि इसको सिंगल एप्लीकेशन, इसको ऐसे बनाया गया है कि सिंगल एप्लीकेशन हर टाइप के हर लेवल के हेल्थ फैसिलिटीज़ को सर्व कर पाए. सेम एप्लीकेशन अभी हमारा एम्स से लेके एम्स ऋषिकेश में भी चल रहा है एंड सेम स्ट्रेंथ का है PSC एंड CSC एंड हेल्थ सब सेंटर में भी चलता है. तो इसकी एक खूबी है कि एप्लीकेशन सॉफ्टवेयर एज ए सर्विस ही हम प्रोवाइड कर रहे हैं। जैसे अभी हमारे जो साथी सीडेक के बता रहे थे कि जो क्लिनिक ई सुश्रुत क्लिनिक है वो सॉफ्टवेयर एज ए सर्विस दे रहे हैं, बट ये एप्लीकेशन केवल उनको टारगेट नहीं, छोटे हॉस्पिटल को टारगेट नहीं करता, सभी हॉस्पिटल में सॉफ्टवेयर एज ए सर्विस ही है। कोई भी बड़ा हॉस्पिटल है वो ऑनबोर्ड करता है HFID डाल के, HFID से उसको ऑथेंटिकेट होता है एंड उसके बाद हॉस्पिटल के पास पूरा पावर है कि वो उसको कॉन्फ़िगर करता है। फुल्ली कॉन्फ़िगरेबल एप्लीकेशन है। उसको कैसे कॉन्फ़िगर करता है, अपने कितने उसमें वार्ड हैं, कितने रूम्स हैं, कितने डॉक्टर्स हैं, किसका क्या रोल है। जैसे अभी इसमें बता रहे थे कि कैसे कैसे रोल देते हैं, वीडियो में दिखाया गया था। तो वो सिमिलरली इस एप्लीकेशन में भी पूरा रोल बेस्ड एप्लीकेशन है। एंड नेक्स्ट करें। कॉस्ट इफेक्टिव है। कॉस्ट इफेक्टिव इसलिए कह सकते हैं क्योंकि गवर्नमेंट ऑफ इंडिया से फंडेड है, तो हम हेल्थ फैसिलिटी से इसके लिए कोई चार्ज नहीं करते हैं एज ऑफ नाउ। एंड चूँकि क्लाउड हम लोग NGC 2.0 पे होस्टेड है ये एप्लीकेशन, और किसी भी गवर्नमेंट एजेंसी, गवर्नमेंट हॉस्पिटल्स को, गवर्नमेंट हेल्थ फैसिलिटी को ये अगर इसको अडॉप्ट करना है तो उनके लिए फ्री ऑफ कॉस्ट है। इस पर कोई चार्ज नहीं है क्योंकि गवर्नमेंट ऑफ इंडिया ऑलरेडी इसके लिए फंड करती है। एंड अभी मोर देन 4000 हॉस्पिटल्स में इट इज़ बीइंग रनिंग। एंड अभी जितने फीचर्स लाइक CDSS, वॉइस टू टेक्स्ट, ये सारे फीचर्स भी इसमें भी एप्लीकेशन में भी अवेलेबल है। नेक्स्ट, हमने इंटीग्रेशन किया है। इंटीग्रेशन में हमने ई-संजीवनी के साथ इंटीग्रेशन किया है फॉर टेली कंसल्टेशन। PMJY के साथ इंटीग्रेशन किया है। NSCX के साथ इंटीग्रेशन हमारा लास्ट फेज में है। स्टेट के जितने भी सिस्टम्स हैं, स्टेट के पोर्टल्स हैं, उनके साथ हमने इंटीग्रेशन किया है सो दैट स्टेट अपने पोर्टल पे, डैशबोर्ड पे, अपने डैशबोर्ड पे डेटा दिखा पाए कि कितने के हॉस्पिटल्स में कितने ट्रांजैक्शंस हो रहे हैं, कितने डॉक्टर्स प्रिस्क्रिप्शन बना रहे हैं। उनको API के थ्रू हमने उनको दिया है और वो ले सकते हैं। बैक हाँ, इसके अलावा AVDM के साथ तो इंटीग्रेशन है ही। M1, M2, M3 एंड M4 भी हो गया है। ई-कोलैब DTS टेली रेडियोलॉजी, ये भी एक फीचर है, इसके बारे में और आगे बताएंगे। आगे बढ़ें। ये तो सेम ही है। नेक्स्ट करें। सो बेसिकली हम लोग बता रहे थे कि हम लोगों ने स्टैंडर्ड भी बहुत फॉलो किए हैं, लाइक स्नोमेट सिटी स्टैंडर्ड फॉलो किया है, ICD-10, MDDS स्टैंडर्ड फॉलो किए, सो दैट कि डेटा एक हॉस्पिटल से दूसरे हॉस्पिटल में जब हम AVDM फ्रेमवर्क के थ्रू जाएगा डेटा, तो वो स्मूथली जाए, कहीं पे कोई उसमें डिस्क्रिपेंसी नहीं आनी चाहिए। अगर हम इन स्टैंडर्ड्स को फॉलो नहीं करेंगे तो उसमें डिस्क्रिपेंसी आने का वो है, रिस्क है। एंड वन मोर थिंग, आपका डेटा जब जो बड़े इंस्टीट्यूशंस हैं, जो रिसर्च इंस्टीट्यूशंस हैं, मेडिकल कॉलेजेस हैं, वो अपने डेटा को रिसर्च के लिए यूज करना चाहते हैं। रिसर्च के लिए यूज करने के लिए अगर आप स्टैंडर्ड फॉलो करेंगे तो वो यूजफुल होगा, डेटा वैल्यू होगी। अदरवाइज वो उस डेटा की कोई वैल्यू नहीं रहेगी, क्योंकि अगर सिमिलर टाइप के डिसीजेज, सिमिलर टाइप के सिम्टम्स अगर हमने अलग अलग नाम से लिख लिए हैं तो उनको आप सर्च नहीं कर सकते कि सपोज फीवर, डेंगू फीवर के कितने हैं, या सपोज एक्सरे, चेस्ट एक्सरे कितने लोगों ने कराया है, ये आइडेंटिफाई करना है। बहुत सारे जो रिसर्च के हमारे लिए जो बेनिफिट हैं वो फिर नहीं होते हैं। बैक हाँ, इसके अलावा हम जो भी डेटा ट्रांजैक्शंस के लिए, चाहे AVDM के साथ कर रहे हों, चाहे हम जो लैब इंटीग्रेशन करते हैं, जो मशीन इंटीग्रेशन करते हैं, उसमें कर रहे हैं, सभी में FHIR, फास्ट हेल्थ केयर इंटरऑपरेबिलिटी रिसोर्स, ये स्टैंडर्ड फॉलो करते हैं सो दैट कि डेटा में कोई डिस्क्रिमिनेंसी ना आए। जितने भी मॉड्यूल्स हैं, चाहे OPD है, IPD है, बिलिंग है, LIS, RIS, हमारा ये चूँकि माइक्रो सर्विस आर्किटेक्चर में है, तो सारी सर्विसेज अलग अलग होस्टेड हैं। अलग अलग होस्टेड मीन्स अलग अलग उनकी माइक्रो सर्विसेज हैं और उनका डिप्लॉयमेंट भी अलग अलग होता है, उनके सबके डेटाबेसेस भी अलग अलग हैं। तो इसलिए डाउन टाइम का जो समस्या होता है, कई बार कि सिस्टम बंद हो जाता है। हम लोग बोलते हैं ना, रेलवे रिजर्वेशन बंद हो गया, चल नहीं रहा, 2 घंटे बंद रहा। तो हमारे सिस्टम में ये बेनिफिट है कि ये कभी भी उस तरह से बंद नहीं होता कि पूरा सिस्टम बंद हो गया। अगर हम OPD क्लिनिक में अगर कोई डिप्लॉयमेंट हो रहा है, अगर डाउन टाइम लेने की ज़रूरत पड़ रही है, तो वो 5 मिनट के लिए अगर होगा तो बाकी सिस्टम एज इट इज चलता रहेगा। तो एक दूसरे के ऊपर डिपेंडेंसी नहीं रहती है। तो API फर्स्ट अप्रोच के साथ ये बनाया गया है, और हमने इसमें बहुत सारी टेक्नोलॉजी यूज की है, लाइक जैसे सर्च के लिए हमने ELK स्टैक यूज किया है जिससे सर्च फास्ट हो पाए, रेडिस यूज किया है जिससे कैशिंग हो पाए, सो दैट कि कैशिंग परफॉर्मेंस के लिए रहता है कि आप परफॉर्मेंस कैसे ज़्यादा से ज़्यादा दे पाएँ कि कहीं पे भी कोई डिले ना आए और डेटा इमीडिएटली एक जगह से दूसरी जगह पहुंच पाए। एक अगर हम क्लिनिक में कोई ऑर्डर किया है एक्सरे, तो जब वो एक्सरे कराने जाए बंदा एक्सरे की काउंटर पे, तो वहाँ पे इन्फॉर्मेशन पहले से पहुँचनी चाहिए कि एक्सरे का इनका ऑर्डर है, हम यहाँ पे एक्सरे इसका करना है। बिलिंग के काउंटर पे पहुँचे तो वहाँ पे इन्फॉर्मेशन होनी चाहिए कि इसकी बिलिंग है, इसको इससे पैसे लेने हैं। नेक्स्ट। नेक्स्ट। हाँ, इसका प्रेजेंस के बारे में बताना चाहूँगा कि अभी बहुत सारे स्टेट्स में इसकी प्रेजेंस है। जो बड़े स्टेट्स हैं जैसे यूपी में 1000 से ज़्यादा हॉस्पिटल्स में ये इम्प्लीमेंटेड है, छत्तीसगढ़ में 300 से ज़्यादा, कर्नाटका में 500 से ज़्यादा, आंध्रा में 281 से ज़्यादा। इसके अलावा छोटे छोटे स्टेट्स में भी काफ़ी जगह ये इम्प्लीमेंटेड है, लाइक लद्दाख, लक्षद्वीप। लक्षद्वीप में जितने भी हॉस्पिटल्स हैं छोटे से बड़ा तक, सारे हॉस्पिटल्स नेक्स्ट जेन हॉस्पिटल के ऊपर ही हैं। अंडमान, मणिपुर, मेघालय, मिजोरम, त्रिपुरा, जम्मू कश्मीर में अभी हम लोग आगे कर रहे हैं। अभी 300 से ज़्यादा हॉस्पिटल में जम्मू कश्मीर में ऑनबोर्डिंग चल रही है, उत्तराखंड, नागालैंड। एंड इसका यही है कि देखिए एम्स ऋषिकेश में भी चल रहा है, RML हॉस्पिटल, VMMC हॉस्पिटल। VMMC हॉस्पिटल, सफदरजंग हॉस्पिटल में एक दिन के रजिस्ट्रेशन 12,000 से ऊपर होते हैं मंडे को, तो और वो भी केवल 8 बजे से लेके 2 बजे के बीच में। और ओवरऑल अगर हम देखें डेली का हमारा जो इसका हम देखते हैं, तो 7 लाख से 8 लाख के बीच में डेली रजिस्ट्रेशन होते हैं मॉर्निंग, सुबह 8 बजे से लेके 2 बजे या 3 बजे तक। तो ये हमारा स्ट्रेंथ है इस एप्लीकेशन का कि उसमें कहीं पे भी किसी को डिले या स्लो नहीं होता है, सिस्टम स्मूथ चलता है और वो कर पाते हैं। कहीं पे हमें 4000 हॉस्पिटल में चल रहा है, सिंगल एप्लीकेशन है, अगर बंद होगा तो सब जगह बंद हो जाएगा, तो हम लोग सर्वाइव नहीं कर सकते 1 मिनट भी अगर सब जगह बंद हो जाए। तो हम लोग उसको किस तरह चला रहे हैं। KGMU लखनऊ है, इधर बड़े बड़े इंस्टीट्यूशन हैं जिनमें ये चल रहा है। MHA के जो 43 हॉस्पिटल्स हैं, जो हमारे CRPF एंड BSF, ITBP उनके हॉस्पिटल्स हैं, उनमें भी चल रहा है। इसके अलावा सऊदी अरब में जो हज के लिए जाती है टीम, तो वहाँ पे जो हेल्थ क्लिनिक्स क्रिएट होते हैं, उनमें भी ये एप्लीकेशन रन होता है, और वहाँ पे भी डेली 8 से 10 हज़ार ड्यूरिंग हज 8 से 10 हज़ार रजिस्ट्रेशन एंड प्रिस्क्रिप्शन बनते हैं डेली। इस बार भी बने, अभी कल या परसों ही इसका वहाँ पे समापन हुआ है हज का, इस साल का हज का। और इस बार भी करीब करीब 3 लाख के आसपास प्रिस्क्रिप्शन बने हैं। अभी इसमें मैं और बताऊं कि जो मैंने आपको बताया कि 7 लाख से ऊपर OPD रजिस्ट्रेशन हो रहे हैं, लेकिन जो ऑनलाइन प्रिस्क्रिप्शन है वो करीब करीब 1 लाख हमारे डेली बन रहे हैं आउट ऑफ 7 लाख। तो चूंकि अभी जैसे सुबह से चर्चा हो रही है कि अडॉप्शन, डॉक्टर्स को क्या बेनिफिट हो कि वो कैसे इसको अडॉप्ट करें कि ज़्यादा से ज़्यादा प्रिस्क्रिप्शन बनाएं। तो एक जैसे DHIS एक फैसिलिटी है कि अगर हम प्रिस्क्रिप्शन बनाएंगे तो हेल्थ रिकॉर्ड बनेगा, तो उससे DHIS क्लेम कर सकते हैं। ऐसे ही हम अगर लैब रिपोर्ट्स बनाएंगे तो वो हेल्थ रिकॉर्ड बनेगा, उससे क्लेम कर सकते हैं। प्रिस्क्रिप्शन बनाने का एक बहुत बड़ा बेनिफिट ये है कि प्रिस्क्रिप्शन अगर बन गया, अगर डॉक्टर ने बनाया, तो उसमें जो एफर्ट्स लग रहे हैं उसका बेनिफिट तो बहुत लॉन्ग टर्म है। बेनिफिट इस तरह से है कि वहीं से जब उन्होंने किया, उन्होंने ऑर्डर कर दिया एक्सरे, उन्होंने ऑर्डर कर दिया CBC, उन्होंने ऑर्डर कर दिया मेडिसिन ऑर्डर कर दिया, तो वो फिर जब वहाँ काउंटर पे जाता है तो वहाँ पे उन लोगों को किसी को एंटर नहीं करना पड़ता। उनके पास पहले से प्री फिल्ड आता है कि मेरे को ये एक्सरे करना है, इनको ये CBC करना है, इसको ये मेडिसिन देनी है। कोई और अगर कोई IPD के लिए अगर कोई प्रिस्क्राइब किया है तो IPD काउंटर पे भी ये पहले से इन्फॉर्मेशन रहती है। तो एंड टू एंड अगर हम पेपरलेस की तरफ अगर हम जाने की कोशिश करते हैं तो प्रिस्क्रिप्शन इज़ द की। इसीलिए सारा जो फोकस है इस समय प्रिस्क्रिप्शन पे है कि प्रिस्क्रिप्शन अगर हम बनाएंगे तो जो है एंड टू एंड हम कर सकते हैं, उसमें फिर हमें कहीं पे भी पेपर की ज़रूरत नहीं पड़ेगी। अदरवाइज़ हर जगह यही होता है कि अब वो पेपर पे लेके जाते हैं तो उस पेपर को दिखा के फिर वो एंट्री करते हैं, फर्दर एंट्री करते हैं, फिर वो दूसरा पेपर लेके जाके दूसरी जगह एंट्री करते हैं। तो वो उसको हमें उस चैलेंज को दूर करना है। इसके लिए नेक्स्ट करिए। ये अभी जो आज के इस समय तक के हमारे वो हैं स्टेटिस्टिक्स हैं, 65 करोड़ ओपीडी विजिट्स हुए हैं, 3.5 करोड़ से ऊपर प्रिस्क्रिप्शन बने हैं, 5 करोड़ से ऊपर लैब के रिपोर्ट्स वगैरह बने हैं, 4000 हॉस्पिटल में चल रहा है। नेक्स्ट, ये मॉड्यूल के बारे में है। ओपीडी मॉड्यूल आपको सबको पता ही है, चूँकि सभी लोग हॉस्पिटल्स एंड मेडिकल लाइन से ही हैं, कि ओपीडी में क्या स्टेप्स होती हैं, आईपीडी में क्या क्या सर्विसेज होती हैं। प्रिस्क्रिप्शन में हम लोगों ने भी जो वॉइस टू टेक्स्ट हम लोगों ने भी लागू किया है, और ये सक्सेसफुली कई हॉस्पिटल्स में चल रहा है, आंध्रा में चल रहा है। प्रिस्क्रिप्शन के बारे में जो मैं बोल रहा था कि 7 लाख में से 1 लाख डेली प्रिस्क्रिप्शन बनते हैं, उस 1 लाख में करीब करीब 80,000 प्रिस्क्रिप्शन केवल आंध्र प्रदेश में बनते हैं। तो अगर जैसे सुबह हम बात कर रहे थे बिहार की, कि बिहार में एंड टू एंड चल रहा है, तो ऐसे आंध्रा में भी अगर हम डिस्ट्रिक्ट हॉस्पिटल लेवल, मेडिकल कॉलेज एंड डिस्ट्रिक्ट हॉस्पिटल लेवल तक देखना चाहें, तो आंध्रा में भी वो एंड टू एंड यूज कर रहे हैं। विजयवाड़ा में, गुंटूर में, कई हॉस्पिटल्स में आप कोई देखने जाना चाहें तो देख सकते हैं कि नेक्स्ट जेन हॉस्पिटल का वहाँ पे कैसे यूज हो रहा है। लैब और आरआईएस का जो है वो पूरा वर्कफ्लो है, हम इसको इंटीग्रेट भी कर सकते हैं एनालाइजर के साथ, पैक्स मशीन के साथ। वो फैसिलिटी है, हमारी एपीआईज बनी हुई है, और कई वेंडर ऐसे हैं जो जिनके साथ ऑलरेडी इंटीग्रेटेड है। अगर आपके हॉस्पिटल किसी भी वेंडर को लेके आते हैं तो उनके साथ हम इंटीग्रेट कर सकते हैं क्विकली। नेक्स्ट, बाकी मॉड्यूल भी सारे हैं, विलिंग, स्टोर, डाइट्री, फार्मेसी, ओटी। नेक्स्ट, एम्बुलेंस, एमआरडी, एलाइड सर्विसेज में जैसे सर्टिफिकेट्स हैं, विजिटर पासेस हैं। नेक्स्ट, तो बेसिकली ये सारे मॉड्यूल्स अवेलेबल हैं, एंड इसके लिए कोई ऐसा नहीं है कि इस एप्लीकेशन में अगर आपने एक बार अडॉप्ट कर लिया, आप जो मॉड्यूल यूज करना चाहें वो मॉड्यूल यूज कर सकते हैं। उसके लिए कोई एक्स्ट्रा चार्ज या एक्स्ट्रा कोई रिक्वायरमेंट नहीं है। केवल रिक्वायरमेंट यह है कि आपको अपने हॉस्पिटल में उन टच पॉइंट पे आईसीटी इंफ्रास्ट्रक्चर की रिक्वायरमेंट होगी, इंटरनेट की रिक्वायरमेंट होगी। अदरवाइज हमारी साइड से, एनआईसी साइड से या मिनिस्ट्री ऑफ हेल्थ की साइड से कोई रिक्वायरमेंट नहीं है कि आपको कोई एक्स्ट्रा चार्ज होगा या आप कोई सर्विस लेना चाहेंगे तो उसके लिए आपको कोई एक्स्ट्रा एफर्ट्स करने हैं। ट्रेनिंग हम लोग कराते हैं। नेक्स्ट, ये डे का वो है, डे का ओपीडी रजिस्ट्रेशन 7 लाख था मंडे को। जनरली 7 लाख मंडे ट्यूसडे में 7 लाख से ऊपर निकलता है। एक महीने में करीब 12 करोड़ 1 करोड़, हाँ 1 करोड़ 20 लाख ऐसे करके रजिस्ट्रेशन हो जाते हैं। नेक्स्ट, ये तो सारे फीचर बता ही दिया मैंने। नेक्स्ट, हाँ एक ये फीचर है टेली रेडियोलॉजी का, ये शायद आप लोगों ने सुना हो। टेली रेडियोलॉजी क्या, ई कोलैबोरेटिव के साथ हमने इंटीग्रेशन किया है। इसमें क्या है, बेसिकली अगर आपके हॉस्पिटल में, सपोज डिस्ट्रिक्ट हॉस्पिटल में रेडियोलॉजिस्ट है, आपके पीएससी में या सीएससी में रेडियोलॉजिस्ट नहीं है, बट मशीन है, एक्सरे मशीन है, सीटी मशीन है, टेक्नीशियन है, तो वो वहाँ पे टेक्नीशियन उन फिल्म को जो स्कैन करेंगे, चाहे वो एक्सरे हो चाहे वो सीटी हो, उनको अपलोड कर सकते हैं हमारे सिस्टम में। ये ई कोलैबोरेटिव सिस्टम ये नेक्स्ट जेन हॉस्पिटल के साथ इंटीग्रेटेड है, एंड इसका भी कोई एक्स्ट्रा चार्ज नहीं है। वो अपलोड कर सकते हैं, और जहाँ पे रेडियोलॉजिस्ट हैं वो उसको इंटरप्रेट कर सकते हैं, और जो ट्रीटिंग डॉक्टर को वो इमीडिएटली रिपोर्ट पहुँच जाती है सामने उनके। तो ये कई हॉस्पिटल्स में यूज कर रहे हैं। इवन जो हमारे एमएचए के, मिनिस्ट्री ऑफ हेल्थ होम अफेयर्स के हॉस्पिटल हैं, सीआरपीएफ और बीएसएफ के, वो लोग यूज कर रहे हैं। उनका दिल्ली में उनका स्कैन होता है, एंड शिलोंग में उनका रेडियोलॉजिस्ट बैठ के उनको इंटरप्रेट करते हैं। तो ऐसे प्रैक्टिस में चल रहा है। नेक्स्ट, ई प्रिस्क्रिप्शन सिस्टम हमारा, हमने 2-3 ऑप्शंस दिए हुए हैं ई प्रिस्क्रिप्शन में बनाने के लिए। एक है हमारा टैब वाइज है, लाइक हम वाइटल्स भर सकते हैं, मेडिकेशन भर सकते हैं, सिम्टम भर सकते हैं, कंप्लेंट भर सकते हैं। एक हमने 1 पेजर भी है उसके इक्विवेलेंट। अगर एक ही पेज में आप स्क्रॉल करते जाएं तो आप जो भरना चाहें वो भरते चले जाएं। वॉइस टू टेक्स्ट में अगर आप करेंगे तो वॉइस जो कन्वर्सेशन करें, चाहे डिक्टेशन मोड में जाएं, वो जो भी बोलेंगे उसके हिसाब से वो अपने आप फिल हो जाता है, फॉर्म पूरा फिल हो जाता है। इसके अलावा इसमें टेम्पलेट्स भी बना सकते हैं। टेम्पलेट्स मीन्स जैसे आपने डेंगू का टेम्पलेट बनाया, किसी भी बीमारी का टेम्पलेट बनाया, उस टेम्पलेट में क्या दवाइयाँ दी जानी है, क्या टेस्ट कराने हैं, वो पहले से भर के रखते हैं, और उसको एक सिंपल सिंगल क्लिक किया एंड वो इसको यूज कर सकते हैं। हमने ये भी किया हुआ कि अगर एक हॉस्पिटल के अंदर एक डॉक्टर अगर टेम्पलेट बनाते हैं और वो अलाउ करता है डॉक्टर कि मेरे टेम्पलेट ये दूसरे डॉक्टर भी यूज कर सकें, तो वो उसको शेयर हो जाता है वो सेम टेम्पलेट, और वो डॉक्टर उसको फर्दर और एनहेंस करना चाहे तो दोबारा अपने नाम से सेव कर सकता है, अदरवाइज सेम एज इट इज यूज कर सकते हैं। तो वो शेयरिंग भी हो जाता है टेम्पलेट्स को। नेक्स्ट, ये ऑनलाइन ओपीडी रजिस्ट्रेशन की स्लिप है, हमने इसको जन औषधि केंद्र के साथ इंटीग्रेट किया हुआ है। उसमें हमें नियरेस्ट जन औषधि केंद्र कहाँ पे है उसका एड्रेस आपके हॉस्पिटल के हिसाब के एड्रेस के हिसाब से लॉन्गिट्यूड लैटिट्यूड को देख के वो हम बता देते हैं कि आपका नियरेस्ट जन औषधि केंद्र कहाँ पे, जहाँ से आपको सस्ती दवाइयाँ मिल सकती हैं पेशेंट्स को। नेक्स्ट, ये जो CDSS सिस्टम है, जैसे सीडेक टीम ने भी बताया था, सेम CDSS सिस्टम है जो एम्स दिल्ली के साथ मिला बनाया गया है, जिसमें बीमारियों के हाइपरटेंशन एंड डायबिटीज़ के बारे में वो सजेस्ट करते हैं कि क्या दवाई दी जा सकती है, किस ग्रेड की बीमारी है। नेक्स्ट, टिकटिंग मॉड्यूल है हमारा जो सिस्टम में कोई भी यूजर जिसको कोई इशू आता है वो टिकटिंग मॉड्यूल पे अपनी टिकट रेज कर सकता है, जिसको हम रिजॉल्व कर देते हैं इन टाइम बाउंड मैनर में। हम लोग ट्रेनिंग देते हैं, जो भी हॉस्पिटल ऑनबोर्ड होना चाहता है वो हॉस्पिटल को हम ट्रेनिंग देते हैं, एंड एवरी वीक एवरी फ्राइडे को 3 बजे से 5 बजे का हमारा ओपन ट्रेनिंग का सेशन रहता है। उसका लिंक हम लोग प्रोवाइड कर देंगे, गोवा को भी प्रोवाइड कर देंगे। वो कोई भी ट्रेनिंग करके देख सकते हैं, एक बार उसका फील ले सकते हैं कि उसका कैसे डेमो है, कैसे उसको ऑनबोर्डिंग करना है, कैसे प्रिस्क्रिप्शन करना है, कैसे वो करना है, ओपीडी रजिस्ट्रेशन करना है। तो वो 2 घंटे का एक सेशन होता है एवरी फ्राइडे को, तो वो देख सकते हैं। नेक्स्ट, प्री रिक्विजिट केवल इतना ही है कि आपके पास ICT इंफ्रास्ट्रक्चर होना चाहिए, इंटरनेट कनेक्टिविटी होनी चाहिए, मैन पावर होना चाहिए सफिशिएंट जहाँ पे भी ज़रूरत है, और इन सब चीज़ों के लिए DHIS की हेल्प ली जा सकती है। अगर आप यूज करते हैं AVDM कंप्लाइंट एप्लीकेशन को, तो DHIS के थ्रू ये बाकी चीज़ें भी आप उनको गैदर भी कर सकते हैं। नेक्स्ट, ये कुछ फोटोग्राफ्स हैं डिफरेंट लोकेशंस के, NNMC नवी मुंबई का है, ये BSF हॉस्पिटल का है। नेक्स्ट, ये गुंटूर हॉस्पिटल में देखिए क्लीनिंग मॉड्यूल यूज़ कर रहे हैं आईपैड पे। तो ये चूँकि हमारा एप्लीकेशन मोबाइल फ्रेंडली है, इट कैन रन ऑन आईपैड, इट कैन रन ऑन मोबाइल ऑल्सो। इसके अलावा एक चीज़ और बताना रह गया इसमें कि हम लोगों ने एक IPD का मोबाइल ऐप भी बनाया है। वो IPD का मोबाइल ऐप से डॉक्टर्स एंड नर्सेस वो उसको मोबाइल ऐप को ऑन द गो पेशेंट को देख रहे हैं तो उसको यूज कर सकते हैं, उसको उस पर डिस्चार्ज समरी इनिशिएट कर सकते हैं, डिस्चार्ज समरी अप्रूव कर सकते हैं, और इसके अलावा पेशेंट की स्टेज भी देख सकते हैं कि अगर नर्सेज वहाँ पे क्या सर्विस दे रही हैं, डॉक्टर अगर कहीं दूसरी जगह पे हैं तो वो भी देख सकते हैं कि पेशेंट को लाइक अगर वाइटल्स लिए गए हैं तो वाइटल्स देख सकते हैं कि अभी इस समय क्या वाइटल्स हैं, कितना BP है, कितना शुगर है, वगैरह वगैरह। नेक्स्ट, ये रोड मैप है कि हमें जितने भी हॉस्पिटल्स इस पे आना चाहें उनका स्वागत है। हमने रक्त कोष के साथ भी इंटीग्रेशन किया हुआ है, और कोई भी गवर्नमेंट के या कोई भी इस टाइप के ऑर्गेनाइजेशंस हैं जिनके साथ हमें इंटीग्रेशन करके अगर डॉक्टर्स को, अगर हॉस्पिटल्स को कुछ बेनिफिट होगा तो वी आर ओपन फॉर इंटीग्रेशन। थैंक यू। नेक्स्ट, बस इतना ही है हमारी मेरी तरफ से। थैंक यू। कोई क्वेश्चन हो तो प्लीज बताएं। थैंक यू।
Thank you, sir, for the very informative session. As a token of appreciation, I would like to invite Ms. Dikshita to kindly present you with a small memento. So our next session will focus on the roadmap towards the model district, covering the planned approach, the implementation strategy, and key actions required for its successful execution. For this, I invite Mr. Pavan Kumar Raikar, Joint Director Coordination, ABDM Goa, to kindly deliver the presentation.
Thank you very much. Hello. Yeah. So, hello. So, as we all know that it is a model district North Goa initiative. Okay. So next. So in the morning, as Minister of Health said that we have achieved 10 lakh Abha card in Goa. Okay, it is very true. And if we see the model district North Goa, then we have achieved in North Goa itself 5 lakh 20,000 Abha cards, considering the population of 8 lakh as such. Okay, these are some of the things like we have administrative block 5, private hospitals 631, hospitals, public hospitals 14, 10 PHCs, 2 UHCs, 4 CHCs, 112 sub-centers, 17 RMDs, and 1 health and wellness center. Next. So what is the strategy? What exactly is the model district initiative, and what exactly the leadership is trying to implement? The thing is that NHPR and HPR registration. So all of y'all here are from the medical background, pharmacy background, various y'all are attached to different kinds of systems which is linked to healthcare. Now, HPR, Health Professional Registry. So if we see HPR and HFR, so facility 100% saturation of public healthcare infrastructure is being done in Goa. And almost 402 private facilities are already onboarded in the state of Goa. And what is the phase 1 target in the model district initiative? Phase 1 target is to onboard all the facilities, private facilities which are there in Goa. That is our main target. If you see the health professional registry, we want to saturate or all the health professional who are there in Goa. We want to onboard them. So this is one of the key target apart from health facility registry. Next. Okay, skip the queue. As we know that digitization, meaning to make something faster, easier. So skip the queue is one of the revolution, or you can say scan and share is one of the revolution. So it eliminates a long queue. We have already seen this initiative in the model facility PHC Kolim, which is one of the model facility where we are able to eliminate long queues, manual data entry error which are there. It is also can be eliminated. QR code, if you see QR code integration, so this is the second thing, a unique QR code at every entrance. So if we initiate a QR code at every entrance, then the patient can self-register. Okay. So ABHA help desk, dedicated kiosk will be set up to assist the patient to generate the ABHA IDs. Okay. So digital token. So digital token is like immediate registration on ABHA app. Okay. If you see ABHA app feeding patient details on the HMIS. Okay. So details will automatically be fetched. So as we all know that all your things, all your records are linked to Aadhaar. It is Aadhaar based. Okay, next. So third thing is that HMIS and e-Srishrut Lite adoption. So team is focusing on rolling out in public health facilities, starting with a registration counter, uh, OPD, labs, pharmacies through e-Srishrut HMIS to all public hospitals. We have already initiated, we have already started, and we are moving forward with this. Okay. Sub-center deployment of e-Srishrut Lite. So e-Srishrut Lite is one of the specialized lightweight HMIs which is already been deployed or most of our sub-centers are already onboarded, designed for rural peripherals clinics to ensure even the smallest touch points generates the digital data. Private facilities. Now, private facilities are currently using various HMIs. So, ABDM team, private player is one of the important player because we have to go parallelly. So, public sector and private sectors, if we go parallelly, then only this mission will be a success. So, what we are ensuring that private facilities, we are will be focusing on private facilities. All the private facilities are using various HMIs. Okay, the team will be planning to visit these facilities, ensure the adoption of ABDM compliant software. Many of the private facilities are having softwares HMIs, but we'll see that they are using the software which are ABDM compliant. Next. So infrastructure and operational requirements to achieve 100% digitization in both public and private facilities, particularly in North Goa Model District, which is you can say it is a initial thing which we are doing. So the following factors must be met. One, as you know, that ICT hardware. So hardware is a must. Okay, so will ensuring procurement, placement of desktop, tablets, printers at every steps of a patient's journey at the facility, whether it be registration, OPD, pharmacy, labs. So we'll try to ensure this is done. Okay, hospital help desk. So hospital help desk using deploying dedicated staff to guide the patient. If we are saying that skip the queue, we are installing QR code. Then we have to ensure that someone should be there who will help the patient who are coming to the hospital, clinics, or anywhere as such. Okay, so I see. So if you see that high visibility branding, explaining common questions such as what is how to create ABHA, how to create ABHA ID, what are the benefits of electronic health record, privacy, and consent based data sharing. Okay, so this is one of the things. Now expected impact, this is a very important things. By moving to the model district initiative, we are visioning to reduce the waiting time. Okay, scan and share, which is one of the thing which reduces the waiting time from minutes to seconds. Then continuity of care, a patient treated in a healthcare facility will have his history instantly on the PHR app. Okay, provider sensitivity, so digital records allow for better follow up and patient centric care. Okay, so these are the three expected impact: reduce waiting time, continuity of care, and providers sensitivity. Next. This is the plan which we are projecting. Okay, this is the month-wise plan which we are projecting. If we see here that the health facility registry, we have already achieved 100% health facility, public health facility onboarded. Okay, private facility, believe me, it is 70% of the private facility are already onboarded. Okay, HPR, this is for the June. Okay, so HPR public almost professional, 75% of professional, private professionals are already onboarded. for professional, you say doctors, nurses who are related to medical field. Okay, so HMIS adoption in public 35% and HMIS adoption in private it is 20%. So we have a gap which we have to fill, and that is what the plan is. Okay, so at the end we are projecting of achieving 100% in both public and private. Okay, next. So what is the roles of the hospitals, pharmacies, clinics, and labs? So one is that registration on NHPRs. NHPR, we request all the hospitals, clinics, pharmacies, and lab to get themselves onboarded on the health professional registry, health facility registry. So this is one of our first aim. So everyone should be onboarded. Second is 100% usage of ABDM compliant HMI software. Public sector, we have already onboarded HMIS compliant software, but what we request the private player is that they are having HMIS, no doubt, but ensure that they are using a ABDM compliant HMIS. Okay. Third is ABA generation for of patient visiting that facility. So every patient, what we request you is that every patient who visit your hospitals, clinics, labs should have a ABHA. Okay, ABHA should be generated each and every patient. And the fourth thing is that 100% record linkage of patient using various ABDM compliant software. So record linkage is also one of the key factors which is going to be or what we can say is that in order to complete the cycle, record linkage is one of the important parameters. Okay, that's it. Okay, yeah, thank you, thanks a lot.
Thank you, Pavan, for a very insightful session. I'm sure with the roadmap that Mr. Pavan has just displayed, we will achieve our targets much sooner than November 2026. Agreed? Because to achieve our targets, we definitely need the support of all of you present here, private as well as all the public healthcare facilities. So as a token of our appreciation, I would like to invite Ms. Ruchita to kindly come and present a small memento to Mr. Pavan Kumar Raikar. Okay. I request Dr. Kedar Raikar to please do the honors. Thank you, sir. So we have, if you see around, we have a lot of HMIS providers. Their stalls are put up. We have requested few HMIS providers to kindly come up and give you a demo so that you can understand their product better. To start with, I would like to invite from Tirupati HMIS, Shri Yogesh Kumar Lohar, Director. You could please come and demonstrate your HMIS product.
I think it is there. Thank you. Okay. So good afternoon, everyone. So first of all, respected to distinguished guest, officer of National Health Authority ABDM integration team, as well as the government officers, doctors, and healthcare and hospital administrator, and technology partners. Uh, as on behalf of the Tirupati Software Infotech, it's my great honor and privilege to welcome and greet all of you, and happy Doctors Day to everyone. So as of now, you know that the ABDM integration is a government initiative Sri Modi ji have introduced digitalization of the healthcare industry, make transparent और patient record. Okay, so अभी healthcare industry कैसे help कर रहा है, और इससे सबसे बड़ा advantage as I feel that is the we are making digital as well as the nature को भी हम लोग help कर रहे हैं कि paperless करके trees और green चीज़ों को execute कर रहे हैं. ठीक है. इसी इवेंट में तिरुपति इंट्रोड्यूस इज वर्किंग सिंस 2014 एंड more than over a decade, Tirupati Software Infotech have been executed over the 1250 hospital management software in India as well as the 125 hospital application abroad out of India. Okay, so let's go the application overview. What are we are providing? There are more than 70 plus modules are there, and which is covering almost hospitals all department, which is covered from patient entry to patient exit as well as the management care activities. So let us see, this is our the team of introduction, which we are having two branch office in the one in the Tirupati, one is the Jaipur city, and both city we are covering North India and South India also. Now this is the digital initiative application we have introduced. There are the many facility you can see in the this slide one, and this is you can see the software main menu, which you can see more than 70 are module, where dashboard, appointment, registration for outdoor patient, indoor patient, and apart from the token screen generation, and OPD billing, IPD billing, laboratory, radiology, pharmacy, discharge summary, multi-specialty modules, as well as the finance report, MIS report, master settings, and other modules are there. You can go through in the detail. Now let us go. We have focused the ABDM integrates compliance system. So this is the first screen. So ABDM integration M1 module. What is exactly do? It's creating ABA from the patient's Aadhaar number, where we can have the ABA creating verify ABA and token generation screenshot. In the second screen, you can see the ABA number will be used for taking ABA creating our patient, and that time system will ask ABA number and OTP will be sent to the registered mobile number of the patient sending the record. Once the verified ABA, the system will get two options, either existing ABA number, either creating new. So at a time you will, if you find the existing ABA, so it will get your record. Otherwise you ask for create new ABA, it can create new another ABA with the same Aadhaar number. Up to 6 Aadhaar number on one Aadhaar number, 6 ABA number can be created maximum. The same way, once ABA have been received the data for the patient demographic data, the data will be auto-fetched to the registration event to create OPD or required IPD entry as per the patient demographic detail will be fetched from the system. Now there is one more option. If the patient has already ABA, so if a patient, so we ask verify ABA via mobile number, ABA address, or his ABA ID. So these are the verified and get the again data of the patient. Now, sorry. So this is the ABA M2 record, where once the healthcare institution, hospital, clinic have created patient's health record. So this M2 module is synchronizing the data of the patient to the government portal ABDM automatically. Once the healthcare have verified that the data is logged, and it should be shared to government portal, so it auto synchronize with the system to ABDM, and patient can get access in this PHR application as well as the other institution. And the third one slide, which is cross M3 module, which is provide healthcare facility to get the patient any patient's data from any other facility he have taken the treatment, like that. So where prescription, discharge summary, any clinical data doctor request. In that slide, what happen, the ABA address will be used by the doctor or healthcare institution, and they will send the request to patient's PHR application, and once the patient is accept the request, the data will be available to the particular healthcare owners or doctors or user to get the patient record and can identify what was his clinical history of the patient or medical history record, like that. And there is this also time limit of the patient record which we have received healthcare industry. It is will be available after a certain duration. It will be self-expire from the system data. Now this is the PHR application, some screenshot where you show how the patient data is be granted patient a consent acceptance, like that, and institutions available nearby his location can be accessible in this screenshot. And this is the application to complete Tirupati HMS software is solution providing integrated software solution more than all activities workflow with digitally where making patient appointment registration, consultation, laboratory radiology, and ABDM compliant documentation generation, discharge summary, OT, admission billing, and the patient's journey will be completed after pharmacy medications. Now, these are the hospital applications, a basic screenshot where the front office system login, dashboard, appointment creating, registration window, apart from the clinical health record generation for the patient, e-prescription writing. Now, in the prescription side and medical IPD document generation, we have used some event AI generated services which is help to doctor to reduce time and focus on the patient, because what happen if we focus on digitally, if you are looking on the computer screen, mobile screen, patient think he is not attention me, so it is awkward impact. So reduce that, AI will help you to drop down plus AI suggestion medicine investigation based on the diagnosis selection will be suggest the system. And once you have saved the prescription, this record shall be go to the billing desk or the requested department billing. So once the billing request will user approve the billing request, this bill and patient's amount will be received via the system payment or cash or whatever mode is there. It is TPA insurance, so it will be verified record and save the record. Once the billing have been recorded, this request automatically will fetch to the laboratory radiology departments, so where the lab technician sample collection and the report processing in the that duration report generation laboratory side, various LS device integration possibilities are there, as well as the radiology side we have already executed the PEX integration, DICOM integration to get the data device with the system software. And once report are prepared, this report will be automatically available to clinical side to the doctor e-desk, where doctor can see lab or radiology report in front of the PDF format as well the clinical data. And there is the some highlighted value will be doctor can easily find out which is the test result is abnormal, so they can make the decision according to basis in the system software. Okay. Similarly, once the report have been completed and doctor can advise the medication to the patient prescription, this request go to pharmacy desk, and pharmacy desk one click select patient and medicine will be dispatched. In this all the event of flow OPD, paperless event means we have to reduce the paper printing. So what we have done executed, PHR application will be also get the real data, as well as the we are also sending the patient's billing and the your confirmed record to be shared on the patient's WhatsApp number or email ID by system generated. Also there is a option is available to take the patient appointment over WhatsApp also. समटाइम यू हैपन हमें क्या होता है कि हर हॉस्पिटल का एक मोबाइल एप्लीकेशन इंस्टॉल करना पड़ता है, तो हम उसको अवॉइड कर रहे हैं. व्हाट्सअप स्कैन जैसा क्यूआर कोड एक ऐसा यूनिक फीचर है कि आप क्यूआर कोड स्कैन कीजिए, आप किसी सार्टिन इवेंट पे जा सकते हैं और वो एक्टिविटी परफॉर्म कर सकते हो. हमने व्हाट्सअप को काफ़ी तरीके से सिस्टम के साथ सिंक्रोनाइज़ किया है काफ़ी इवेंट पे, तो वो रिकॉर्ड व्हाट्सअप पे आ जाएगा जिसमें आपका पेशेंट का रिसिप्ट है, डायग्नोस्टिक रिपोर्ट है, प्रिस्क्रिप्शन है, डिस्चार्ज समरी है, वो सारा अवेलेबल हो जाएगा आपको उसमें. और पेशेंट इवन व्हाट्सअप से जैसे कि चैट बोर्ड पे आप पूछेंगे पेशेंट को हाय भेजा आपके व्हाट्सअप हॉस्पिटल के रजिस्टर नंबर पे, तो उस इवेंट पे आपके पास में आएगा आप क्या चाहते हैं, क्या अपॉइंटमेंट या रजिस्ट्रेशन या डायग्नोस्टिक रिपोर्ट या अदर इन्फॉर्मेशन, तो दैट विल बी चैट बोर्ड विल रेस्पॉन्ड अकॉर्डिंग टू एंड विल अवेलेबल द रेस्पेक्टिव डॉक्यूमेंट्स. This was the pharmacy section service window after the billing department, where the cash card, UPI, or insurance or TPA services respective billing validated. If it is insurance or TPA patient, the reimbursement process will be maintained separately. The TPA and cash payment will be handled the billing department. Apart from that, the other hospital supporting module where the biomedical, CSD, canteen, laundry, mortuary, parking are there to digitalize other department also. So you can transformally use healthcare system each and every department. Okay. And this is also a management dashboard where the live statistics of the hospital, billing rows, MIS reports, user-wise, doctor-wise, patient-wise, or there are more than 400 type of reports are there. So we can be accessible. There is also YouTube channel is there. Detailed video are played in the system, so you can find out either clinical flow, IP flow, OP flow, various flows are there. Okay. So these are due to short time we would like to cover this event and USP of the application. One second. Sorry. there are some key feature of the system is there. Just a second. Okay. So thank you so much. If someone have query, they can ask the question. Otherwise, I would like to wind up the session. And thank you for ABDM and all the team to giving us opportunity, and have a good day.
Thank you so much. If anybody wishes to have a more detailed interaction or explore their solution, they can visit the stalls behind, okay, for any further information regarding the particular HMIS product. As a token of our appreciation, I would like to request Dr. Kedar Raikar, State Nodal Officer, to present Shri Yogesh Kumar with a small memento. Next, I request Mr. Chandresh Gaukar from Marg ERP software to kindly demonstrate his product. Due to paucity of time, we have assigned only 10 minutes. So requesting all to please stick to their time.
Good evening, everyone. So I am basically from Mark Software, billing and accounting software. So we have done ABA integration. So इसका कैसे process क्या है? Just मैं आपको in short में बता देता हूँ. Next. तो यहाँ पे पहले आपको HFR ID जनरेट करनी पड़ेगी तो रजिस्ट्रेशन के थ्रू. तो जो HFR ID जनरेट होगी वो हम सॉफ्टवेयर में डाल देंगे तो वहाँ पे आपका रजिस्ट्रेशन हो जाएगा. इसका बिलिंग में बाद में आबा कैसे लिंक होगा आपको बता देता हूँ. नेक्स्ट. यहाँ पे बिलिंग प्रोसेस रहेगा. यहीं पे आप डायरेक्ट आबा क्रिएट कर सकते हो. जैसे आपका नीचे वहाँ पे एक आबा बटन है तो उस पर क्लिक करके आप डायरेक्ट आबा क्रिएट कर सकते हो. नेक्स्ट. यहाँ पे पेशेंट रजिस्ट्रेशन होगा. तो पेशेंट रजिस्ट्रेशन में आप जैसे आपका आबा का नंबर रहेगा, आधार नंबर डाल के आप आबा रजिस्ट्रेशन कर सकते हैं. अभी तो OTP वेरिफिकेशन करके यहाँ पे ओके कर देना. नेक्स्ट. देखो आपका आबा कार्ड भी यहाँ से डाउनलोड कर सकते हैं आप डायरेक्ट. तो यहाँ पे आबा इंटीग्रेशन हो जाएगा. तो जैसे आपका आबा रजिस्ट्रेशन हो जाएगा तो आप यहाँ पे डायरेक्ट उसका नाम डाल के सेव कर सकते हो. तो उसके बिल पे डायरेक्ट आप यहाँ पे इंटीग्रेशन हो जाएगा. वहाँ पे इंडिकेट करेगा आपको डॉट से जिसका आबा आपका इंटीग्रेशन है. उसका आबा आईडी आ जाएगा यहाँ पे एट टेक्स्ट. वहाँ पे बाद में जैसे वो रेड कलर में रहता है वो ग्रीन हो जाता है. जैसे आबा इंटीग्रेशन हो जाएगा तो वहाँ पे वो ग्रीन कलर में शो हो जाएगा आपको. तो आपको बिल का प्रीव्यू देखना है, आबा रजिस्ट्रेशन नंबर देखना है तो वहाँ पे F प्रेस कर दिया तो यहाँ पे शो हो जाएगा आपको. नेक्स्ट. ये प्रीव्यू रहेगा आपका प्रिंट का, जो भी प्रिंट देंगे आप इसका. अभी ऑलरेडी जो आबा रजिस्ट्रेशन है तो उनका डायरेक्ट आप OTP वेरिफिकेशन से लिंक कर सकते हो. यहाँ पे पेशेंट रजिस्ट्रेशन रहेगा, डायरेक्ट OTP जाएगी आबा रजिस्ट्रेशन से. नेक्स्ट. ओके. नेक्स्ट. ये सब OTP वेरिफिकेशन रहेगा. सब OTP वेरिफिकेशन से हो जाएगा. नेक्स्ट. सेव. नेक्स्ट. और जो ऑलरेडी एग्जिस्टिंग आबा कस्टमर है उनका डायरेक्ट करना है आपको तो आबा नंबर डाल के भी डायरेक्ट उसका बिलिंग हो जाएगा. ये देखो यहाँ पे आप सेव चेक कर सकते हो. जो ऑलरेडी एग्जिस्टिंग है तो वहाँ पे आपका शो हो जाएगा. जहाँ पे सेव एंड चेक आबा एड्रेस है तो उस पर क्लिक करते आपको पता चल जाएगा उसका आबा कार्ड ऑलरेडी लिंक है करके. नेक्स्ट. ये देखो जितने भी कस्टमर हैं उनके वहाँ पे डॉट करके दिखाता है आपको. जो आबा रजिस्टर्ड है, जो सॉफ्टवेयर के साथ इंटीग्रेट है, उनका आपको पेशेंट का वहाँ पे डॉट करके लिंक में दिखाता है. नेक्स्ट. ये सेम बिलिंग प्रोसेस ही रहेगा. नेक्स्ट. तो यहाँ पे आपको कस्टमर की पूरी डिटेल्स मिल जाएगी. जहाँ पे आबा की बिलिंग हो रही है ना आबा के नंबर से, उसकी पेशेंट की सारी आपको डिटेल्स मिल जाएगी। नेक्स्ट कीजिए। ये देखो यहाँ पे ऐसे आपको डिटेल्स मिल जाएगी जिसकी आभा बिलिंग हुई है। नेक्स्ट नेक्स्ट। तो यहाँ पे आप सारे जो भी आभा के बिलिंग हुए हैं वो देखने हैं। तो यहाँ पे आपको डायरेक्ट यहाँ पे स्टेप्स है। तो यहाँ पे जितने भी आभा के थ्रू बिलिंग्स हुए हैं वो आपको यहीं पे सॉफ्टवेयर में दिख जाएंगे। नेक्स्ट नेक्स्ट नेक्स्ट। और लास्ट में ये आपका मतलब जो सॉफ्टवेयर यूज़ कर रहे हैं उनको क्लेम इंसेंटिव्स क्लेम्स करने हैं। तो ये लास्ट उसका प्रोसेस रहता है। आपको यहाँ पे दिख जाएगा जितने भी आपके आभा के बिलिंग्स हुए हैं। तो यहाँ पे दिख जाएगा आपको, वहाँ पे टोटल आपको बाद में क्लेम करने मिलेगा। नेक्स्ट कीजिए। इतना ही रहेगा प्रोसेस। मेन हमारा बिलिंग और अकाउंटिंग सॉफ्टवेयर है, तो उसके थ्रू यहाँ पे आप अर्न कर सकते हो। थैंक यू।
Thank you so much. I request Mr. Pavan Kumar Raikar to kindly present a token of appreciation. Hmm. So quickly we will have more two demonstrations. I call upon Shri Kunal Agarwal, founder, Easy Solution.
Good afternoon, everyone. Myself, Kunal Agarwal. I'm the founder and CEO of Easy Solution. So we are a company involved in healthcare technology from last 2 decades. So this company was started in 2003, and we have a product called Easy Hospital Management System. So basically, this product is a comprehensive product for any kind of hospital, whether it's a small, medium, large, or chain of hospitals. And we are already catering to 100 million patients, handling transaction worth 15 billions per year. And using our software, hospital has achieved up to 40% revenue boost, and they have also achieved 60% patient satisfaction. So we are not talking only about the revenue, we are also talking about the patient satisfaction and patient engagement through our product. So basically, our product is cloud-based, and we also have an offline version or a licensed version which can be deployed locally on the hospital premises. And we are compliant with NABH, so we have a lot of workflow which can be NABH compliant. And we are also ABDM certified. We also can communicate with the HL7 systems. So HL7 is basically the medical devices communicate through the HL7. And we also are JCI certified, means the JCI workflow is embedded in our system. And we have a very good user-based user dashboards. So what we have done in our system is we have divided our system into different designation dashboards. So for an example, we have a different dashboard for reception, we have a different dashboard for nursing, we have different dashboard for doctors, ward. So they have all the information easily available on the dashboard. They need not to search anything in the menu, and they can work from the dashboards itself. 99% of things they can do from the dashboards. And we can handle multiple locations. In the EMR, we are following ICD-10, although it is compatible with ICD-11. And in lot of places, we have integrated AI as well. So it's not only a marketing gimmick. So we have actually practically implemented AI into our system. And we also have the barcode, QR code, SMS, email, WhatsApp, and very intelligent bot. So when we talk about the AI bot, it's not a FAQ bot which we are providing. So it's a very intelligent bot which is database driven. So it can actually take out the data from the database and give the result or the communicate with the patient accordingly. And it can also communicate with the administrators. So it can give the live statistics. If you ask them that what is the collection for the today, it can tell you that what is the collection for the today. So these kind of database connectivity is there in our bots. And we also have the medical device integration. A lot of medical device we have integrated. And we also have a very advanced queue management system. So we always think one step ahead. So you must have seen the queue management system where the tokens are displayed on the television screen. So we have also generated a QR code, and the token numbers are also available in the mobile app, and the ETA is also available, like estimated time of facility. So that thing is available, so they need not to stick to the waiting room. They can go anywhere, have a cup of coffee, and they get to know that when there's numbers about to come. And we also have the mobile app for the iOS and Android, and mobile app has the interface for the staff, doctor, patients. So a lot of things can be done through the mobile app. So I will not repeat certain things. We also are HIPAA compliant, and SOC2 is the international compliance, so that is also there with us. And we have the quick prescription tool, and we also have a very good tool called AI Voice RX. So where it can record the communication between the doctor and the patient, and it can pull out the clinical information, and it can categorize into the diagnosis, it can categorize into the medicines, it can categorize into the different findings, and it can also map field by field, and the prescription is ready. So it's not only a textual prescription, it can actually work through the MIS as well. So the field by field mapping is also there. So later on you can pull out the MIS, like for this particular diagnosis, how many patients we have attended in a particular day, month, or in year. So those kind of statistics can also be generated. Generally, when you talk about AI voice RX, so when you are doing the transcription, so it's just a textual transcription. The MIS is not associated with that. But in our AI voice RX, the MIS is also associated. It also get to know the ICD code. So it automatically fetch the ICD codes as well from your transcription. Doctor need not to tell the ICD code. It will automatically fetch from the database. And although all the integration I've already told you, I'll go to the next slide quickly. So these are the benefit of the AI integration. I have focused a bit on the AI integration. So the machine learning part is also there. So our AI also learns from the lot of users input, and based on that it can give the output to the next user. And we also have the predictive analysis, intelligent board, and we also have the lead processing. So there are a lot of leads which a hospital get in the day-to-day run, and we missed out on the lot of leads. So the system is intelligent enough to tell you and follow up automatically with the patients as well. And in the engagement part also, AI is very helpful. Based on the diagnosis, based on the surgery advice, it can also send the educational content automatically. So if we have the educational content for a particular diagnosis, suppose we have educational content for cataract, so system will send an educational video for the cataract to the patient automatically. And if we have a language preference set in the system, so it can send according to the language preference as well. So it engages the patient, patient feels happy, patient feels educated, and they are more interested in the hospital after that. And then we have a BI tools. So BI tool is a kind of a very advanced MIS where you can specify what kind of data you want to pull out from the system. You can specify the criterias, you can specify the columns which you want to have in the report, and the BI tool can generate those kind of report. So some of the example of BI tools are like a Power BI or those kind of things you must have seen. And the real-time monitoring tool. So as an administrator, you have to have the dashboards where you need to know that what is going on in the hospital. So what is the turnaround time of the patient? If it is increasing, then you can deploy more manpower. So that kind of statistics can give in the real-time monitoring. So last two slides are the key modules what we have in the software. So the key modules are the front desk management system. We have the IPD system. We have the QR code based self-registration. So we also have a kiosk. It's again an intelligent kiosk where we call it easy virtual receptionist. So it can do 80% of the job of a reception or a registration desk through a kiosk. And we also have the outpatient management, doctor management, infrastructure management, because there are a lot of assets. They require a lot of maintenance. So some are the preventive maintenance, some are the breakdown maintenance. So all those maintenance can be scheduled and can be done through the system. And we also are monitoring TAT of each and every services. And then we have the OT services, EMR with the integrated digital pen, and the drawing app, because some of the doctors like to draw. So we also have a drawing app. Through that you can select the template and draw the things into the system, and then that will be linked with the EMR automatically. And if you are uploading any kind of images, so system can also give the AI analysis based on the history of the patient, and it will give you the complete analysis according to that. And we also have the HR management. So HR, I will not explain all the things, whatever you can generate the payrolls, maintain the attendance, onboarding, and every documentations is there in the HR. We have a very advanced purchase and inventory and supply chain management. So we are maintaining the reorder levels, all the supply chain process is paperless in our system. So the requisitions, issue, and even the vendor linking is also there in our system. And we are also maintaining consignment stocks and inventory stocking and everything. And then we have a very advanced module called the lead management. So it's an advanced version of CRM. So all the leads can be managed through that. And then we have a doctor schedule management, referral management and loyalty program, financial advisor and counselor management, camp and outreach program. So hospitals do a lot of camps. So those camps can be managed, and sometimes we do those camps in a remotest area. So if you're doing in a remote area, there's a problem of network. So how we do it? So sometimes we note it down on paper or something. So we have a hybrid app, so which can work in offline mode as well. You can just collect all the data, and when you have the internet connected, it will sync to the server. So you're collecting all the data, and later on we can also have the conversion. So what is the conversion of the camp? So all those things we can have. And last slide, we also have the online appointment program with the optional payment gateway integration, AI voice RX, hospital maintenance, digital signage solution, laboratory management system, RIS, optical shop, medical store, corporate medical TPA billing. So all those things are there. And feedback management system, integrated MIS with leadership dashboards and user management where the user rights can be stored. So that's it from the presentation. I'll just keep it short. If you have any question and if you want to have a detailed demonstration, so you can very well get in touch with us. You can note down our digits as well. Thank you.
Thank you, Kunal Agarwalji. I would like to request Mr. Pavan Kumar Raikar to kindly give a small memento as a token of our love and appreciation. Next, we have Shri Ashish Paule, Associate Director from HealthPlix EMR.
So good evening all. I am Ashish Paule. I am Associate Director in HealthPlix Technologies Private Limited. I am working in this organization from last 8 years. So next, all the software competitor shows you the same thing. So I will not go with that flow. I'll just tell you some things about the software. तो हमारे सॉफ्टवेयर में हम हमारे सॉफ्टवेयर को क्विक सॉफ्टवेयर बोलते हैं क्योंकि हम हमारे सॉफ्टवेयर से यू कैन क्रिएट प्रिस्क्रिप्शन इन 30 seconds एंड डिस्चार्ज समरी इन जस्ट 1 minute. हमारे सॉफ्टवेयर में हम किसी से भी इंटीग्रेटेड नहीं है. वी हैव ऑल द थिंग्स इन हाउस. OPD, IPD, lab, pharmacy, all the things are created by our own self. We have our presence in 23 states, 374 cities, and 36 lakhs prescriptions created in our platform in last 30 days. We have total 16 specialty hospital software for all these specialties. Also, you can generate the prescription in 14 regional languages. We are ABDM, NABH, RSSDI, HIPAA, and ISO certified software. So we are selling trust to you guys. Next. So this is already covered by the in last sessions. So next. So we are proven scale as we are proven scale as 1.5 lakhs prescription generated daily, 10K clinic and hospital users nationwide. We build the software for the doctors, workflow efficiency, AI power capabilities, and all the things are already cleared. Please go ahead. Thanks. If you want detailed demo, please visit to our store.
Thank you so much, Shri Ashish Paule. Requesting Ms. Divya Walke to present a small token of appreciation. Thank you. I now call upon the last presentation for the day, ICA Care, Mr. Sam Dennis.
everyone. I'm from ECACare. I'm Sam Dennis. I lead the ABDM program along with government projects. So just wanted to show a brief live demonstration of our tool. Just waiting for the setup to be done. Meanwhile, I would like to ask if, so we wanted to demonstrate our scribe capabilities. If there is a doctor who would like to volunteer to interact with our system. Anyone? Okay. Okay, no worries. I'll do the demonstration along with my colleague here. So this is our tool. So we'll start with the registration process where we are completely ABDM enabled. We are one of the first integrators with ABDM. And here so based on mobile number search, you were able to fetch all the ABA number linked addresses. So to that particular mobile number. And now the OTP is initiated. Sham, skip to. Use your existing patient, yeah. And on opening up, we have our prescription pad, which is one of our key and stalwart products, which is very detailed. We are able to offer you detailed templates where you can set up for each of your diagnoses, for each of your symptoms, you're able to set up templates. Go to your prescription pad, please. Yeah, so we'll just briefly demonstrate our scribe capability. I'll have a conversation with my colleague. We will be role-playing a doctor and a patient, and we'll show you how the data gets captured. Yes, please, can you? Hi, could you please tell me your name and what issue you're having?
Hey, I'm Shyamjit. I'm having fever for last 3 days. I'm having cough and feeling very tired.
Okay. How long has it been going on, and what are the did you have anything cold? Did you eat anything? What was the issue?
No, it's been 3 days. I have taken Dolo as well last day. That's feeling very tired and fatigue.
Okay, so I believe it could be a cause of the seasonal change. I would recommend that you go on to use Dolo 650 along with the cetirizine for the next 3 days. Follow up after 5 days. So after this is done, we will proceed to get a transcript along with the prescription structured in the structured exactly how a prescription pad should be. So you will get your patient's demographics, the medical history that is getting captured, treatment plan, diagnosis, symptoms, all within a structure. And you can just copy this and add this to your prescription pad within the EMR tool, where everything gets structured, and you can also print it right from here. The capabilities are there where you can print it within the language that the patient wants as well. So this is one of the key capabilities. We also have the rest of the EMR and HMIS capabilities that most solutions offer, such as IPD, OPD. We are also HIPAA, ABDM compliant. So outside of that, we wanted to demonstrate some of the key capabilities that we have. So thank you. Thank you very much.
Thank you, Mr. Sam Dennis. That was a real quick presentation. I now invite Ms. Divya. efforts of all the teams in showcasing their platform and sharing their experiences. I would like to inform all the participants once again that the HMIS providers have set up their stalls. Those who wish to have more detailed interactions or explore the solutions are encouraged to visit the stalls. We request everyone to make use of this opportunity to engage with the providers and understand the available digital health solutions in greater detail. You can also adopt them to make Goa digital. As we come to the close of this inaugural event, it is very important that we take a moment to express our sincere gratitude to all who have contributed in making today's event such a success. To help us do this, I'd like to invite Ms. Divya Walke from ABDM team to kindly deliver the thanks.
Gentlemen in the mix.
Of Directorate of Health Services and Ayushman Bharat Digital Mission Goa, I extend our heartfelt gratitude to our chief guest, Health Minister Goa, Shri Vishwajit Rani ji, for his presence. We are deeply grateful to Dr. Sunil Kumar Banwal, IS Executive Officer, National Health Authority, for sharing the national vision of the Ayushman Bharat and for reinforcing the importance of collaborative efforts between the center and the state in creating a truly integrated digital health application. Sincere appreciation goes to Shri Yatindra IAS, Government of State, whose guidance and steadfast support has been instrumental in driving the implementation of in Goa. Our sincere appreciation also goes to Dr. Pankaj Kumar Arora, Director NHA, and Dr. Piyush Singla, Director NHA, for their valuable directions to our journey ahead. I would also like to thank our regional coordinator team, Goa, Shri Arun Kumar, and Mr. Anand Joshi, Network Operations Team Lead, for their insightful presentation. Special thanks to teams from STEC and NEET for their insightful presentation and practical demonstrations. A special note of appreciation to our HMIS partners, Tirupati HMIS, ICA Care, Mark ERP Software, Easy Solutions, and Plix EMR for showcasing their innovative digital solutions that will play a vital role in accelerating ABDM adoption across healthcare facilities. My sincere thanks to all the representatives from government departments, healthcare institutions, private hospitals, clinics, professional bodies, and every participant present here today. Your enthusiastic participation and valuable discussion have made this workshop a truly meaningful. I sincerely acknowledge the efforts of our ABDM Goa team, the Directorate of Health Services, for our organizing committee, our technical team, volunteers, venue staff, and every individual who have contributed tirelessly to making today's program a big success. As we leave this hall today, let us all remember that digital health is not merely about technology. It is about improving lives, strengthening trust, and ensuring that every citizen receives seamless, secure, and quality healthcare. Today, let us transform today's discussion into tomorrow's achievement and make North Goa as a model that inspires the rest of the country. Thank you, everyone. I now request everyone to kindly rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you.
Thank you, everyone. We have high tea arranged outside the venue, so you all could please have high tea. Thank you.